Welcome to MEDICINA Corto Film Fest 2022, also known as MEDICOFF. So this year's theme is medical education and health promotion through short films. So first of all, we have the organizing secretary MEDICOFF 2022, Dr. Rohit S. for a welcome speech.
Good morning, one and all. This is Dr. Rohit S., the organizing secretary of MEDICOFF MEDICINA Corto Film Fest 2022. It gives me an immense pleasure in welcoming our respected director Dr. Rakesh Agarwal, respected Dean Academic Dr. Pankaj Kundra, respected head of Department of Medical Education Dr. Saya Prakash Rajan, and our respected head of NTTC Alumni Association Dr. Kadambari, and our external juries Mr. Nagavarman, a short film director, and Mr. Muttamil from electronic media from Puducherry University, and other NTTC members and other student as well as the resident coordinators, and my dear fellow committee members of MEDICOFF, viewers and participants online for this first MEDICINA Corto Film Fest JIPMER 2022. This MEDICOFF serves as a bridge in linking your medicine knowledge with the population through short films. It provides a platform to showcase your talent that reaches a large number of population in a quick time. We are very much delighted in receiving more than 40 entries for this first MEDICOFF. I would like to see more entries in future. I hope you will enjoy this MEDICOFF, and it's the time for lights, camera and action.
Thank you, sir, for that wonderful welcome address. I now request the NTTC Alumni Association President, Dr. Kadambari, to share a few words with the audience.
A good day to all viewers of MEDICOFF, and welcome to this program, which is being jointly conducted by the NTTC Alumni Association and Department of Medical Education, JIPMER. First of all, I would like to congratulate Dr. Jayaprakash Rajan, Head of the Department of Medical Education, JIPMER, for his untiring efforts to see that this program is publicized and encouraged, and also seeing that it is accomplished. An impressive 45 entries have been submitted to this competition, and participants range from undergraduates to residents to faculty. I have seen some of these videos myself, and I must say that the quality is remarkable. It's going to be a difficult task for the judges to decide who are the winners. But of course, winning is not all. It is the participation and doing the job well that matters more. So I would like to congratulate all the participants for their efforts and the time that they have put in preparing these videos. And the messages are so relevant, whether it's towards education or towards patient education. The messages are very clear and very relevant. So I hope all of you enjoy these videos, and I welcome all of you to participate in subsequent such programs as well. Thank you.
Thank you for your valuable message, ma'am. Now, I would like to invite the Head of the Department of Medical Education, Dr. Saya Prakash Rajan, to share his views on MEDICOFF.
Ladies and gentlemen, it gives me great pleasure to welcome everyone to the first educational film festival organized by the Department of Medical Education in association with NTTC Alumni Association of JIPMER and JIPMER Resident Doctors Association. This short film fest, the MEDICINA Corto Film Fest, is shortly named as MEDICOFF, and the major theme for this first edition is medical education and health promotion through short films. Because of its audiovisual capabilities, the media has shown to be beneficial in every field of life. Cinema has been recognized for its educational value in addition to its entertainment value. Non-traditional educational methods, such as the use of short films in education, have been increasingly popular in recent years. In its latest guidelines for adopting competency-based medical education, the National Medical Commission of India recommended the use of short films and videos in teaching medical concepts. Trigger films, movie clips, full-length films and television shows have all been shown to be useful in teaching medical topics. All health science specialties, including medical, nursing, physiotherapy, dentistry and Ayush, can use short films for both undergraduate and postgraduate teaching, as well as for training the resident doctors. Learning through media can be a life-transforming experience provided if the media is developed keeping in mind the learners and the learning goals. Combining the state-of-the-art filmmaking technology with our extensive medical knowledge will lead to the creation of outstanding films for medical education and to inform recent advances in preventive, promotive, curative and rehabilitative aspects of health. The main objectives of this short film is to sensitize the stakeholders in medical education about the educational use of short films in teaching and learning medical concepts, to provide opportunity for students, residents and faculty to showcase their talents in creating educational short movies, to develop an educational culture of fostering creativity in medical education and health promotion. The short films of this virtual event cover a wide range of styles and topics, each with its own takeaway message. We received a positive response with 46 entries from medical colleges across the country taking part in the first edition of MEDICOFF, which will be represented on screen. Such opportunities, in my opinion, will encourage students and teachers to think creatively and develop new resources for medical education. I congratulate the contestants on their efforts and enthusiasm for creating their short films, and I wish them all the best in their endeavors. I would like to express my heartfelt gratitude to our respected Director Dr. Rakesh Agarwal, our respected Dean Academic Dr. Pankaj Kundra, the respected President of the NTTC Alumni Association and Professor and Head of Surgery Dr. Kadambari, my dear postgraduate resident Dr. Rohit from the Department of Biochemistry and his team, and the staff members of the Department of Medical Education for their help and encouragement in putting this event together. Thank you all.
Thank you so much for your valuable words, sir. So now next up on stage, I would like to call Dean Academics Dr. Pankaj Kundra to share his valuable thoughts.
My dear faculty, residents and students, good morning. It gives me immense pleasure to welcome the delegates to the first short film festival aimed at promoting medical education and health through short films. I am happy to learn that there is a good response to this innovative initiative by the Department of Medical Education in association with the JIPMER Resident Doctors Association and NTTC Alumni Association of JIPMER. I hope the entries will have a unique message to all the stakeholders of medical education. I congratulate the organizers for this initiative, which provides an opportunity to use short films to explore and learn medical concepts meaningfully. My advance congratulations to the winning team and appreciation to all the participating teams. Thank you. All the best. Jai Hind.
Thank you, sir, for your valuable message. I now request the Director of JIPMER, Dr. Rakesh Agarwal, to give the inaugural address.
Professor Jaiprakash Rajan, members of the JIPMER faculty, participants in the film festival, ladies and gentlemen, good morning. It gives me immense pleasure to inaugurate this first edition of the MEDICINA Corto Film Festival, also abbreviated as MEDICOFF 2022, which is a 2-day festival of short films. This festival, aimed at promoting medical education and health education through the use of short films, is a collaborative venture of the Department of Medical Education, the Resident Doctors Association and Alumni Association of the National Teachers Training Center or NTTC at JIPMER. The idea of this festival is to bring together the art of filmmaking and the science of medicine to make it easier to teach and learn medical concepts. This festival is supposed to provide medical teachers a platform to showcase their creative skills, their creative talent in using today's technology, audiovisual technology, where we can stimulate multiple senses in students for teaching and inspiring their students more effectively. I have been told that the festival has already received a large number of entries from teachers as well as students at several prestigious institutions around the country. I am also given to understand that many of these films have used very innovative approaches that should make medical education, medical teaching a fun both for the teachers and the students, and should allow for easier and more effective transmission of medical concepts, medical knowledge from the teachers to the taught. In short, I can say this festival, this fest promises to be a feast for your eyes. Though this festival is meant to be competitive, I think what is most important is participation and not winning. If the films at the festival can promote greater and more effective use of technology, leading to more effective teaching and learning environment, all of us, I mean all of us in the medical teaching community, would be the winners. Let me end by wishing the MEDICOFF 2022 all success and congratulating the organizing committee as well as the participants who have made films and submitted these for competition, because all of them have put in a lot of hard work, and without their hard work this festival would not have been a success. Let me stop here and let you enjoy the films. Thank you. Bye bye.
Thank you so much for your valuable words, sir.
The films in MEDICOFF 2022 are divided into 3 categories. The first category is the long short films, which range from 5 to 15 minutes. The next category is the super short films, which range from 1 to 5 minutes. And the last category is the micro short films, which are less than 1 minute long.
To start off first with the category of long short movie, we have first coming up Kidneys, The Beautiful Couple by Sri Ramachandra Institute of Higher Education and Research.
ரெகுலரா வாக்கிங் போறது, எக்ஸசைஸ் பண்றது, அந்த மாதிரி செய்யும் போது ஒரு சில பிரச்சனைகள் வராம தடுக்கலாம். பிபி, சுகர், அந்த மாதிரி லைஃப் ஸ்டைல் மாடிஃபிகேஷன் பண்ணும்போது கிட்னி பிரச்சனையை நம்மளால தடுக்க முடியும். இல்லைங்களா? கிட்னி ப்ராப்ளம் எப்படி இருக்கா இல்லையா அப்படின்னு கண்டுபிடிக்கிறது சம்டைம்ஸ் நமக்கு தெரியும். யூரின் குறைச்சி போறது, வீக்கமா இருக்கிறது, வயிறு வலி வருது, அந்த மாதிரி ஒரு சில வாமிட்டிங் வருது, அந்த யூரியாங்கிறது அதிகமாயிடுச்சுன்னா வரலாம். பட் சில நேரங்கள்ல வெயிட் சரியா ஏற மாட்டேங்கிறாங்க, சின்ன குழந்தைங்க வீக்கேர்ல வளர்ச்சி இல்லை, யூரின் அடிக்கடி போயிட்டே இருக்காங்க. அந்த மாதிரி ஒரு சில ப்ராப்ளம்ஸ் இருந்தாலையும் நம்ம அது அந்த பாக்குற குழந்தைங்க டாக்டர் கிட்ட அட்டென்ஷன் கொண்டு அதை நம்ம பார்க்கணும் என்ன இருக்கு அப்படிங்கிறது. ப்ராப்ளம்ஸ் குழந்தை வைத்தது கொண்டே கண்டுபிடிக்க முடியுமா அப்படின்னா எஸ். இப்ப என்ன மினிமம் ஒரு ஸ்கேன் பண்றோம். பிரெக்னன்சி இல்லை. ஆனா ஒரு சில பிரச்சனைகள்லாம் நமக்கு தெரிஞ்சிருக்கும். ஓகே, அதை வந்து நம்ம ஃபாலோ பண்ணிக்கிறது ஈஸியா இருக்கும். அதாவது ஒரு சிலருக்கு வந்து கிரியேட்டிவ் இப்போ நிறைய ஆயிடுச்சுன்னா நமக்கு நிஜமாக ட்ரீட்மெண்ட் இல்லை. பட் கொஞ்சமா அதாவது அது கொஞ்சம் அதிகமாகுதுங்கிற பட்சத்துக்கு நம்ம கிட்ட ஒரு சில ட்ரீட்மெண்ட் இருக்கு. அதனால அதை வந்து நம்ம மிஸ் பண்ணிக்கலாம். இப்போ வந்து இருக்காங்கல்ல, ரொம்ப வீக்கெல்லாம் வந்துருச்சு, நம்ம பாடியில இருந்து எப்படி வந்து அந்த தண்ணி எல்லாம் ரிமூவ் பண்ணுவோம்னா அது வந்து டயாலிசிஸ். இப்போ கேள்விப்பட்டிருக்கீங்களா? நான் யாருமே ஆன்சருக்கு சொல்லலை. டயாலிசிஸ் அப்படிங்கிறது தான் அதுக்கான ட்ரீட்மெண்ட். ஓகே, அதுல வந்து ஒரு சில டைப்ஸ் இருக்கு. மெஷின் வச்சு டயாலிசிஸ் பண்றது, வலிமையே டியூப் போட்டு டயாலிசிஸ் பண்றது. மெஷின் வச்சுன்னா பிளட் வந்து அந்த மெஷினுக்கு போய் அங்க வந்து ஒரு ஆர்டிபிஷியல் கிட்னி அப்படிங்கிறது இருக்கும். அதுல போயிட்டு சுத்திகரிக்கப்பட்டு திரும்ப பேஷண்டோட வந்து வரும். ஒரு சிலர் வந்து ரொம்ப ஊர்ல ரொம்ப ரிமோட் வில்லேஜ் வராங்க, அவங்களால அந்த சென்டர்லாம் வந்து போக முடியலன்னா வயலே வந்து ஒரு சின்ன லேப்ரோஸ்கோபி வழியா ஒரு டியூப் இன்சர்ட் பண்ணிப்போம். நாங்க வந்து சொல்லி கொடுப்போம் எப்படி பண்றது அப்படின்னு சொல்லி அதை அவங்களே பண்ணிப்பாங்க. இப்போ நம்ம வந்து கிட்னி பிரச்சனையை பற்றி உங்ககிட்ட கேட்கும்போது அதை பற்றி உங்களுக்கு தெரிஞ்சிருக்க வாய்ப்பு இருக்கா? இல்லை இப்போ இந்த குழந்தைக்கு வந்திருக்கிறதுனால தான் உங்களுக்கு இந்த ப்ராப்ளம் பற்றி தெரியுதா? இல்லை முன்னாடியே உங்களுக்கு வந்து தெரிஞ்சிருந்தது இந்த ப்ராப்ளம் இருக்குது அப்படிங்கிறது தெரிஞ்சிருந்ததுன்னா நல்லா இருந்திருக்கும் அப்படின்னு நீங்கள் நினைக்கிறீங்களா? என்ன நினைக்கிறீங்க?
முன்னாடி தெரிஞ்சது நல்லா திடீர்னு தான் வந்தது, தெரியாது. அது ரெஸ்பாண்ட் பண்ணாங்க. ஈவினிங் வரும்போது முகம் கையில் ஃபுல்லாக விழுந்துச்சு. 10 நாள் முன்னாடியே அவங்க சரியாக சாப்பிட்டு கீழே உட்காந்து இப்படியே இருப்பாங்க, வலி இருந்தாங்க. ஒரு 10 நாளாக சொல்லியிருந்தாங்க. எங்களுக்கு புரியல. ராமச்சந்திரன் நல்லா பார்க்குறாங்க, வீடுலாம் நல்லா போகிறாங்க.
இந்த யூரினரி பிளாடர்ங்கிறதுல ஸ்டோர் ஆகும். அதுல வந்து இந்த 2 சைடும் மைண்டா வீக்கா இருக்கு அப்படிங்கிற மாதிரி கொடுத்துருக்காங்க. கிட்னிஸ் எங்க இருக்கு?
ஸ்டமக்.
தொட்டு காமி.
The kidneys are located in the back on either sides of the spine.
கிட்னிஸ் வந்து ஸ்டமக்குக்கு பின்னாடி சைடில், அதாவது தண்டுவடத்தோட 2 பகுதியிலையும் வந்து இருக்கும். கிட்னியோட ஷேப் என்ன?
Bean shape.
வெரி குட். எத்தனை கிட்னிஸ் இருக்கு நமக்கு?
2.
வெரி குட். இது என்னது? ஓகே, இது என்ன ஷேப்ல இருக்கு? வெரி குட். இது என்ன சொல்லியிருக்காங்க சொல்லி பார்க்கலாம். ஓகே, வெரி குட்.
Keep fit and
stay active. ஓகே ஓகே. என்ன?
adequate sleep.
நம்ம தூங்குறோமா கரெக்டா? என்ன பாப்பா, நிறைய நேரம் ஃபோன் பாப்பியா? டிவிலாம் பாப்பியா? யூடியூப்ல ரைம்ஸ் வீடியோலாம் பாப்பியா? சரி, ஓகே. நல்லா தூங்குவியா? கரெக்டா எவ்வளோ ஹவர்ஸ் தூங்குவ ஒரு நாளைக்கு?
8 hours.
இது வந்து இப்போ குழந்தை பிறந்ததுக்கு அப்புறம் ஜென்ரலா கிட்னிஸ் ஹெல்த் இதெல்லாம் நம்ம நல்லா பார்த்துக்கணும் அப்படின்னா என்ன உங்க மைண்ட்ல இருக்கு?
ஜஸ்ட் பேசிக்காக வந்து 6 months அந்த பிரஸ்ட் மில்கோட இது கொடுத்தாவே நம்ம மேக்ஸிமம் வந்து எல்லா ப்ராப்ளம்ஸும் ரெக்டிஃபை ஆகிடும்.
வேற ஏதாவது குழந்தைய மட்டும் விட்டுருங்க. மற்ற இதுலலாம் கூட வந்து இப்போ இதெல்லாம் பண்ணா இது கிட்னி கொஞ்சம் ரிஸ்க் அந்த மாதிரிலாம் உங்களுக்கு
ஜெனரிக்கா நார்மலா வாட் தி ஃபீல் இஸ் நம்ம பிளாக்ல பார்க்கிறது தான். ட்ரிங்க் plenty of water. Water intake will actually purify the kidney much.
ஜென்ரலாவே பார்த்தோன்னா இப்போ நம்மளோட பேரண்ட்ஸ் இருந்ததுக்கும் இப்போ நம்மளோட லைஃப் ஸ்டைலும் நிறைய வேரியேஷன் இருக்கு. அதனால வந்து அப்போல்லாம் வந்து 50 இயர்ஸ்ல வந்து பிபி சுகர் வருதுன்னா இப்போ நம்ம 30 இயர்ஸ்லேயே பார்க்கறதுனால ஒரு மாஸ்டர் ஹெல்த் செக்அப் அப்படிங்கிறது வந்து நம்ம பண்ணிக்கிறது வந்து ரொம்ப நல்லது தான். பிகாஸ் நமக்கு சில டைம்ல வந்து கிட்னி டிசீசஸ் வந்து அந்த எண்டில் தான் தெரியுதுன்றதுனால நம்ம ரெகுலராகவே வந்து அதை கிரியாட்டினின் அப்படிங்கிற செக் பண்ணிக்கலாம்.
Now I would request the judges to share their views.
Kidney is the beautiful couple. The video was really informative, but it was like a documentary style of movie.
Yes, it was more of like looked like an instructional video.
Yeah.
But it was lot of information was there, so we were interacting with the students and with the patients. So those things were there.
Yeah.
But little bit I liked. I didn't like that stencil kind of
on those slides
they used. Okay.
Yeah, it would be better if they have made a story out of it. Yeah. That will be better.
But it was informative.
Yeah, good work it is. Okay.
Next up on the screen we have Medication Error, Brand Name Confusion by Karwar Institute of Medical Sciences, Karwar, Karnataka.
Title: Medication Error, Brand Name Confusion. Disclaimer: Story contains imaginary characters and content not related to any real life incidents. It is a medical educational movie for MEDICOFF 22 by Dr. Harish Naik, Department of Pharmacology, Karwar Institute of Medical Sciences, Karwar, Karnataka. Scene 1: Dr. Rohit and his friend Vishal in living room.
I had gone to get together yesterday. My friends, engineering college batchmates had turned up here. We had gone to spa resort. Food was good. I had nicely. But then from morning, stomach is paining, and also have little bit nausea. Yesterday was all good, but today, I am screwed up, and I have lot of work. You know, work from home thing. Okay. Doc, what meds should I take? You prescribed something for me.
Okay. I feel you are suffering from gastritis, acidity. I will prescribe you a medicine. Get it from drugstore. And take it 30 minutes before breakfast. I mean empty stomach. Once daily you take it for 5 days. You will be fine in 2 days. You will be ready for your with from home adventure. Okay, I got to go. I will see you later. Take care.
Scene 2: Dr. Rohit and Vishal's father in the elevator.
Hi uncle. Good afternoon. How are you?
I am good. How's everything?
Fine uncle. I was out of town. My cousin's marriage. Came today only. How is Vishal?
He is better, but still has stomach pain. Today is the 3rd day.
Okay, I had prescribed him medication. Is he taking the medicines? If so, he should have been alright.
Yes, he is taking the medicine. I had told him to call you and consult.
He did not call me. Uncle.
Oh, okay.
I had prescribed him Pipizole 40 milligrams. It contains pantoprazole, acid-reducing medicines. That should have made him fine by now.
Wait, what? I saw these tablets on his table, which he said has been taking. But it's not 40 milligrams. I saw it was 400 milligrams. If I am not mistaken.
Uncle, how can that be possible? Please go and have a look at the medicines he is taking. And inform me.
Okay, I will do that right away.
Scene 3: Vishal and his father in the living room.
How are you feeling, Vishal?
Still have stomach pain. Dad, I will call Dr. Rohit and consult him again.
I met him in the lift. He just reached. He told me he had prescribed medicine for you.
Yes, Dad, I am taking the medicine since 3 days. But not much improvement.
Show me those medicines.
Why, Dad? What happened?
Dr. Rohit told me that he had prescribed Pipizole 40 milligrams. But I saw on your table those tablets. It had printed 400 milligrams. Go and get that medicine. Let me check it.
Okay, I went to the medical store and showed the prescription. And got those medicines.
Vishal goes to his room, checks the medicines and comes back.
I checked it now. They are different. Rohit had prescribed me Pipizole 40 milligrams. But in the medical store, they had given me Didizole 400 milligrams. Which I have been taking. And it's not pantoprazole, it's albendazole, some other drug. Both the brand names are so similar. One is Pipizole and other which I am taking since 2 days is Didizole.
How can you be so ignorant? You have to cross-check the medicines which has been given. You are taking some other drugs. That's why your symptoms have not reduced. Don't take it. Let me talk to Dr. Rohit.
Scene 4. Vishal's father and Dr. Rohit. At doctor's home.
Vishal has been taking some other medicines.
Why? How can that be possible? I am sure I have written the correct medicines.
Yes, you had prescribed pipizole 40 milligrams. But he had been taking didizole 400 milligrams, which is albendazole, as mentioned on the tablet.
Albendazole is an anthelmintic medicine, but why is he taking that? I have not prescribed that.
Vishal went to the medical store and showed the prescription, and got that medicines.
Oh my god, these brand names, which look like, and sometimes sound alike, are creating confusion, resulting in medication error. Uncle, I am sorry. In this case, I feel all three of us, that is, me, pharmacist, and Vishal, to be blamed. Vishal, being literate, he should have checked it, and should have brought to the notice of the pharmacist. And it's always better to tell the symptoms. That is what we are going through, to the pharmacist.
Yes, I scolded him and gave the same advice.
The role of pharmacist as a clinical or community pharmacist should be very much stressed. They should have knowledge of the commonly used drugs and doses, and should develop a habit of inquiring about the symptoms of the patients before dispensing medicines. In case of doubt, they should never hesitate to call the prescribing doctor. And manufacturers also should do thorough check of the brand names before finalizing the name for their product. And any report regarding confusing brand name, it should be taken seriously, and product should be renamed.
Yes, Rohit, regulating authorities should be very strict in this matter. They should take stringent action against the defaulter.
Yes, uncle. I will talk to the concerned medical representative of the company and share my concern and also this experience. And will also write to the concerned authorities, as confusing brand names are more likely to produce medication errors. And uncle, what I have learned today is, it is always necessary to write the generic name along with the brand names. And uncle, I promise, I'll follow it.
Yes. You should do this. Take this matter forward so that it should not happen to other patients. At least, in this case, we were able to identify the problem, and nothing serious happened.
Yes, uncle, tell Vishal to stop the albendazole and start pantoprazole. I will write another prescription with both generic and brand name.
Yes, I will inform him, and we will be there as you need any cooperation from our side about this case. And also I will write to the concerned authorities. Thank you, doctor. Good day.
Good day, uncle.
Summary. Confusing brand names are here to stay. But if the doctor, pharmacist, and patients become more cautious and attentive, medication errors due to confusing brand name drugs can be minimized. Thank you.
Now, I would request the judges to share their views.
Medication error. It was really a good attempt, informative and all. But it was a major issue which should be addressed.
Yes.
Into the current situation. No? There are lots of medicines, but people are not going to.
They used to get confused for the normal public, no? So when they go to the drugstore, so these problems, so they have addressed with really a
nice problem.
Okay, which is currently a lot of people used to face this kind of thing. Well made also. So particularly normally when short films, people used to make this kind of normal videos using real characters. But they have tried, they have created animated
and
characters.
That was a good try.
Animation also was there. Okay, so the design, whatever the characters they have designed. Okay, so these things were good. Well made one.
But for me, these kinds of story need not to be animated.
Yeah.
Maybe it can. It has only three characters. It's surrounded by
a boy and two doctor.
That's it. So it can be short. Maybe mostly animations are done for stories which cannot be shot in real life.
Yeah.
Which has an large scale value in it.
Yes, true.
But still, it's a nice work. Nice work. Yeah.
Good.
Next on the screen we have PBL Orientation Role Play by AIMST University, Kedah, Malaysia.
we will have Prof. Rajesh, Dr. Bharati, Ms. Rami, and Dr. Ethu as our students, and I'll be the facilitator. We will simulate the trigger 1 here. You guys observe how the process happens. Then for trigger 2, we'll break into breakout rooms, all right, where you guys will try it out yourself, see whether you get the hang of it. All right, then we all come back to the main page for further discussions and Q&A sessions. All right, are our students ready?
Yeah.
Okay.
Ready.
All
Sir,
right.
I'm here. Mark my attendance, please.
Yes.
How many
All right.
marks will I get, Prof, for this session?
So usually I don't come for class, sir. So at least now note me, because I am not sure I'll attend other PPLs. So please mark my attendance.
I will keep an eye. Okay.
What if the next PPL I join 20 minutes late? Will you give me attendance?
No. That defeats the entire purpose if you join late. Where's Miss Ramya?
Yeah, I'm here.
She is the rep. So, Miss Ramya.
Oh, you're Ramya is the leader?
Yes, Ramya is the leader. Ramya, pick your
scribe. Who's a scribe?
Yeah,
Okay.
So maybe for today's session, I will choose Dr. Bharati as scribe.
Okay.
Okay, so we can start the session. So any of my group mates want to read the trigger?
Okay, I will read.
Yeah, sure.
Okay. Etatia omne.
Okay, thank you. So we have our trigger. So maybe we can start discussing the cues first and then go to the learning needs.
Yes.
It's open.
Yes. 30-year-old. That's what I think Dr. A's thing is. Why 30-year-old? Huh?
Yeah. 30-year-old. Male patient. Patient is male.
Is there significance in that? So we need to probably check into that, I guess.
Why is it always male?
Dr. Parthi, can you please tell us
What is a low-grade fever?
Low-grade fever
means
what?
Again, it defeats the purpose if I give the answer. You can ask your fellow colleagues, backgroup mates, if anybody is able to give an answer. If no, you can always put it into your learning needs, go back and find about it. Okay? So
maybe it means less fever or something, not very high.
Yes.
Maybe, I don't know, we look
no
up.
high temperature, maybe.
Yeah.
No high temperature. And then it is only evening.
That's interesting. I wonder why only evening.
Yeah, I always actually, whenever I go to get my MC, I say my fever is in the morning. It's sort of very sad. Huh?
Yeah.
After fever is after work, after class is over. Yeah?
Evening.
But why they say? But usually when we get sick, we feel more sick in the evening, right? I mean, is it like that or what? Or is it something different?
No wonder all the doctors' clinic, they flourish 5 to 9. Huh? Anyway,
But
we'll
why? But why evening?
Yeah, that's right.
Dr. Parthi, can we use a handphone? Can we check on Google?
You can find for information now if we are discussing. Of course, you can do that. See if we can contribute or give any answers. But make sure
Wikipedia allowed?
No, make sure the website you're finding is a proper medical database website. Right? You can't use Wikipedia. So if you're sharing an information, please tell from where did you get the information from.
I just saw normal fever. So I don't think there's any normal fever, right? Fever
itself is abnormal. Then how can it be normal?
Yeah, so
something is wrong.
Cannot trust that site. Yeah, agree. Okay.
Dr. Parthiban, can we just copy from the PowerPoint yesterday's lecture?
No. You can't copy from the PowerPoint from the lecture. You are supposed to put it in your own words, and most importantly, you have to understand what you're putting there.
What was the lecture? yesterday, which you are going to copy?
Was it physio?
Come to class.
So no, but which lecture you suggested you can copy from somewhere. So now I'm thinking the answers are. Tell me, because when I go to the LMS, there are 500 lectures there, So you have to tell me
Which one?
lecture.
Yeah, exactly. Then it'll be easy for us. Come on, Ramya, tell us which lecture.
Yeah.
Ramya,
We
don't
can
tell which
copy.
lecture.
I'll share that maybe in the WhatsApp group.
Okay.
Yeah.
Okay. But how come we never heard of hemoptysis in the lecture before?
That's what I'm wondering.
Yeah. So weird that word is.
Yeah.
Hemoptysis. Then you brought up something, vomiting of blood. Okay, we look up.
Dr. Parthiban, can we just search why male patient, why 30-year-old? Is it okay? We just check like that?
How is it okay? Think about it.
Okay.
It can be so big, right?
Okay. So can I make a wild guess? I might be wrong, please, sir. So we have to find out what hemoptysis is, correct? So that could be a learning need.
Yeah.
Yeah.
Definition of hemoptysis or whatever hemoptysis.
What is hemoptysis?
What is hemoptysis? Yeah.
Okay, let me write it. What is
hemoptysis?
What is hemoptysis? Okay, that's the first learning need.
Yeah. And can we link whether hemoptysis is common in the 30-year-old male?
Yeah.
So should I add it as a learning need?
No, or should we look at the causes? I don't know.
Causes of hemoptysis.
Okay.
Okay.
We can find causes of hemoptysis.
Just state, list the causes.
Yeah, list the causes.
Okay. Okay.
I really hope it's only 5 or 6.
So should we
don't limit yourself
go for all the causes or
don't limit. Okay. He said don't. Not limiting.
Please do not limit yourself just because maybe some other groups have got 5 or 6. Doesn't mean that you only have to come up with 5 or 6 learning needs. Whatever that you don't understand, whatever that you need to know, put it as a learning need. If not, how are you learning? It's a learning need. You need to learn it. So yes, don't limit yourself.
But sir, my group got 5 of us, so we form 5 SLO. It will be correct.
No. It doesn't work that way. If there's more SLOs, you can always break it. Someone can volunteer to take more than one learning. Doesn't mean one person has to take one learning. For all you know, some questions, the answer is very straightforward and simple. It's probably a one-line answer. All right. And some learning needs can be a bit heavy or more information that needs to be shared. Right. So form your learning needs first, then segregate it accordingly in your group.
Dr. Parthi, my friend just texted from the other group. It seems the lecturer there listed 5 causes.
No. See, that whatever happens, that like I said, it defeats the purpose, and that should not happen. Okay?
Okay.
So do not follow that. Okay, go according to what we are planning here and discussing here. Build more learning needs.
Okay, so then after the causes, can we see
state the possible causes of cough of more than 4-week duration?
Wait, Ramya, where did you get this outcome from?
No, I just thought of it, sir.
So specifically thought of this outcome?
Yeah, it looks like an exam question.
No, I just thought, sir. Really,
I don't think so. I don't think so. You should not take from other groups, Ramya. Please form your own learning outcomes.
I think we should combine everything and look for a cause.
Yeah.
Is it okay?
Yeah, sure.
Is all okay? I'm not hearing from the 4th person.
Okay, so we look for person with hemoptysis with 4 weeks cough, who has fever. It is in the evening, and he has lost weight. We do it after we check all the other in this order 1, 2, 3.
Process of
Is the hospital staff particularly stated so that he picked up something from the hospital?
Yeah, maybe we can
Yes.
look into that. So should we include it as separate or in the?
I think separate. Yeah, separate.
So what is the outcome? Tell me.
Risk factors for hospital staff.
Risk factors.
Risk factors. Yeah. Job.
Hospitals.
Hospital.
Yeah.
For the above, what is all the cough and all that. Correct, no?
Okay. Sir, we are done. Is there anything we are missing or is it okay?
Okay, what do you think? Do you think you can ask your roommates? Do you think
I think roommates.
this covers everything?
Anything to add?
How to find out whether this fellow was treated earlier and all that? How to ask the history?
Maybe should we wait for next trigger or how, Doctor?
So what are you expecting to know more? Okay, from here, moving forward from here, what do you think do you need more? What do you want to know?
I want to know more about this disease, this history of this person.
Okay, so you feel that there might be a connection with the history.
Yeah.
Yeah, whether cough, whether he's a smoker.
Okay.
Okay.
Maybe whether he's on any treatment.
Yeah, whether he has any other disease.
Yeah, underlying conditions.
All right. Okay. So okay then, we can if we are done with this, we can move to the next design and see what we have more information for you in the next design.
Okay.
So who's finding out these things, or we decide later?
Okay,
we can decide in the
end. Okay.
Yeah. So once all your learning needs are combined, that'll be better.
And then each of you, when you if we are just finding out one learning need, that please don't just stick to it. So share the learning need in the WhatsApp group, and then so that we can read through the other person's learning need and everything. And then somebody is absent, we don't have to tell the lecturer that that person is absent. We can just like cover their portion also, and it will be better because we can learn that way. So yeah.
But the lecturer will still check your attendance. And the lecturer will know if you don't come for the class.
Suppose I find something, do I read only that? Suppose I'm assigned something, do I read only that, Dr. Parthi?
No. This learning needs, you are encouraged to read everything and know everything. What you are going to contribute or share is only the portion that you're given. That doesn't mean you just stick to them. You have to read through everything and know everything. Ultimately, again, it will all be combined. So when it's combined, you will have a proper full material that you can always keep. What you are learning today, now it's going to help you even when you're in your final year and also when you're working. So this information that is being gathered here is very important because these are real life situations and scenarios that you are going to face once you become a doctor.
Sir, what if like we all are students now, right? We are just starting this thing. So what if like, I give some wrong information or maybe like somebody else give a wrong information if I got correct information? I mean.
Yeah, that is why we have the discussion. You can always share. And this is another important reason why we want you to give the reference from where you are taking the information.
Thank you, Dr. Parthi.
Thank you, sir.
It's the best teaching session I've ever attended. The classes are so boring.
Yeah. It's so interesting. I can look at these things. I think I'm going to learn a lot of things here.
Thank you.
Thank you.
Now, I would request the judges to share their views.
PBL orientation role play. The whole mock BBL idea was nice.
Yes.
I liked it. It was more informative and it was creative also. The students and faculty pretending to be students, and that was nice.
Yeah.
Like it was example. It was comical.
But these kind of things, when you do a role play, my way of looking at it is it would have been little serious. Okay, certain things at the beginning it was little comical, so it deviated. The seriousness was not there.
In real life, it will be more serious.
More serious. Okay, so that's what I felt from this. Okay, so otherwise it's a well attempt. So,
but the thing is, it's a short film competition. No?
Yeah.
These things. Will not come under a roof of short film. It's like a documentary
kind of thing. Yeah.
Okay.
Fine.
It's fine.
Yeah.
It's a nice
good,
work.
Good work.
And next we have NDM by Trichy SRM Medical College and Hospital and Research Center.
ஹே அப்சல்யூட் புக் பண்ணிட்டியாடி 4 பேருக்கு?
எத்தனை வாட்டி கேட்ப? அப்போவே புக் பண்ணிட்டேன்டி. இது 5வது வாட்டி. போய் சாப்பிட்றோம், ஃபன் பண்ணுறோம், வந்து தின்னுட்டு தூங்குறோம்.
ஓகே சரி வா கிளாஸ்க்கு போவோம்.
சேகர் என்ன வீல் சேர்ல வந்திருக்கீங்க? 2 வாரமா இருக்கு. இன்னும் சரியாகவே எவ்வளோ நாளா இருக்கு? 2 வாரத்துக்கு மேல இருக்கு. 2 வாரமா இருக்கு. நீங்க இப்போ இவ்வளோ பெருசா இருக்கு, முன்னாடி கவனிக்கலையா? சின்னதாக இருக்கு சொல்லிட்டு விட்டுருக்கோம். பெருசாகிடுச்சு. சரியாகும். சரியாகும். நீங்க கொடுத்த எந்த மருந்து மட்டும் உடனே சாப்பிடுறது சார். இது உள்ள வலி தெரியுதா? இல்லை டாக்டர், வலி இல்லை. அப்புறம் சேகர் பழக்கம்லாம் என்ன ஆச்சு? அப்புறம் சேகர், நான் இன்னைக்கு போன வாட்டி வந்தப்போ எழுதி கொடுத்தேனே, சாப்பிட்றதுக்கு லிஸ்ட்லாம் எழுதி கொடுத்தேன், இதெல்லாம் சாப்பிடணும் இதெல்லாம் சாப்பிடக்கூடாதுன்னு. அதெல்லாம் கரெக்டாக ஃபாலோ பண்ணுறீங்களா?
இப்போ சார் அன்னைக்கு நீங்கள் சொன்ன அன்னைக்கு 2 நாள் நான் கொடுத்தேன் சார். அதுவும் சாப்பிட்றது இப்போ வந்து ஃபுல்லாக ஃப்ரெண்ட்ஸ் கூட வெளில பரோட்டா சிக்கன் ஏதோ ஒன்று சாப்பிட்டு தான் சார் இருக்கேன். எதுவுமே ஃபாலோ பண்ணுறதில்ல, மாட்டு சாப்பிட்றதில்ல, குடி பழக்கம் விடல சார்.
இப்படி போனால் எப்படி சேகர்? சுகர்லாம் கண்ட்ரோலில் வச்சுக்கணும்ல. வேற ஏதாவது தொந்தரவு இருக்கா? கண்ணு வந்து மங்களா தெரியுதுன்னா எவ்வளோ நாளா அப்படி இருக்கு? கொஞ்ச நாளாக அப்படி இருக்கு. அதனால வேலைக்கு போகவே கஷ்டமா இருக்கு. சரி, நான் உங்களுக்கு கண்டக்டருக்கு எழுதி கொடுக்குறேன், சரியா? அங்கே போய் காமிச்சிட்டு வாங்க, அப்போ நம்ம பார்க்கலாம், சரியா? சரி, போய் பார்த்துட்டு வாங்க. ரைட். ஆனால் வந்து இன்னைக்கு கிளாஸ் வந்து ஃபுல் அவேர்னஸ் பற்றி. ஸோ வந்து நம்ம ரெகுலராக யூஸ் பண்ணுற மெடிக்கல் டேர்ம்ஸ் வேணாம். அது தவிர நம்ம நார்மலாக ஒரு பேஷண்ட்டை நீங்கள் எப்படி பேசுவீங்க அந்த மாதிரி சொல்லுங்கள். டயபெட்டிஸ் சொன்னீங்க இல்லையா? இப்போ சர்க்கரை வியாதியில் என்னென்ன வகை இருக்கு? எஸ் ரேஷ்மா.
சார், சர்க்கரை வியாதியில் 3 வகை இருக்கு சார். குழந்தைங்கள்ல வருது, வயசானவங்கள்ல வருது, அப்புறம் வந்து கர்ப்பிணி பெண்கள்ல வருதுன்னு சொல்லிட்டு.
ஓகே, சரிதான்.
இப்போ நம்ம டயபெட்டிஸ் மிலிட்டஸ் அப்படின்ற கண்டிஷனை பற்றி பார்க்க போகிறோம். நம்ம எடுத்துக்கிற சாப்பாடில் இருக்கிற சர்க்கரையெல்லாம் உடம்பு எனர்ஜியாக மாற்றுது. ஸோ இதை சாதிக்கிறதுக்கு நம்ம உடம்புக்கு தேவையான ஹார்மோன் பேர் இன்சுலின். இதை சுரக்கிறது பேங்க்ரியாஸ். ஸோ நம்ம பிளட்டில் இருக்கிற சுகர் எல்லாமே இந்த இன்சுலின் தான் உடம்புக்குள்ளே இருக்கிற செல்ஸில் போய் எனர்ஜியாக மாற்றுறதுக்கு ஹெல்ப் பண்ணுது. இப்போ நம்ம சர்க்கரை வியாதியிலேயே டைப் 1 முதலாவது வகையை பற்றி பார்க்க போகிறோம். ஸோ டைப் 1 டயபெட்டிஸ் மெலிட்டஸ் இது வந்து ஒரு இம்யூன் சிஸ்டம் டிஸார்டர் அப்படின்னு சொல்லுவாங்க. இதை வந்து ஜுவினைல் டயபெட்டிஸ்னு சொல்லுவாங்க. சின்ன பசங்களுக்கு வரனால ஜுவினைல் அப்படின்னு இதுக்கு பேர் வந்துச்சு. ஸோ இந்த டிஸார்டரில் வந்து நம்ம உடம்புல இருக்கிற செல்ஸே பேங்க்ரியாஸ்க்கு எதிராக செயல்படுறதுனால இன்சுலின் ப்ரொடியூஸ் பண்ண முடியாத அளவுக்கு அட்டாக் பண்ணி வச்சிரும். ஸோ இந்த பேஷண்ட்ஸ்லாம் லைஃப் லாங் இன்சுலின் எடுத்துக்கிற மாதிரி ஒரு பிரச்சனை இருக்குது. இது சில்ட்ரனுக்கும் இருக்கலாம், யங் அடல்ட்ஸ்க்கும் இருக்கலாம். இந்த மாதிரி பேஷண்ட்ஸ்க்கு இருக்கிற பிரச்சனை என்னெல்லாம் வரும் அப்படின்னா, அதிகமாக அவங்களுக்கு யூரின் போகும், ரொம்ப தாகம் எடுக்கும், ரொம்ப டயர்டாவாங்க. இதெல்லாம் கண்டுக்காமல் விட்டாங்க அப்படின்னா கோமான்ற கண்டிஷனுக்கு போயிடுவாங்க. அடுத்து நம்ம பார்க்க போகிறது 2வது வகை டைப் 2 டயபெட்டிஸ் மெலிட்டஸ் அப்படின்னு சொல்லுவாங்க. இது வந்து 40 வயசுக்கு மேலே இருக்கிற ஒரு ஓல்டு பேஷண்ட்ஸ்க்கு மட்டும்தான் வரும். ஆனால் இப்போல்லாம் லைஃப் ஸ்டைல் சேஞ்சஸ்னால சின்ன பசங்களுக்கும் வர ஆரம்பிச்சிருச்சு. இதோட முக்கிய காரணன்றது ஒபிசிட்டி, உடல் பருமன் அப்படின்னு சொல்லுவாங்க. இது மெயினாக வரதுக்கான காரணம் என்ன அப்படின்னா, நிறைய ஜங்க் ஃபுட் சாப்பிட்றது, ப்ராப்பராக ஃபிசிக்கல் ஆக்டிவிட்டி அதாவது உடற்பயிற்சி இல்லாமல் இருக்கிறது, இதனாலெல்லாம் இந்த பிரச்சனை ஆரம்பிக்கும். இந்த பேஷண்ட்ஸ்க்கெல்லாம் பார்வை மங்கலாகிறது, ரொம்ப டயர்டாகிறதெல்லாம் இருக்கும். ஸோ டயபெட்டிஸ் இருக்கா இல்லையா அப்படின்றத நம்ம முதல்ல சீக்கிரம் தெரிஞ்சுக்கிறதுக்கு வந்து பிளட் சுகர் டெஸ்ட் பண்ணலாம். ஸோ ரத்தத்தில் வந்து எவ்வளோ சர்க்கரை இருக்குன்றத HbA1c அப்படின்ற ஒரு லெவல் வச்சு நம்ம பார்க்கலாம். 2வது யூரின் டெஸ்ட் வச்சு நம்ம பார்க்கலாம். இப்போ இந்த ரத்தத்தில் இருக்கிற சர்க்கரையெல்லாம் நம்ம பார்க்காம கண்ட்ரோல் பண்ணாமல் விட்டோம் அப்படின்னா பெரிய பெரிய காம்ப்ளிகேஷன்ஸ்க்கெல்லாம் போகலாம். இதனால் வர இருதய பிரச்சனைகள் எல்லாம் இரத்த கொதிப்பு, மாரடைப்பு, பக்கவாதம். இதுக்கப்புறம் உடம்புல இருக்கிற சின்ன சின்ன இரத்த குழாயெல்லாம் பிரச்சனை வர ஆரம்பிக்கும். இதுக்கப்புறம் நரம்பு பாதிக்கிறதுனால நியூரோபதி அப்படின்ற ஒரு கண்டிஷன் ஆகும். இதில் வந்து வலி, அப்புறம் வந்து உணர்ச்சி இல்லாமல் இருக்கிறதெல்லாம் இருக்கலாம். இந்த சின்ன சின்ன இரத்த குழாயில் பிரச்சனை வர ஆரம்பிக்கிறதுனால பார்வையிலையும் பிரச்சனை வர ஆரம்பிக்கும். டயாபெட்டிக் ரெட்டினோபதி அப்படின்ற வியாதி 80% மக்களுக்கு வர ஆரம்பிச்சிருக்கு. இந்த பார்வை பிரச்சனை பெருசாகாமல் இருக்க பார்த்துக்கணும் அப்படின்னா அடிக்கடி கண் செக்அப் பண்ணணும், பிளட் சுகர் கண்ட்ரோலில் வச்சுக்கணும், சரியான பார்வைக்காக வந்து ட்ரீட்மெண்ட் எடுத்துக்கணும். நாள் ஆக ஆக கிட்னியும் பிரச்சனையாக ஆரம்பிக்கும். அதை வந்து க்ரானிக் கிட்னி டிசீஸ் அப்படின்ற ஒரு கண்டிஷனாக சொல்லுவாங்க. இந்த பேஷண்ட்ஸுக்கு டயாலிசிஸ் பண்ணுற மாதிரி சுச்சுவேஷன் வரலாம். இந்த சின்ன சின்ன இரத்த குழாயில் வர பிரச்சனைனால தான் டயபெட்டிஸ் பேஷண்ட்ஸ்க்கு வந்து ரொம்ப பெரிய பெரிய விளைவுகள் வர ஆரம்பிக்கும். இதுக்கு நம்ம என்னெல்லாம் பண்ணலாம் அப்படின்னா, ஆரோக்கியமான வாழ்க்கை முறை, ஒரு ஹெல்த்தி லைஃப் ஸ்டைல் வந்து நம்ம ஃபாலோ பண்ணணும். டெய்லி எக்ஸசைஸ் பண்ணணும். 2வது சுகர் வந்தவங்களுக்கு நம்ம டெய்லி ட்ரீட்மெண்ட் கரெக்டாக எடுத்துக்க சொல்லணும். 3வது கால் பாதத்தை சரியாக பார்த்துக்கணும். அல்சர் யாருக்கெல்லாம் சீக்கிரம் வர மாதிரி தெரியுதோ அவங்களுக்கு கால் பாதத்தை வந்து டெய்லி நல்லா சரியாக செக்அப் பண்ணிக்கணும். 4வது வருஷம் ஐ செக்அப் போய் சரியாக பார்த்துக்கணும். அப்புறம் ப்ரெஷர் வந்து அடிக்கடி செக் பண்ணிக்கணும். இதெல்லாம் பண்ணாங்கன்னா சுகர் இல்லாதவங்களுக்கு வந்து வராமல் இருக்கிறது பார்த்துக்கலாம், இருக்கிறவங்களுக்கு சிக்கலாகாமல் பார்த்துக்கலாம்.
இன்னைக்கு கிளாஸ் பார்த்தியாடி? ஃபாஸ்ட் ஃபுட்லாம் நிறைய சாப்பிடவே கூடாதுடி.
Now I would request the judges to share their views.
NDM. The concept was really nice. It was one of the major issues to be addressed. Today the food habits have grown into a different types,
yeah. The way the enacted the drama they have created, okay, so nice. and okay, I think students have acted themselves as patient and acting.
That was nice.
So that was a good try, but a little certain areas it was little lacking. But what the intention of the concept was good. Okay, so to avoid junk foods. Okay, so to have a proper healthy foods like that. Okay, so
it was somewhat like a
well
TV
tried.
commercial for diabetic.
Yeah,
because they have made some slides into it.
Yes.
Movies don't have slides into it. That's the
real
basic.
Should be there.
Yeah. The footage should speak. A movie is what characters and screenplay should be expressing the thought of a creator, right?
Really
not
like using slides or
anime. Simple things won't help in a movie.
Okay, fine. So good work, good attempt.
Good work, good thought, especially. Nice.
And next we have Cancer Care, Bridge the Gap by Christian Medical College, Vellore.
Please, can you see the patient? He has a fixed inoperable entry node. I have told him it is inoperable, but he wants to speak to the senior doctor. Would you please see him for a few minutes?
Sure, Joseph. Who's come with the patient?
Only his sister has come today, sir.
Please come in. What is your name? And have a seat, please.
Good evening, sir. My name is Bhaskar. Doctor, sir, please operate to take this out. Only you can help me, doctor. You have to operate, doctor. Please, doctor.
Bhaskar, we'll definitely help you. But can you tell me what Dr. Joseph explained to you?
A nice doctor told me it was a cancer. I already knew that. But he said they cannot operate. But we know you can do something, sir. Doctors are like God. Anything is possible for you, sir. Please, sir.
Bhaskar, it is true, it is a cancer. And in many patients with this type of cancer, we do operate. I know it is very hard for both of you. You've come so far to the hospital, and here we tell you that we cannot operate. It can be very, very difficult. But I'd like to explain to you why the situation is different. Is that okay?
Yes, sir.
So this is the cancer, and these are blood vessels which go from the heart to different parts of the body to keep you alive. Now this blood vessel is a vessel that goes to the brain and the face, and the cancer is completely stuck to this blood vessel, and it is also involving other important parts of the neck. Are you with me?
Okay, sir.
So when we operate in a situation like this, we may not be able to take out all the cancer. And an operation where we leave behind some cancer actually can do more harm than good. And then when we operate in a situation where the blood vessel is so completely stuck, there could be a lot of bleeding. We could end up with paralysis of one half of the body, or there could also be a risk to life. And in this situation, I think these risks are not acceptable at all. And I would very strongly recommend that, at least for now, we do not consider surgery.
Sir, we don't mind any risk, sir, but I cannot live with this. The pain is so unbearable, sir.
I understand that, Bhaskar. See, even if we are not going to help by doing surgery, we can help you through other forms of treatment. We can give you a type of treatment called radiation therapy, which will shrink the tumor, which will reduce the fluid coming out, and will definitely help your pain. And once we start, you will start feeling better. Dr. Joseph, what type of painkillers have you started him on?
He had a pain score of 8, sir. So I have started him on step 3 analgesics. I have given him tablet morphine 5 mg every 4 hours and PRN. And it can be titrated up.
Today, I want you to go and see our palliative care clinic. My colleagues there will help you with the pain and with the wound.
Doctor, sir, if operation not possible, then I have to just go, sir.
No, Bhaskar, don't say that, because I think we can really help you. Dr. Joseph will come with you and make sure you're taken care of.
Sir, I was working up some patients in the ward.
I know you're very busy, but I'm very concerned about Bhaskar. We don't know what could happen in this situation. Please go with him, stay with him, and make sure he's attended to. See what they do with him in the palliative care clinic and come back and tell me. So we can also start doing this in our clinic.
Thank you, sir. Thank you.
Even though we are not planning an operation, I would like you to come back and talk to us if you feel the need. Our OPD is tomorrow, and we will definitely make time to talk to you and your family members to make sure you're taken care of, your doubts are addressed, and that we work on this as a team. Don't ever feel left out and all alone, Bhaskar. We are with you in this.
I'm Dr. Joseph from the Head and Neck Cancer Department. Dr. Kannan asked me to bring this patient to you. He has a squamous cell carcinoma of the hypopharynx with the right-sided neck node. It is 10 centimeter, hard, fixed and inoperable. His chest X-ray bloods and creatinine are normal, but there is a lot of outflowing discharge. Madam, Dr. Kannan asked me to stay until you finish seeing this patient.
Sure, Dr. Joseph. Please take a seat there. So you are Bhaskar. And how are you related to him?
I'm Rekha, his sister.
Whom do you stay with, Bhaskar?
Madam, he doesn't have children. After his wife died of cancer, he has been staying with my younger brother's family in our village. But after the tumor became big and started smelling, my brother's family said he cannot stay in their house. 2 days back, Bhaskar phoned me, and when I went to the village, he was sitting outside in the cold, crying with pain. My husband also doesn't let me bring him our house, but he said I can take him to hospital and stay till the operation is done, and then he can go back to his village.
Right. So I understand that is why the operation is so important to you, so that this tumor can be removed and Bhaskar can go back to your brother's place.
Yes, madam. I don't want to be burden to anyone. My screams and cries are making it difficult for my brother's children also. And the pain medicine they are bringing me, it is not helping, madam. Please, madam, you ask them to do operation. Even if I die, it doesn't matter.
Bhaskar, I'm really sorry that you've been through such agony. Okay? And to help you, we have better ways than this operation, which would harm you at this stage, actually. Okay? See, the tablets that you've been given, they may not be enough for pain as severe as you have. I think Dr. Joseph has written some new tablets for you today. And I'm sure that with that, your pain will become much, much better. Okay? Now, tell me about the smell. Since when has that been there?
No smell, madam. Everyone telling, no smell, no smell.
Madam, the smell has been there for 2 months.
Right. And have there been worms at any time?
Yes, madam. The tumor started producing worms. Actually, and that is when my sister-in-law said they could not keep Bhaskar in their home with the children. Otherwise, madam, they were looking after him very well until then. After that, she got scared. If the cancer is producing all these worms, what else will happen to others in the family?
See, that can be very frightening for anyone. But if we work on this together, definitely we can prevent these worms from happening again. Okay, the first thing is to remember that the worms are not being produced by Bhaskar's body. They came only because flies laid eggs on that swelling. You know how sometimes we may see worms inside a mango?
Oh, it's like that.
Exactly. And what do you do if you want to prevent flies from sitting on food?
We cover it with a lid.
So that is why we must always keep the wound completely covered with a dressing.
But madam, I don't know how we will manage that. In the clinic in our village, once the cancer starts smelling, they told him not to come back. Today, here the sister did nice dressing. I can't bring him here every day. Even today, while we are coming to the hospital, the conductor shouted at us because of the smell. We have to get off and pay a lot of money to come by an auto.
I really appreciate the fact that you took all this trouble to help your brother. But we need to make it much easier for that dressing to be done regularly. We'll do 2, 3 things. First, to reduce the smell, we'll give some simple tablets. Okay? And once that is done, dressings will be easier to do. In fact, most of our patients and relatives, they learn to do the dressings at home. It saves a lot of time and money and travel. Our nurse, she will teach you today. Bhaskar, do you want to ask me anything else?
Doctor, I am not afraid of death. Only thing I don't want is to be a burden to anybody else. Will this cancer spread to the family? I don't want it going to anybody else.
No, Bhaskar. The cancer will not spread to anyone who is staying with you or looking after you or eating with you. Okay? So, do you want to ask me anything, Dr. Joseph?
Madam, what will you do about this terrible smell?
It's actually quite simple. We know this is an anaerobic malodor. So, first, we give a full course of oral metronidazole. But in this hypoxic necrotic tumor, the anaerobic necrosis is going to continue. So we will keep him on daily low dose or oral metronidazole. Otherwise, we used to find that the smell comes back, and smell brings flies, flies bring maggots. Patients can die really terrible, lonely deaths. You prevented a big tragedy by bringing this patient here yourself today.
Madam, actually, to be honest, I was reluctant to come with him. After I joined this head and neck cancer fellowship, when I see patients whom we can operate, those who are doing well on follow-up, I'm very happy. But when these kinds of patients come, but now I understood why they were so desperate to remove that smelly fungating tumor. Actually, when we were coming through the hospital, people were moving away from us. I was wondering why this lady had brought him. But now, when I heard her story about how much she struggled to help her brother, I really think she's a much greater person than me.
I'm really very touched by what you have said, Dr. Joseph, because very few of us have the humility to accept our limitations. And many of our patients are braver and wiser than us. I really think if you continue on the same track, learning from your patients, you'll become a wonderful head and neck cancer surgeon someday.
Now I would request the judges to share their views.
So next is
Cancer Care Bridge the
Cancer
Gap.
Care Bridge the.
Yeah, it was a nice attempt.
Yeah.
But the thing is, after the video call thing, they have put some slides into the movie, which doesn't make us connect with that movie.
Yes. Little for me, it is little cliched, same kind of that the patient, the actors. Okay, little
the performance
too dramatic was there. It can be little lively also. So that's what I felt by the performance. But little informative. It was informative.
Yeah. Important point is that it only don't talk about the patient's perspective. It also talks about the attenders'
perspective also.
Yeah, patients, family members, and everyone. No? That was a good point. But slides are not at all a good idea. But still, nice work.
But you can avoid the these kind of slides so that we can the visuals should speak. Okay, instead of the
that's the main thing.
That's the main thing in short.
That's what makes the movie good.
Yeah.
A slide in between a scene will not be taken as a will not make a connect between the characters and the audience.
Yes.
Okay, it's fine.
Okay, fine.
Next for the screening we have A Step Towards TB Elimination by BJ Medical College, Pune.
छान दिसतं ना ते.
खरंच ग. आणि साखरपुड्याच्या दिवशी इतकी गोड दिसत होतीस असं वाटत होतं अख्खं खाऊन टाकावं तुला.
अरे खाण्यावरून आठवलं मला गोळ्या खायच्या.
कशाच्या?
टीबीच्या.
माझ्या आणि कविताच्या साखरपुड्यानंतर जेव्हा मला कळलं की कविताला टीबी झालाय तेव्हा मी उद्ध्वस्तच झालो.
कविता माझ्याकडे आली आणि तिला टीबी आहे म्हणून तिचा होणारा नवरा अजय तिच्याशी लग्न करायला आता तयार नाही म्हणून सांगू लागली.
मी टीबीच्या गोळ्या 4 महिन्यापासून घेत होते. माझं लग्न ठरलेलं होतं. पण ज्यावेळी अजयला कळलं की मला टीबी झालेला आहे तेव्हा अजयनं माझ्याशी पूर्णपणे संबंध तोडून टाकला. माझ्याशी फोनवर सुद्धा बोलणं टाळलं.
अजय चांगला शिकला सवरलेला त्यामुळे आपल्या होणाऱ्या बायकोला टीबी आहे या कारणाकरता तो लग्न मोडायला निघाला. एक अज्ञान, रोगाबद्दलची नेमकी माहिती नसणं हेच खरं तर त्याचं कारण होतं.
भारतात सगळेच जास्त क्षयरोगाचे रुग्ण आहेत. दरवर्षी आपण असं पाहतो की क्षयरोगाने पीडित महिलांना 1 लाखाहून जास्त महिलांना त्यांचं घर सोडावं लागतं. खरं तर हे अतिशय चुकीचं आहे कारण क्षयरोग पूर्णपणे बरा होतो. आपल्याकडे अतिशय चांगल्या दर्जाची औषधी उपलब्ध आहे. गरज आहे ती फक्त नियमित उपचाराची आणि एकही गोळी न सुटवण्याची. भारत क्षयरोगमुक्त व्हावा यासाठी वैद्यकीय महाविद्यालय यांनी केलेला हा छोटासा प्रयास.
समोरच्या व्यक्तीला जर सांगितलं ना तर समोरच्या व्यक्तीने पण ते समजून घेतलं पाहिजे. म्हणजे त्याला हाडजीडपणा केला नाही पाहिजे तर त्याचा तो आजार बरा होईल. आपण जसं त्या म्हणजे आजारी व्यक्तीला जर आपण हाडजीडपणा केला असं लांब जर केलं तर त्याचा तो आजार बरा होणार नाही. त्याचा जास्त डोक्यावर परिणाम होईल. मग त्याला असं वाटेल की आपण खरंच इतका आजारी आहे म्हणून आपल्याला कोणच बघत नाही. मग त्यापेक्षा त्या गोळ्या खायलाच नको असं होईल.
माझ्या मनात शंका यायला लागल्या की कवितामुळे मलाही टीबी होऊ शकतो आणि लग्नानंतर कविताला मुलाबाळांचाही प्रॉब्लेम येऊ शकतो. हे कळल्यानंतर माझ्या घरातल्यांनी आणि मी स्वतः सुद्धा आमचं लग्न मोडलं असंच जमेत धरलं. आणि मग त्याच्यानंतर मला काही सुचेच ना.
पण मी त्याला बोलावून घेतलं आणि त्याला समजावून सांगितलं, अरे गेले 4 महिने कविता या गोळ्या खाते आहे. त्याच्या डोक्यामध्ये खूप प्रश्न होते की कवितामुळं मला हा आजार होईल का, TB झालाय म्हणजे कवितानंतर मूलबाळ होईल की नाही. आणि एकदा गोळ्या सुरू केल्या, डॉट्स उपचार सुरू केल्या TB करता, की अवघ्या 2 आठवड्यामध्ये TBचा कोणताही रुग्ण हा दुसऱ्या कोणालाही त्याचं संसर्गजन्य असणं संपतं.
डॉक्टरांच्या बरोबर आणि कविताबरोबर TBमधून बऱ्या झालेल्या अनेक रुग्णांना भेटलो. त्यामध्ये हॉस्पिटलमधल्या शहनाज मावशी असतील, त्यांची सून असेल.
मी ह्या गाडीखान्यापासून TV युनिटला खूप वर्ष झालं काम करत आहे. मी कॉर्पोरेशन सर्वंट आहे. पण माझ्या घरामध्ये माझ्या नंदेच्या मुलीला लग्नाच्या अगोदर TB झाला होता मुलगी असताना. गोळ्या वगैरे खाऊन व्यवस्थित झाली, लग्न झालं, 2 मुलं झाली, अगदी सुंदर मुलगी आहे, मोठी मोठी मुलं झाली. तिला परत TB काय झाला नाही, आपल्या गोळ्यांनी एकदम व्यवस्थित झालेली, काही विरोध नाही केला. माझ्या मुलांनी म्हणला की तू 6 महिने ॲडमिट होत, तर ती म्हणली नाही आणि शेजारच्या लोकांचा आणि मला त्रास होईल. तिथे डॉक्टर म्हणाले, तर म्हणली नाही आहे, मग मला घरी यायचं. मग म्हटलं ठीक आहे, कशाला बाबा तिला बाहेर काढतो, आता भावानी तर नाही सांभाळत, मग आपण सांभाळू ना, आपण सासरे असून पण तिला आपण आपली करून आणली तर आपणच सांभाळायची. मग ते बाळाला पण व्यवस्थित केलं आणि ती बाई पण म्हणजे माझी सून पण चांगली झालेली आहे. आणि मी किती गेल्या वर्षी मी कॉर्पोरेशन सर्वंट आहे, गाडीखान्यामध्ये कित्येक वर्ष TB युनिटमध्ये काम करत आहे. मला कुठल्याही आजाराचा कुठलाही त्रास नाही होत. मी सगळ्या पेशंटशी बोलते, सगळ्या पेशंटला सोडते, सगळं काही पेशंटशी माझा सगळा संबंध पेशंटशी असतो, पण मला आणि काही त्रास झाला नाही आहे.
किंवा नितीन म्हणून आणखीन एक अतिशय जर्जर असा पेशंट होता की ज्याला उठताही येत नव्हतं, पण तो TBमधून बरा होऊन आमच्याशी स्वतः बोलत होता.
मी पहिल्यांदा आजारी पडलो, मला थंडी वाजून यायची, मी सारखा उन्हामध्ये जाऊन बसायचो, थंडी ताप यायचा, सारखा झोपून असायचो मी. आणि त्याच्या बाजूला व्हायला लागले. नंतरच्या थोडं जरी चालले तर अशक्तपणा जाणवायला लागला, दम लागायला लागला. थोडं जरी चाललं तर नंतरच्याला मी दवाखान्यामध्ये गेलो, ॲडमिट झालो. नंतरच्या डॉक्टर लोकांनी गोळ्या दिल्या, मी त्या कॉर्पोरेशनच्या दवाखान्यामध्ये जाऊन गोळ्या घेतल्या. त्या गोळ्यामध्ये एकदा दोनदा माझे चुकलेलं, डॉक्टर लोक माझ्या घरी आले ते वापिस, मी वापस गेलो, वापस गोळ्या खाल्ल्या. त्याच्यामुळे हा आजार बरा झाला आणि मी आता माणसांमध्ये हिंडू फिरू शकतो. आता माझ्यामध्ये पहिल्यासारखं हे आलेलं आहे.
अशा लोकांना भेटल्यानंतर मला संपूर्णपणे खात्री झाली की TB हा जो रोग आहे तो बरा होऊ शकतो. त्याच्यासाठी फक्त गरज आहे ती नियमित उपचारांची.
लोक घाबरतात ह्या आजाराला, की हा आजार TB म्हणजे खूप मोठा आजार आहे, पण हा TB म्हणजे सर्दी पडल्यासारखा झालेला आहे, ह्याला म्हणजे काही भीती नाही आहे. पण काही लोक सून असली तर सासरा सासू नणंद भाऊजाई जाच करून भांडे वेगळे हे वेगळे, हे चुकीचं आहे. हे कधी असं करू नये, कारण तो आजार गोळ्यांनी हा बरा होऊ शकते. जर पॉझिटिव्ह जर पेशंट असलं 2 महिने फक्त रुमाला लावावं, त्यानंतर 2 महिन्यानंतर गोळ्या दुसऱ्या खाल्ल्यानंतर निगेटिव्ह रिपोर्ट 2 महिन्यांनी येतो. त्यानंतर पेशंटचे सगळ्यांनी घरातल्यासारखं संबंध करावं आणि सारखं वागावं, आपल्या समजून घरामध्ये सगळं पहिलं होत तसं वातावरण ठेवा. त्या पेशंटची कधीही कडूसपणाने वागू नये, त्याच्या मनामध्ये परिणाम पडतो, कारण ते पेशंटला आणि आजार जास्त वाढत असतो, त्याला टेन्शन येतं. म्हणून त्याचं टेन्शन नीट करायसाठी आपण चांगल्याच स्वरूपाने त्याला बोलायचं आणि प्रेमाने बोलायचं, चांगलं खाऊ घालायचं, आहार भरपूर द्यायचा, दूध अंडे केळी हे सगळं खायला घालायचं, हा आजार नीट होतो.
जेव्हा मी कविताच्या डॉक्टरांना भेटलो तेव्हा त्यांनी मला TBची संपूर्ण माहिती दिली की TB हा जो रोग आहे तो अतिशय साधा रोग आहे आणि काही नियमित उपचार घेतल्यानंतर तो बरा होऊ शकतो.
TB हा आजार असा कोणा बाबतीत भेद करत नाही. तो श्रीमंत तसंच गरीब अशा दोन्ही वर्गातल्या लोकांना होतो. तो लहानांना होतो, मोठ्यांना होतो, स्त्रियांना होतो, पुरुषांना होतो. तो तशाच इतर कोणत्याही प्रोफेशनच्या लोकांना होतो. TBच्या बाबतीत असा काही नैसर्गिक असा भेदभाव नाही. त्याच्यामुळे आपण TBच्या बाबतीत डॉक्टर कम्युनिटी मिळून सुद्धा भेदभाव करू नये आणि त्यांना इक्वल दर्जानीच आपण त्यांना उपचार करायला पाहिजे आणि तसं त्यांच्यासोबत वागायला पाहिजे.
मला अगोदर खोकला येत होता आणि छातीत म्हणजे पुढे छातीमध्ये आणि बॅक साईडला चमक मारत होती आणि खोकताना म्हणजे माझ्या खोकल्यामधून कफ पडत होता.
ज्या रुग्णाला सर्वसाधारणतः 2 आठवड्यापेक्षा जास्त खोकला असेल, त्याला ताप असेल मुख्यतः संध्याकाळचा, त्याला खोकलावाटी रक्त पडत असेल किंवा दम लागत असेल किंवा छाती दुखत असेल, हे प्रामुख्याने हे 5 लक्षणं असतात. तरी पण जास्तमध्ये आपण खोकल्याला महत्त्व देतो. आपण थुंकीचे नमुने 2 घेतो, एक सकाळी आणि एक स्पॉटवर, आणि 2 नमुने आपण लॅबॉरेटरी प्रयोगशाळेमध्ये पाठवून त्याची क्षयरोगाचे जंतू आपण त्याचा तपासण्याचा प्रयत्न करतो.
मला खूप त्रास व्हायचा, त्यावेळेस मी दवाखान्यात गेले आणि थुंकी चेक केली आणि थुंकी चेक केल्यानंतर मला सांगितलं की तुला क्षयरोग म्हणजेच TB हा झालेला आहे.
TBचा आजार हा दीर्घ मुदतीचा आजार असतो, त्यामुळे उपचार पद्धतसुद्धा ही दीर्घ मुदतीची असते. तर सर्वसाधारणतः 6 ते 8 महिने हा उपचार चालू असतो. ह्या उपचारामध्ये 3 ते 4 प्रकारची औषधे असतात साधारणतः, आणि सर्वसाधारणपणे काही त्याचे दुष्परिणाम असतात, पण तो दुष्परिणाम एवढे गंभीर स्वरूपाचे नसतात, ते किरकोळ स्वरूपाचे असतात. सर्वसाधारणतः उलट्या येणे, पोटामध्ये दुखणे किंवा मळमळ होणे, आणि उपचार सहज त्याच्यावर मात करता येते सर्वसाधारण औषधीमुळे.
त्यांनी मला त्यांच्यातर्फे डॉट्स प्रणाली म्हणजेच त्या गोळ्या दिल्या आणि त्या गोळ्यांचा कोर्स म्हणजे 6 महिन्याचा होता. सर्वप्रथम त्या गोळ्या म्हणजे 2 महिने 7 गोळ्या खायच्या होत्या आणि मी त्या गोळ्या नेहमी दवाखान्यात जाऊन डॉक्टरांच्या समोर बसून त्या गोळ्या घेत होते आणि वेळेवर जेवायचे. म्हणजे सकाळी उठल्यानंतर मी भरपूर जेवण करून त्या गोळ्या घ्यायचे.
समजा काही रुग्णांनी उपचार सुरू झाल्यानंतर 1 ते 2 महिन्यात त्यांना बरं वाटायला लागतं आणि ते डॉक्टरचा सल्ला न घेता असे रुग्ण औषधी बंद करतात, आणि अशा रुग्णांचा काही दिवस त्यांना आराम पडल्यानंतर पुन्हा त्यांना त्रास व्हायला सुरुवात होते. त्यावेळी ते पेशंट रुग्णालयामध्ये येतात आणि त्यांचे आम्ही नमुने घेतो थुंकीचे. तर अशा पेशंटमध्ये नंतर रेजिस्टंट TB नावाचा प्रकार होऊ शकतो. असा रेजिस्टंट TB जर झाला त्याला आम्ही मल्टी ड्रग रेजिस्टंट ट्युबरक्युलोसिस म्हणतो. तर त्याला जी मूळची उपचार पद्धती आहे, डॉट्स उपचार पद्धती लागू पडत नाही. त्यासाठी जरी नवीन उपचार पद्धती असेल डॉट प्लस, तरी ती जी नवीन ड्रग्ज आहेत सेकंड लाईन ड्रग ते फार टॉक्सिक आहेत, ते जास्त दुष्परिणाम करणारे आहेत आणि त्याचा सक्सेस रेट हा सुद्धा कमी आहे. म्हणून याच्यावर एकच सल्ला आहे की पेशंटनी किंवा रुग्णांनी डिफॉल्टर होऊ नये किंवा ती औषधी मध्ये सोडू नये आणि डॉक्टरच्या सल्ल्याप्रमाणे नियमित घ्यावी.
की तू बरा होशील, फक्त एवढं म्हणजे त्याचे जे पत्ते असतील म्हणजे रुमाल तोंडाला बांधणे, म्हणजे बोलताना, शिंकताना, खोकताना तोंडाला रुमाल बांधणे, जास्त म्हणजे नाही का कुठं प्रवास टाळायचा, म्हणजे जास्त करून गर्दीचा प्रवास टाळायचा. हे त्याला जर समजून सांगितलं तर तो नक्कीच म्हणजे मला असं वाटतं की व्यवस्थित होणार.
आणि त्यानंतर मी 6 महिने ते पुढे परत आणखी कंटिन्यू, मग एक दिवस पण खाडा नाही केला त्या गोळ्यांचा आणि 6 महिने पूर्ण औषधे घेतली आणि माझं वजन वाढलं. विशेष म्हणजे त्याच्यानंतर TB खूप छोटी गोष्ट आहे आणि औषधं जर घेतली नियमित आणि खूप सारं खायला पण नाही लागत, फक्त वेळ सांभाळायची आणि औषधाची वेळ सांभाळायची, खाण्याची वेळ सांभाळायची आणि मानसिकता शांत ठेवायची. आपल्या बुद्धीला डोक्याला एकदम शांत ठेवून डोक्यात टेन्शन नाही घ्यायचं की अरे बापरे TB झाला, तर तसं काय नसतं. औषधं घेतली ना तर TB ही राहतच नाही आणि एक चांगली प्रकृती निर्माण होती त्याच्यानंतर आणि चांगलं जीवन जगू शकतो आपण.
नारायण परशुराम भतखंडे, 20/14 सदाशिव पेठ, पुणे, नंबर 2. मला TB झाल्याचं लक्षणं दिसली. ते कप वगैरे पाडल्यानंतर इथं गाडी काढण्यात आलो. त्यांनी औषधं दिली. 2 दिवसांनी 6 गोळ्या दिल्या. ते नियमित घेत नाही आणि लहान मुलांची काळजी, घरी लहान मुलं नसली तरी काळजी घ्यायला सांगितली.
त्याच्या लक्षात आलं की TB झाल्यामुळं स्त्रियांना मुलबाळ होत नाही असं काही नाही, ते त्यातून पूर्णपणे बऱ्या होतात. खूप अशा पद्धतीच्या बऱ्या झालेल्या पेशंटला भेटल्यानंतर त्याला खात्री पडली की आपल्या मनामध्ये हे जे एक जळफट सगळी जमलेली आहेत TB बद्दलची, ती चुकीची आहेत आणि ती आपण पुसून काढायची गरज आहे. अजय बदलला.
आता अजय माझ्याशी खूप चांगला वागतो आणि आम्ही दोघांनी मिळून TBच्या जे पेशंट आहेत त्यांना भेटलो. अजय खूप आता मला मदत करतो, साथ देतो.
आणि या अनेक रुग्णांना भेटल्यानंतर, अनेक पेशंटला भेटल्यानंतर अजयची अगदी पूर्ण खात्रीच पटली की नियमित उपचारानं TB हा आजार पूर्णपणे बरा होऊ शकतो. गरज आहे ती प्रत्येक पेशंटनं आपली ही जबाबदारी ओळखण्याची, एकही गोळी न चुकवण्याची आणि त्याचबरोबर त्याचे मित्र, मैत्रिणी, नातेवाईक, समाज या सगळ्यांनी अशा पेशंटला आधार देण्याची, मानसिक धैर्य देण्याची गरज ही खूप जास्त असते.
नियमित जर गोळ्या घेणं व्यवस्थित घेतलेला बरं होतं, काही घाबरायची जरूर नाही.
TB हा बरा होतो
100% बरा होतो.
आणि आता एकदम क्लिअर आहे, मला काही होत नाही आणि मी शाळेत म्हणजे मी कॉलेजही माझं पूर्ण केले.
तो आजार मला झाला होता आणि तो व्यवस्थित बरा झालाय आता, म्हणजे पूर्ण बरा झालाय.
मी इथे 6 महिने गोळ्या खाल्ल्या, मी आता पूर्णपणे गोळ्या खाऊन बरा झालेलो आहे.
नियमित उपचाराने टीबी पूर्णपणे बरा होतो.
नियमित उपचाराने पेशंट हा बरा होतो.
नियमित उपचाराने टीबी संपूर्ण बरा होतो.
Now I would request the judges to share their views.
Step towards TB elimination.
Okay, so actually this short film started very well, okay, with the boy and girl, okay, they are going to get married, okay, suddenly that comes, but in between it deviated little from the okay story. The same way they have treated.
They should be moving as a story.
Story, yeah. In between,
a person talking directly to the camera doesn't look
impact,
good.
So the doctors also, okay, and the other person got affected. They used to say that kind of narration little had okay, we are losing the grip. Okay, it is not gripping that much.
Yeah, movie should speak itself.
Yeah,
and not a narration or something.
But at the beginning it was
nice.
Okay, the non-fiction, okay, it was very creative. It started well, and in the between it went little deviated.
So the narration makes it look like a documentary or an ad film.
Ad film kind of a thing. Yeah, fine.
But it's fine, it's a good work.
Good work.
Next in the line we have Breaking the Bad News by Ames Mangalagiri, Andhra Pradesh.
Hello my dear students, my dear friends and respected seniors. While working in the hospitals, junior residents, interns may feel difficulty while delivering the sad news to the patients or their relatives. Delivering the sad news suddenly to the patients or their relatives will definitely hurt them. Due to the busy schedule of these working doctors, they may not give sufficient time to the patients or their relatives to inform the seriousness of the disease in a proper way or to satisfy their queries. This may lead to the assault on the working doctor and staff. Despite the busy schedule of the doctors, they should give sufficient time to the patients or their relatives to satisfy their queries and inform the seriousness of the disease in a proper way. Here, the faculties of the physiology department Ames Mangalagiri are going to make a role play showing how to deliver the sad news in a proper way to the patients and their relatives, maintaining good attitude and proper communication. Thank you.
Next patient. Come first, come first. Come fast. Tell me.
Can I sit, sir?
Sit. Yeah, what?
Sir, actually, like I asked in the lab, sir, about the reports. They said it is ready and they've sent it to you.
Who are you? What's your name?
Sir, my name is Sarla, sir.
Okay.
Last week I came for consultation.
Yeah, tell that first, no?
I came for consultation with stomach ache, sir.
Okay.
And till now I'm having the same.
Yeah. Stomach pain, vomiting and all. Okay. I have asked you to take a blood test and this also, scan also.
Yes, sir.
Report has come?
Yes, sir.
Paid the bill, no?
Yes, sir.
Okay. Name? Sarla. Okay. Yeah, the report has come. I think it's cancer. Okay. Pancreatic ductal adenocarcinoma, stage 3. Yeah. Okay.
Sir,
you do one thing.
I'm not understanding what you're saying, sir.
First hear what I am telling. There's cancer has come. It's stage 3. You have to get admitted first.
Sir,
Okay.
I'm just 30.
Yeah, wait. Tell me, sister. Yeah. For the 4th bed patient, no. He is our VIP patient. Okay. You continue the drips for him. And I think one more cancer patient has come. Yeah, Sarla name. Yeah, that's 30 years. You prepare the bed and keep. I will ask her to get admitted. Okay. Yeah. Okay. Tell me.
Sir,
Yeah, what?
should we take the reports test once again, sir?
Report is correct only. Come. Please, get in.
Sir, how are you, sir?
I'm very fine. Sister, chair for him.
Sir, I'll sit in this chair.
Okay.
No problem.
2 minutes, sir.
Yes, sir.
The cancer patient is there. I will send her and come. Okay. Tell me.
Sir, I'm still having the pain, sir.
I have told already. You have to get admitted. Prepare 2 lakhs. I have a hospital. I have told the sister to prepare the bed also. Okay, you heard now. Prepare and come.
Sir,
Okay.
2 lakhs is on the higher side, sir.
Wait.
Sir, we have got some new drugs, sir. Can we see this?
1 minute. Tell me. You will finish
2
fast.
lakhs is
Yeah.
on the higher side, sir.
That is not all my problem. Okay. You have the drugs, painkiller. You take it now.
No, sir, I don't have, sir.
Yesterday I have given previous visit. The same drug only. Okay. You take it and come and get admitted fast. Cancer is ductal carcinoma. You know that.
Should be
It's
checked.
higher end. Chances of dying is more. Don't take risk and come and get
Should
admitted.
we check in other labs, sir?
That is up to you. Okay, I have other works also. Okay, I have reported you. Get the report collected. Pay the bill again. Okay, they will give you the report. Thank you. You can go.
Sir, the report has come here.
Done. You go. You'll see. Tell me, man.
Thank you,
Yeah.
Sir, this tablets you can see, sir.
Yeah.
If we recommend this one, we can.
Good.
Okay, next. Just want please come and have a seat.
Thank you, sir.
I think you are Sarla, right?
Yes, sir.
Oh, so how are you feeling, Sarla? I think you came with stomach pain and vomiting. So how are you feeling now?
With the medicines, I feel a little better, sir.
Better?
Yes, sir.
Okay. So have you got the reports which they asked you to get it done?
Sir, I inquired in the reception. They said that they have sent it to you.
Okay, just give me a moment. I will just trace it. What's your initial, Sarla? Okay, I have it here. Just give me a moment, okay? I'll go to the report. See, Sarla, I want you to listen patiently and carefully to what I am going to tell you. Okay? I hope you are aware of an organ called pancreas, which is near your stomach. It is secreting insulin. It is going to control your blood sugar. Okay? So the report is telling there is a small swelling in that pancreas, and it could be cancer.
Doctor, I'm just dirty, doctor.
Wait, cool down. Nothing to worry. Cool down, patients, and relax. Okay, want some water?
No, sir.
Okay, see. Wait. Just listen to me, okay? It is not a big issue, okay? It's just a starting stage of cancer, okay? We have a very good treatment, okay, to cure this problem, okay? So don't get this, don't worry, we are here for you, okay? We have an expert team of doctors here, okay, who is going to take good care of you, okay? So do not worry, okay? Fine? So relax, okay? So I will tell you what you are supposed to do, okay? So how the treatment is going to go on, okay? You don't have to worry. If you are going to follow my instructions and take the treatment strictly, you will be fine within 5 to 6 months. Got it? You will be fine within 5 to 6 months, so don't worry about it, okay? Alright? So what I would like you to do is...
How much it would cost me, sir, for the treatment?
Sarah, you meet Ms. Shanti, she's there in the reception, okay? So she will tell you everything in detail. I'll just give a call. Hello. Oh, my Shanti. I'm sending a patient named Sarla, okay? So just please explain her about the treatment and the cost, hospital charges, everything, okay? So she'll be coming to you. Okay, I'll send you 5 minutes. Okay, thank you. Okay, Sarla, I have given you one.
May I come in, sir?
Siddharth, can you please wait in the lobby for some time? I will let you know. Okay. So, Sarla, I have told Mrs. Shanti, okay, you go meet her, she will explain in detail. Nothing to worry, okay? So, you please feel at home, be comfortable, okay? We are here to take care of you. If you have any problems, you can contact the hospital helpline, okay? We will be available 24 hours, okay? So, I prefer you to come next week. We come and meet me next week. I will give you a few set of investigations, okay, to be done. So if you get these investigations done, then we can start away with the treatment. Okay, we can start with the treatment right away. I prefer you bring with you someone, okay, your father, your mother, anybody, so who can be of support to you. Okay, so don't worry. So till your reports come, I will give you.
This is not life-threatening.
Nothing. You will be absolutely fine within 5 to 6 months. Okay, trust me, believe. Be relaxed, cool. Okay. So I'm giving few medicines. Okay, to decrease your pain and vomiting. Okay, you please take these tablets and also continue the tablets which I have given you already. Okay, get these investigations done. And when you come next time, you bring your parents or relatives, anybody who is there to support you. Okay, so please give it in the reception. Mr. Shanti will guide you. Okay, take care. Don't worry. Okay, bye.
Hello everybody. In spite of the advancements in medical science, still there are innumerable conditions or diseases in which we are not able to cure it fully. So, disclosing a bad news is a part and parcel of medical profession. One need not consider that as a failure situation. Executed properly, it can be definitely a winning situation for a doctor. Right. There is no one such rule of thumb or the best method to do that. We have to be aware of all protocols which are being practiced in the profession, and then we have to take the best practices of each protocol, and then we have to design or craft our own methodology for this disclosing this bad news. Every situation is unique, every circumstance is unique, our patients are unique, so therefore according to the context we may have to do finer modifications, and then we need to craft the disclosing of this bad news tailor-made for our situation and patient. Okay. I would recommend one such protocol which involves the following major aspects. Number one thing is you need to understand your patient. You need to understand his background, you need to understand his level of education, so that based on that you can craft your communication accordingly. You can craft your communication in the best possible way. Communication is very important, not only for this, but also to develop a very good rapport. The better the communication, the better the rapport. So once when the rapport is done, once when you understood that a good rapport is there between you and your patient, then slowly what you do, you probe him and then make him to expose his understanding about the particular disease that he is having. Make sure that he is understood it rightly, and then there are no misunderstandings regarding that. And then now comes the difficult part, that is exposing the bad news. Expose the bad news, is that right? You inform him without using much technical words, in a very common language, without ambiguity. You express the bad news, and then immediately the patients will be having emotional outburst, and then these things are part of normal human behavior, so please try to address it and respect it. Anybody will undergo the same thing. Then once the patient cools down after some time, then what you do is that you slowly ask the patient to recount the entire interaction and make sure that the patient has taken things very rightly. After that, make sure that there are adequate support systems, so that the patient safely goes to his home and he does not resort to any unwanted activities like committing suicide, etc. And then what you do is that once when the patient reaches home safely, once when he cools down, once when he takes some time, then he will start thinking. After that, he may require a long-term support. So for that reason, you have to give him some toll-free number or some contact number. Either it could be counseling-wise or it could be technical-wise, that is professional-wise. So you have to support him with such contact numbers, which are greatly benefiting the patients. Now, once when these things are done, make sure that the entire interaction is in a written format, and then the patient gives in affirmative. Okay, either he signs a document, that saying that he has understood everything in the right way, and then you keep these records in a safe custody. Now, again I'm telling you, this is not the only method. There are a number of methods available. You need to be aware of all such methodologies and then take the best practices and give it for your patients. Thank you.
Now, I would request the judges to share their views.
Okay, the next is breaking the bad news.
Yeah.
It was a very good movie, but
so this is very important, particularly when any patient has a kind of a disease. Okay, how to
handle them.
Okay, handle them.
Yeah,
how
that
to
was
inform
nice.
them. So how you break the ice. Okay, so you should not. Okay, that was very
important
good
topic
work.
to me.
Okay, it's a good concept. I like the acting of the actors, the doctor and the patient.
That was really
so
nice.
It was very impressive. The acting was very good, and it holds the story.
Yeah.
Okay, so we are able to connect with the acting, so that they were very real, and it happens also. So how we have to treat the
we can connect
patient
easily.
So this also might have happened to some of our neighbors or relatives. So that is they have got the concept very good concept. They have made it also very well.
Small technical issue is there. No? It's, the doctor's voice is very much audible and the patient's voice
it is very feeble.
Very
feeble. So
that's
little bit of audio quality we have to see that.
Some technical issues which can be easily
we can overcome that one.
Yeah, but otherwise it's very good.
It's a well made one.
To tell us the importance of communication skills, we have Small Things Matter, Communication Can Save Lives by Christian Medical College, Vellore.
This is the first of a series of videos on head and neck cancer. In this video, we will see how an act of communication can be a life-saving intervention. Anand has an early tongue cancer and he comes to the palliative care clinic for pain relief. But what is his real need? How does the doctor identify and address that? The first part of any medical consultation is to gather information. Before the doctor sees the patient, she reviews the notes, and when she meets the patient, she establishes rapport and begins with open questions that allow Anand to tell his story. Perhaps the most important part of the consultation is to listen to the patient's presenting complaints with minimal interruptions. And as we listen, we can remember the mnemonic ICE: ideas, concerns, and expectations. In other words, what does the patient understand about his disease? What are his main problems? And why did he come to the doctor today? Just by allowing the patient to tell their story without interruption, we gathered many parts of the puzzle. Before we move further, we acknowledge and then we use more focused questions to clarify what we need to know about the medical needs as well as about the communication gap. Hello Anand, how can a pain and palliative care clinic help you?
Doctor, my tongue has become painful. My neighbor told me that in this clinic, they treat pain without operation. That is why I have come.
We can definitely do something for your pain, but to help you in the best way possible, can you tell me from the beginning how all this started?
About 4 months ago, I had an ulcer in my tongue. Unlike other ulcers, there was no pain, so I didn't do anything. Then it got bigger. So I went to the dentist. He did some tests and then he sent me to an expensive hospital. There I met a surgeon. He said, I have cancer. And then he said, I have to cut off your tongue. I got scared. I have a small shop. If I cannot speak, how will I talk to my customers? How will I manage? Then I asked him. Is there any other way of treating apart from operation? He got angry and he said, are you the doctor? I am the doctor. So I said, sir, at least give me some tablets for the pain. He said, no, this is not the treatment for cancer. I got scared, doctor. So I came home and asked my wife. She also agreed with me. She said, if we cut the cancer now, then it will become big. I don't want to go through the operation, doctor. I am scared.
I understand that it is frightening. Can you tell me what was difficult?
First, the doctor says I had cancer. Then he says he has to cut off my tongue. I got scared. First, when they did the biopsy, there was little pain. Now it is paining continuously. I don't want an operation, doctor.
We will definitely do something for the pain. Before we discuss further, can I just examine your mouth?
Yes, doctor.
Having obtained information through the history, the examination, and from the notes, we now move to the second part of the consultation, sharing information. A useful mnemonic here is to chunk and check. Using simple language, we move stepwise from what the patient knows to what he needs to know. By chunk, we mean we give bite-sized pieces of information, not a barrage of information. And we do that by using a dialogue rather than a monologue. The dialogue is guided by the patient's verbal and non-verbal response, his questions and concerns. To aid recall, we can use different methods, diagrams, words, appropriate analogies, and signposts such as first, second, third. After that, we really need to check that the patient has understood the key messages, and then finally we summarize and plan ahead. Anand, I would like to explain a few things to you.
Yes,
okay? If cancer is a plant, when the plant has only a few leaves, can we pull it out by the roots?
Yes. Yes.
But after many months, once we leave it for many months, when it grows and the roots go deep inside, then it is difficult to cut it off completely. It may grow back. Many of the patients in our clinic, their cancer has become like the big plant. We are not able to remove it fully. But I think from what I have seen from your reports and from examining you, there is a chance that your cancer could be successfully removed, and that could save your life. You told me you were frightened of the operation.
Yes.
What was most frightening?
See, doctor, my relative had the same problem. After the operation, the cancer came back, came inside the mouth, all over the face. By then he has taken so much of loan for his treatment. Then he died. His family's future is gone. Money is gone. Only the hospital has become bigger.
I'm very sorry to hear this, Anand. That is why you are worried about having this operation.
Yes, doctor. I don't want to have the operation.
Can I explain a few more things? Okay?
Yes.
I'm really sorry about what happened to your relative, but each patient's cancer is different. And cancer, it's not like other ulcers or tumors. Any surgeon cannot just decide and cut it out. Only a cancer surgeon can safely decide whether the cancer can be safely removed or whether it has grown too big and it might grow faster if he cuts through it and removes half of it. In the cancer hospital, there are experienced surgeons who can make wise decisions, weigh the benefits and the risks, and also consider how it affects you, your family, your future. And then they will discuss the pros and cons so that you can make a decision together with them.
Madam, you have taken so much time and explained things to me. But in the big hospital, they use big words, they speak so fast, I don't understand all these things.
Unfortunately, that happens. But Anand, you must remember that this is not a small disease or a small treatment for you. It's a matter of your entire life and your family's future. So before you go to see the cancer surgeon, write down the main questions you have. When he explains to you, many of those questions may get answered about your speech, the cause, the risks. But if any other doubts still remain, you can definitely ask him. And either he or someone in his team should explain those things to you. And then you would be able to make a better decision. I can see that once you have made up your mind, it is difficult to change. That's understandable. It's a big decision. So first, you came to us for pain. So let me give you some medicines for the pain. These are simple tablets because your pain is not very severe.
Okay.
But remember that that will not treat the cancer. It will only reduce the pain. So in the next 2 days, before you come back to us, I would like you to take these pain medicines and think about 2 things. First, how much are the medicines helping the pain? How many tablets do you need to take in a day? That's the first thing. Secondly, at least once, would you be willing to go to the cancer hospital and see a surgeon there? I will refer you to someone.
Yes, doctor.
So you will come back after 2 days with your wife?
Yes, doctor. I will come back 2 days with my wife.
And before that, what are the things you will think about?
I'm going to see how these medicines are going to help the pain. And I will also think about seeing a cancer surgeon, doctor.
Good. See, Anand, it would have taken me only half a minute to write the pain medicines for you. But since it's a matter of your whole life, your family's future, we had to take a little more time to discuss all this.
Thank you, madam. You've been very helpful too.
Communication integrates the patient's perspective and the medical perspective, the verbal and the non-verbal, empathy and science. Treatment outcomes depend not only on appropriate treatment, but also on adequate communication, early symptom relief, and attention to social stressors. So, what were Anand's ideas, concerns, and expectations? And what verbal and non-verbal communication techniques enable the doctor to understand what Anand needed? List 5 reasons why Anand has been unwilling to undergo the cancer surgery. How can we reduce such barriers in our practice? Even in a big disease like cancer, small things matter.
Now I will request the judges to share their views.
Small things matter. Communication can save lives.
Yeah.
And that was really a good movie. The concept is very understandable. It's thorough.
Thorough, yeah.
But they have again they have put some PPT into it.
Yeah, I think it is meant for the educational video purpose. I think. And one more thing about the video quality is little old. I think they might have shot some old using old cameras or something, and it is little slow paced. But I like the acting of the patient. Okay, so
performance was very good.
The performance between the doctor and the patient.
Even the actors nowadays
so how whatever they have discussed in the PPT, that according to that also they are able to do that. So but little slow pace, but it is the need of the hour. So how you have to communicate with the patient. Okay, so how to handle these kind of patients. So that was very good, but and it is a good educational material. I think.
But for me, if they have eliminated the slides or even without the slides, it's understandable. It's thoroughly understandable.
Yeah, but I think these kind of words also sometimes can connect the audience when they talk, as well as when you use a PPT. No, there will be a kind of connect. Okay.
But really, it was a good work.
Good work.
Yeah.
Next in line we have Right Feed Right Deed by Siddhaganga Medical College and Research Institute, Tumakuru.
Why? What happened? Why are you so sad?
I'm so worried, yaar. I did not do my paper well.
It's okay, even I have not done well. Let's see what happens.
I think I will fail this time.
It's okay, chill, yaar.
Hey, why so serious, man?
Bro, I don't know what I have written in my paper. I don't know how much I will score. I guess I will fail, yaar. No, bro, I'm not feeling well, yaar. I don't know what will happen.
Let it be, bro. Let's see what going to happen, okay?
Yeah,
let's be cool.
Yeah, bro.
Sit. This is the worst batch I've ever seen. Majority of you have not performed well. If your attitude remains the same, then none of you will be eligible to take up university exam. Now I'll distribute your answer scripts. Come and collect. Roll number 1. You have to improve, man. Roll number 2. Still you need to improve, ma. Roll number 3. See, you have scored 8 out of 50. Is it enough? Is it enough?
No.
See your paper. There is nothing in your paper. If you continue like this, then it's very difficult for you. You have to improve a lot. Roll number 4. You should work hard, man. Improve your presentation. Roll number 5.
Good morning, madam.
Sit down. Shall I distribute, ma'am? Continue. Comparatively, your performance is better, but still you need to work well, okay? Roll number 6. Still you need to improve, ma. Roll number 7. Focus on diagrams. Huh? Roll number 8. This is one more worse paper. What have you performed, man? Huh?
Dr. Sheila?
Yes, ma'am.
Let us talk to him after the class.
Okay, ma'am.
You come and meet us after the class.
Roll number 9. You have to improve. Roll number 10. He's absent? Okay. All of you can leave now. In spite of teaching them so much, they've not performed well, ma'am. Their performance is very poor.
It's okay, Dr. Sheila. We would have done our best. This is their first internals, isn't it?
Yes, ma'am.
Did you give them feedback while giving their papers?
Yes, ma'am. While giving the paper only, I have told them like how much they've scored, whether they have to improve or not, and I have scolded for those students who have not done well also.
Actually, we need to give them individual feedback rather than generalized feedback. There are certain principles of feedback. We need to call the students, we need to talk to them, and so when they see their papers, they can self-assess and see what their shortcomings are. And when we are talking to them, we need to highlight what their positives are, and in between we need to sandwich their shortcomings. So this will help them to improve their confidence and perform better the next time.
Okay, ma'am.
Shall we talk to that student, Akshay?
Yeah. Sure, ma'am, sure. Akshay?
Take your seat. Have you gone through your paper, Akshay?
Yes, ma'am.
How do you think you have performed?
Ma'am, I have performed very badly, ma'am.
Why do you think so?
Ma'am, I am not able to remember anything. I am getting confused what to write, what not to write. My presentation is also not good, ma'am.
You also gone through your paper, Akshay. Some of the answers you have presented well, isn't it, Dr. Sheila? See, his diagrams are nice. But some answers, see, you have not attempted. And this answer looks like you know the concept, but you are not able to present. So what you can do, Akshay, is to do multiple revisions, make a systematic timetable, practice your answers and diagrams. Okay, then you will be able to perform better. Okay?
Okay, ma'am.
So now you know what to do?
Yes, ma'am. I will make a systematic plan. I will try to do multiple revisions so that I can remember the things whatever I am studying. And I will try to present the answers more properly so that my answer looks good, ma'am. I will try to score better next time, ma'am, for sure. Thank you, ma'am.
We also hope to see you perform better next time.
Okay, ma'am.
Have you studied anything?
I don't know, yeah, just study something.
What have you studied? Nothing is going into my head. I'm feeling so tensed. I'm not able to remember anything. I just feel like running away from here.
Hey, don't worry, yeah. Next time you will get a chance now. That time you can perform better, okay? Last time I was also like this, I was very scared. But then after that I worked on my shortcomings and I guess I am feeling confident this time. You will also perform better, yeah. Don't worry.
Now I have realized the importance of feedback. Appropriate feedback method will definitely facilitate the effective learning of the students.
Now I would request the judges to share their views.
So next is right feed and right deed. So
nice concept.
Nice
good
concept.
Work.
So
visuals are nice.
Yeah, it was well made. The quality of the video was good. The composition, okay, everything was good. The construction, okay, the how they propel to the next level, okay, that kind of. Okay, there was
the plot moves from a point to another point.
Okay, it very well. Okay, it is jumping to. Okay, it is proceeding to the next level. Okay, that was a nice. Good work. Yeah. And another thing is the performance also is very good because this is the need of the hour. Because as a teacher, you have to give a proper feedback for the students to understand certain things. So this will make up a proper human, okay, or a student, okay. So how can improve their things? These kind of things were there. but well made. The quality, okay, the composition, editing, even the sound quality also they have maintained it properly. And the doctors, okay, the senior doctors also, how they counsel the students, it was very
that was very important topic, right now. We
Nowadays,
can talk about doctors.
even I am also a teacher, so how you have to treat with them, okay, so somebody will be very dull, okay, so you have to motivate them, okay, so these kind of things is very, very important, okay, so the title also like push. So right feed and right deed, okay, so aptly, okay, fits for the short film, okay,
nice one,
well made, nice one, good one.
Next up we have The Potential Victim, again by Siddhaganga Medical College and Research Institute, Tumakuru.
Hello, ma'am.
Hello, sir.
I have an appointment with the doctor.
Your good name, sir?
I'm Prashant.
Please be seated. I'll let you know. Excuse me, sir.
Yeah.
Sir, there is a patient for you by name Mr. Prashant.
Please send him in.
Okay, sir. Sir, you can go in.
Thank you. Morning.
Yeah, please come in. Take a seat, Mr. Prashant.
Thank you.
How are you?
Yeah, fine, doctor.
It's been a while since I saw you. I don't even see you in my morning walks, or I don't even see you when I drive back home from my office. Is everything all right?
Actually, doctor, I'm little down these days. You know, I got separated from my wife 6 months back. Of late, I'm not able to sleep properly and not able to concentrate on my work too. And now and then I could able to hear few voices, and if I turn around, I see nobody there.
Okay. Is there anything else you want to tell me?
Doc, I think the man who lives down the lane, Mr. Sujay, he's conspiring against me, and he's the reason behind my current situation, doctor.
Who, Mr. Sujay, who lives down the lane?
Yeah.
I know him for a while now, and he's a good man, and he lives with his family, and during weekends he is involved in a lot of community work with us. I don't think he is anyway responsible for what situation you are in.
No, doctor, I'm convinced. He's up to something, and if it doesn't stop, I may end up killing him.
Okay. Calm down, Mr. Prashant, calm down. So the thing is, from what I have gone through your records and your symptoms, you seem to be having what are called as auditory hallucinations, when you start hearing people's voice when nobody is around. And I am afraid to tell you that these could be early signs of a disease called as schizophrenia. So what I am going to advise is, I advise you to stay in our center for a week. I'll put you on some medications, and we'll take it after a week, and we'll see what happens after a week.
No, doc, you prescribe me medications, I'll end up taking it at home.
Okay, it would have been better if you had admitted, but since you insist, what I'm going to do is I'm going to put you on some medications, and you're going to come back and see me in a month's time.
Yeah.
Okay. Okay, Mr. Prashant.
Thank you.
Yeah.
Hello.
Yes, sir.
We are coming from Medical Council.
Okay.
So we want to meet Dr. Shashiraj.
Okay. Please be seated, sir. I'll let you. Excuse me, sir.
Yeah.
Sir, person has come from State Medical Council. Shall I send him in?
Please send him.
Good morning, doctor. I'm coming from State Medical Council. Thank you.
Take your seat, sir.
Thank you. So here is a notice for you.
Okay. Okay, I don't understand what is this all about, sir.
So this is regarding one of your patient, Mr. Prashant, who has killed a person who lives down the lane.
Okay. Oh, I know Mr. Prashant. He had a consultation only last week with me.
Yeah.
And he had early signs of schizophrenia. Initially, I told him to get admitted. Then, once he refused, I put him on some medications and sent him home. That is all I know about him.
Okay.
I don't know how this holds me responsible.
So this complaint is based on the records that he had confessed to you that he is going to kill a person, but you have never tried to detain him.
Okay. I thought that was a part of his disease. That is why I put him on some medications and sent him home. I never knew that I should be informing this to anybody.
The problem is you have not informed the police nor the relatives.
So I'm extremely sorry for the man who got killed, but I didn't know that I should be informing any of these people. I don't know. I am going blank and not much to speak, sir.
Yeah, even I am feeling sorry for your current situation, but you should be knowing that it's the primary responsibility of the doctor to inform the police or the concerned or to detain the patient. I think you have never done that. Probably you will be called for an inquiry next week.
I'll see what can be done.
So I shall leave.
Thank you.
Now, I would request the judges to share their views.
Potential victim. It speaks about a very important topic.
Yeah. So I think a lot of people doesn't know about this rule, like Tarasov rule. Okay. So what a doctor has to do after treating this kind of
duty to warn and protect
these kind of things is very, very informative. Most of the people doesn't know about this. Okay. So even I was shocked too. So we have to inform. Okay. So this is, and the movie also was well made. Okay. And I like the composition of the shots between the doctor and the patient. Okay. Because the patient is little agitated, is not stable, he has kept the angle like a little lower. And the doctor was okay. So these kind of short framing, no, I liked it very, very nice. And
everybody's mindset will be like,
when the medical council officer comes, there little lag is there, but rest of the other shots were very made, and it's one of the very important topic. Okay, so very informative for normal common public also. Okay, so
everybody will be thinking like this. No, doctors' job is to just diagnose and
we also think
medicate
that is
them.
the
They
end of the
medicate them.
job.
That's it.
Okay.
But it has
So
spoken about
inform.
in very different
you
aspect.
have to inform to the police and these things.
That's
we didn't
very
know. Okay, so well
great
made.
and important
So
thing
very
to speak.
informative. Yeah.
Very much addressed. And that was nice.
Next up, we have Positive by MNR Medical College and Hospital.
You're positive for HIV. ప్రతి మనిషికి ఓ ప్రాబ్లం ఉంటుంది, ఓ కథ ఉంటుంది. ఇది నా లైఫ్ అండ్ డెత్ ప్రాబ్లం, ఇది నా కథ. హాయ్, నా పేరు విజయానంద్. నా లైఫ్ గురించి చెప్పాలంటే నాకు నచ్చని ముగ్గురు వ్యక్తులు, నాకు నచ్చి నా జీవితాన్ని నాశనం చేసిన ఒకటి డ్రగ్స్. నేను ఒక క్రానిక్ డ్రగ్ అబ్యూజర్ని. కంటామినేటెడ్ సిరింజెస్ వాడడం వల్ల నాకు హెచ్ఐవి పాజిటివ్ వచ్చిందని డాక్టర్స్ చెప్పారు. కొకైన్ బగ్స్ ఒళ్ళంతా పురుగులు పాకినట్టుంటుంది. బై ది వే, నాకు నచ్చని ఆ మొదటి వ్యక్తి మా పిన్ని.
హలో బాబు.
ఆ పిన్ని.
ఏం లేదు, వచ్చే వారం నీ చెల్లి బర్త్డే ఉంది.
సరే పిన్ని.
దానికి ఒక నెక్లెస్ కొందాం అనుకుంటున్నాను.
సరే సరే.
1,50,000 అవుతుంది, పంపు కాస్త.
నాకందరూ అవసరం కోసం కాల్ చేసేవాళ్ళే. రారా.
రే ఏంట్రా? రే ఏంటిది, ఏం చేస్తున్నావు?
మార్ఫిన్.
మళ్ళీ మొదలు పెట్టేశావా? వదిలేసరా.
నడు.
రే నువ్వు రా ఫస్ట్.
నేను రాను, దుబాయ్.
రే నీకు ఇంకా ఇదే లాస్ట్ టైం చెప్తున్నా, మాకు ఫోన్ చేయ. గుడ్ బై.
నాకు హెచ్ఐవి పాజిటివ్ అని తెలిసాక నా అనుకున్న వాళ్ళంతా నాకు దూరం అయ్యారు. ఫస్ట్ మా ఫ్యామిలీ.
తెలిసింది నీకు పాజిటివ్ వచ్చిందటగా. నీలాంటి వాడు నా కడుపున పుట్టుకుపోవడమే నయమైంది. ఊరికి మటుకు రాకు. నేను నీ ముఖం చూడాలంటేనే మీ నాన్నకు నాకు అసహ్యంగా ఉంది. నీకు ఓ తండ్రి, పిన్ని, చెల్లి ఉందన్న సంగతి మర్చిపో.
నెక్స్ట్ నా నుంచి దూరం అయిపోయింది నా గర్ల్ ఫ్రెండ్. నేను కావాలంటూ నా దగ్గరికి వచ్చింది, కానీ ఇప్పుడు మాత్రం దూరం అయిపోయింది. ఇప్పుడు నేను ఒక ఒంటరి వాడిని. ఇమ్యూనో కాంప్రమైజ్డ్ అండ్ డయాగ్నోస్డ్ విత్ కకోసి సార్కోమా. ఆ రోజు నాకు అర్థమైపోయింది నాకు పెద్దగా టైం లేదని, కానీ నన్ను చూడ్డానికి ఎవరు లేరనే ఒక బాధ. కానీ వీళ్ళు నా కోసం వస్తారని నేను అస్సలు ఊహించలేదు. ఈరోజు నాకు ఈ సపోర్ట్ దొరికినట్టే ప్రపంచంలో కొన్ని లక్షల మందికి ఇలాంటి సపోర్ట్ అవసరం. సమాజం చాలామందిని వెలేసింది. సమాజం వాళ్ళలో చాలామందిని వెలేసింది. మనం ఎప్పుడు చనిపోతామో మనకి తెలియదు, కానీ వాళ్ళకి మాత్రం డాక్టర్లు లెక్కేసి మరీ చెప్తారు. అలాంటి వాళ్ళ మానసిక స్థితి ఎంత భయంకరంగా ఉంటుందో ఒక్కసారి ఆలోచించండి. వాళ్ళకి మనం చేయాల్సింది ఏం లేదు, జస్ట్ ఒక మోరల్ సపోర్ట్ లాగా వాళ్ళ పక్కన ఉంటే చాలు. థ్యాంక్ యూ.
Now I would request the judges to share their views.
The next movie is Positive. Nice movie. The actors have done a great job.
Yeah.
But technically the cinematography was a bit shaky. That was not really nice. And the music which plays on the title card, that was not. It was not synced to the tone of the movie, and that was really.
For me it is little melodramatic, but not gripping also. Something it is losing. Okay, that's content is there, the acting is okay,
that's
but
really a good content.
But little it's not holding the audience. Okay,
we can't connect easily.
Easily. That's my view on this one.
Okay.
And now to show us the power of empathy, we have Patient Empathy, It Starts With You by Siddhaganga Medical College and Research Institute, Tumakuru.
Hello sir, good afternoon.
Good afternoon, sister.
A patient with femur fracture is admitted here. A patient is having trachepnea and trachycardia, sir.
Sister.
Can you please come, sir?
There is a fracture, obviously, so all those signs will be there. Anyways, I'll come, sister. I'll come in a while.
Yes, sir. Thank you. Good afternoon, sir.
Good afternoon, sister.
The patient is in room number 7, sir.
What are his vitals?
So, BP is 100/70, heart rate is 110, sir. Respiration is 28, saturation is 92 in room air, sir.
This is all normal, sister. Come, let's go see the patient.
How is my brother, doctor? Is he okay?
Hey, nothing happened to your brother, man. He's just scared after the accident. Nothing. He's okay.
Good afternoon, sir.
Good afternoon, sister.
A patient with femur fracture is admitted today, and Dr. Raju has seen the patient, sir, and he has advised some medications, but I don't think so. Patient is in stable condition, sir, and that's why I thought I'll call you, and also to say that sir has spoken rashly with the attenders, and they are unhappy about it, sir.
What's wrong with the patient?
So he's having trachycardia and trachepnea, and his BP and saturation slightly dropping, sir.
Shift him to ICU immediately. I'll come to the ICU and see.
Yes, sir. Thank you, sir.
Thank you. Dr. Raju, come to my room, stat. Dr. Raju, what happened to the femur fracture patient?
Sir, he is just one hyperactive and anxiety disorder patient, sir. He's been just hyperventilating, and as expected, sir, because of the fracture, he is having tachycardia and tachypnea, and it's a femur fracture, sir, so the blood loss is expected. So the BP will drop down, and he is hyperventilating. Because of all that, just the patient is, and the attenders are way too anxious, sir.
No, he is little sick now. Let's go see the patient in the ICU. How are you feeling? You're feeling breathless. Okay. Show me the file, sister. So there seems to be some ECG changes. We'll do an echocardiogram. Okay? Dr. Raju, I think we have evaluated the patient. The clinical profile, ECG and echo parameters are suggestive of complication of a fracture. So I think the patient is having fat embolism. So I think whatever treatment has to be started, we have already started. He should stabilize with time. So of late, I've seen that you have been little, disturbed with the patients. What's wrong, Dr. Raju?
Yes, sir, a little stressed out with the long working hours, complicated cases, more number of OTs, emergency OTs, night duties continuously, sir. All these are adding up for that.
So whatever those things, you need to sort them out, and then need to be little empathetic with the patients. That's extremely important in our clinical practice. I think we need to discuss this with the patients. Let's call the attenders and discuss with them.
Okay, sir.
Sir, 10 minutes back, this fellow told me that my brother has no problem, but my brother is now shifted to ICU with oxygen. How do you explain this?
No, I think you should relax, sir. You should calm down. The patient, your brother, is having a complication of a fracture. So he has developed something called fat embolism, where the fat, through the fracture, it has entered the lungs and it has blocked. So that's why he has developed breathlessness. His oxygen levels are coming down. So for that, whatever necessary medications have to be started, we have started, and oxygen needs to be given, that we have started. I think he is stabilizing. So with the time he should stabilize. For this the treatment are medicines only, and those things will be given in our ICU. So with time he will stabilize. Once he stabilizes, all necessary treatment will be given at a later date.
Okay sir, kindly take care of my brother.
Don't worry, whatever has to be done has been done, and that's going on. He should stabilize with time. Okay, we will take care, don't worry.
Thank you sir, thank you very much.
Now, I would request the judges to share their views.
The next one is empathy.
Empathy, patient empathy.
Patient empathy. It starts with you. The concept was very understandable, no? It's more relatable.
Relatable, yeah. So
that's a good thing.
Everybody will have that kind of connect. Okay,
Connected,
so
yeah.
some people will be some doctors in some hospitals they'll be very harsh. They'll not treat. So they have to understand the patient's mindset.
Yeah.
So this was addressed very well in this movie. So how you have to be very empathetic towards the patient, and the acting also the doctors know. So how it's nothing like that. Okay, so the kind of negligence
they have done a
he
good
had,
job. Very
that
good
is,
job.
and quality wise also it was well made. Okay. And
cinematography was nice, audio quality was good,
and I like the performance of the senior doctor. So how
the doctor who comes later,
he's not also scolding the doctor. You have to, he also understand his problem. Then you have to solve yourself.
He thinks for the both sides.
Not both sides. He's not blaming the doctor also. He was also giving advice to, very empathetic to the doctor who is, that is also very nice. Okay, so the performance of the senior doctor.
That's what the movie speaks. The empathy is
on
not
both
only for
the
the
patients, but
even for the doctors
also.
It has to be on the both sides.
Both sides, well made.
He performed in a subtle manner. It was nice, very nice.
Good work.
Good work.
Up next is TB awareness in memory of Shonel Rebello by students of Christian Medical College, Ludhiana.
Shonel. Her name means God's grace that is unmerited. She was just like us, one among us. She was someone who would silently blend in the crowd, yet make her presence known. Always eager to make changes, to get wheels spinning, to stand up for what she believed in, always ready to learn. But we had to bid farewell to this beautiful soul on the 29th of January 2021. 22-year-old Shonel was diagnosed with abdominal TB and was taking treatment for the same. The COVID-19 pandemic has reversed all global progress that has been made yet with regard to this disease. According to an article by the Tribune, Ludhiana, where Shonel studied, has the highest TB burden in the state. So what can we do? How do we identify the symptoms and seek treatment? Let's find out.
What? 50 kgs? God, I've actually lost a lot of weight. The last time I checked, it was almost 65 to 70. At least 15 kgs. Plus, look at all my clothes. They've got so loose. I think I'm going sick.
Wet your hands, then apply soap. Rub hands palm to palm. Then lather the back of your hands. Then scrub between your fingers. Clean the thumbs. Rub the fingernails. Rub the wrists. Wash the hand again. Rinse it.
सौरभ हेलो सौरभ
आरुष आज आ रहा है खेलने के लिए?
नहीं यार मैं खुद को आइसोलेट कर रहा हूँ मैं किसी से मिल नहीं रहा हूँ
आइसोलेट कर रहा है खुद को? हाँ जी आपको क्या हुआ है?
जी खांसी जुकाम
Hello everybody, I'm Nishma here and I'm Shonal's sister. So Shonal and we have been 19 years together by God's grace, and I'm really blessed to have a sister like Shonal. So there is a lot I could say about her, but if anybody asks me to describe Shonal in few words or a few sentences, then I would really start off by saying that she was never a hypocrite. I mean, Shonal always, she did what she said. It's not like she'll think something and say something else, or say something to please somebody or be in their good books or something. Never. She always was a person who stood for her beliefs, even if it is contradicting to somebody else's or something. She would always stand up for what she believed in. And Shonal has always been a very, very hardworking kid. Right from school, I mean, for all the exams and everything, be it assignments or projects or anything, she would always put in her best efforts. So whenever the results were not as she had expected or not equal to the efforts that she had put in, Shonal would never let it hinder from putting her best in the next time she worked for something. So she was pretty hardworking that way, and all the teachers in the school, everybody appreciated her a lot for it. And Shonal has always been a very great confidant. I mean, if you tell her anything and just tell her not to tell anyone, then she would really respect it, and she would take it to her grave or something. She would really respect that confidence. And Shonal, she was a very humble and down-to-earth person. I mean, always in the sidelines or something, but she had a really big impact on everyone. So there is a lot we can actually learn from her life, but some things which I really, really admire about her is that she was a very obedient child. She never went against mom or dad's decisions in any way. Even when she wanted to not attend class, she would call mama and say, "Mama, I'm not attending class. I'm just staying in the library, or I'm staying in the room and studying anything." She was very honest. Okay, so even though she is not with us now here, her physical absence is there, but I don't actually feel that she's gone somewhere or something. Somewhere I just know that she is with me, and I really look forward to meeting her. She's not lost or anything. I just don't like to say that I lost my sister or something, because she's not lost actually. She's only gone back to her creator, and I really, really look forward to meet her. So that's that.
I request the judges to give their opinion about the film.
Okay, the next movie is TB Awareness in memory of Shonali.
Yeah.
That was really sweet video.
the starting of the video was using the images of the girl.
That was really touching.
That arc was good.
Yeah.
But for me, little they have deviated from that story. They have shifted from the title is on the particular girl, but later it shifted to the other characters. Okay, I think
they would have kept that as in essence of the movie, and they should have made
another one. Okay, but
showing different characters, no. For example, they are showing for a cough they are showing a guy. For sneeze they are showing different things, different symptoms they are showing different characters. But if they have made a story like one particular patient having all symptoms, that would have more effectiveness. That would be more effective.
And one more thing, technically little audio quality was not that good. Okay, so they would have made the fiction story out of it. Okay. The slowly starts with the kind of documenting it is about that girl, but slowly it's deviating out of that.
They would have replicated some story of the girl. Maybe it will be nice.
Also,
no? Based on true events, it will be nice.
Like that.
But still, it's a good work.
Good work.
Yeah.
Up next is The Dream Killer by Arupadai Vidu Medical College.
நான் லேட் ஆச்சு, நான் கிளம்புறேன்.
டேய் பால் குடிச்சிட்டு போடா.
Come on guys, faster. என்ன நிஷாந்த் இன்னைக்கு லேட்டா?
சாரி சார்
வர லேட்டா வரதே
சாரி
வரேன்.
சார்.
ரொம்ப கோச்சிங் இருக்காருப்பா.
பையனை வந்து ஜிம்னாஸ்டிக்ல சேர்க்கலாம்.
கண்டிப்பாக சார் சேர்த்துக்கலாம் சார்.
இந்த கேமை பற்றி ஸ்கோப் எப்படி சார்? இது வந்து நிறைய பேருக்கு தெரியாது இந்த கேமை பற்றி.
நிஷாந்த் வா. இவன் தான் சார் நிஷாந்த். ஆக்சுவலாக மற்ற எல்லாத்துக்குமே ஒரு இன்ஸ்பிரேஷன் மாதிரி. கோச் பண்ணதிலே வந்து பெஸ்ட் ஸ்டூடெண்ட். ஜிம்னாஸ்டிக்ஸில் மொத்தம் 6 ஈவெண்ட் இருக்குது. அந்த 6 ஈவெண்ட்லேயும் கோல்டு அடிச்சு ஒருத்தன் மட்டும்தான். அதுவும் இல்லாமல் ஸ்டேட் சாம்பியன்ஷிப்பில் 6 டைம் வந்து கண்டினியூஸாக கோல்டு மெடல் அடிச்சு ஒருத்தன் மட்டும்தான். இதே மாதிரி விளையாண்டானா அவன் நேஷ்னல்ஸ் ரீச் ஆயிடுவான். ஒன்ஸ் நேஷ்னல்ஸ் ரீச் ஆகிட்டான்னா அவன் லைஃப் வேறு லெவலில் போயிடும். இவனை இன்ஸ்பிரேஷனாக வச்சு மற்ற பசங்களும் மேலே வருவாங்க. சரிங்களா? அப்புறம் கேமும் டெவலப் ஆயிடும். மற்றபடி இந்த கேம் கற்றுக்கிறது எல்லாமே அவன் இன்ட்ரெஸ்ட் தான். அவனுக்கு இன்ட்ரெஸ்ட் இருந்துச்சுன்னா அவன் வந்து நல்லா மேலெல்லாம் ஷைன் பண்ணலாம்.
என்னடா கோச் மேலே இவ்வளோ நம்பிக்கை வச்சுருக்காரு?
ஆமாண்ணா, இந்த வருஷம் தான் கடைசி வருஷம். இதை பார்ட்டிசிபேட் பண்ணி ப்ளேஸ் பண்ணிட்டேன்னா அப்படியே அடுத்த ஒரு போயிடுவேன்.
அப்படியா? காம்படிஷனுக்கு இன்னும் எவ்வளோ நாள் இருக்குடா?
அது இன்னும் 1 மாதம் இருக்கும்ண்ணா.
ரொம்ப டைம் வேஸ்ட் பண்ணாமல் நாளையிலேருந்து இன்டென்ஸாக ப்ராக்டிஸ் பண்ணு.
ஆனால் நான் நாளையிலேருந்து கரெக்டாக பண்ணிடுறேன்.
சரிடா.
சரி, நான் ஸ்கூல் டைம் ஆச்சு, நான் கிளம்புறேன்.
ப்ரோ
டீவன்டா. ஹாய் ப்ரோ.
ஹாய். சரி மச்சான், வா போய் ஒரு கட் ஆஃப் போடுவோம்.
மச்சான் டைம் ஆச்சுடா, ப்ராக்டிஸ் பண்ணுடா.
இவனுக்கு எடுக்கிறதே நீ தான்டா. வரா பார்த்துப்போம், ஒரு நாள் தானே.
மச்சான் 3 வாரத்தில் காம்படிஷன் வருதுடா, போகணும், ப்ராக்டிஸ் பண்ணணும்.
வரமாட்டேன்
சொன்னால் கேட்க மாட்டேன். போவா. சரிடா, பார்ப்போம்டா. பாய் ப்ரோ. என்ன மச்சான் பண்ணுறது, எல்லாம் நடக்கிறதாண்ணா. சரி, ஒரு லைட் சொல்லு.
லைட்ஸ். ஆமாம், டெய்லி ப்ராக்டிஸ் போய் என்ன பண்ண போகிறேன்?
ஒன்றும் இல்லை மச்சான், இந்த வருஷம் தான் கடைசி வருஷம். எப்படியா மெடல் அடிக்கணும். இனிமேல் சிகரெட் வேறு அடிக்கக்கூடாது. உன்னை மாதிரி பண்ண முடியறதில்ல.
அப்போ இனிமேல் அடிக்காத மச்சான்.
டேய், நீ தானே கூப்பிட்டு வந்த, வா ஒழுங்குதே கிளம்பு.
ஹலோ
டேய் இன்னைக்கு சாட்டர்டே ரோட் ரன் இருக்குன்னு தெரியாதா? சீக்கிரம் எழுந்து வாடா போலாம்.
சாரிண்ணா வந்துட்டேண்ணா கிளம்பிட்டேண்ணா.
முன்னாடிலாம் 6 மணி போயிடுச்சுன்னா 5:30 மணிக்கே வருவோம். இப்போ முன்னாடி மாதிரி இல்லை, வரவே மாட்டேங்கிறான். டேய் நிஷாந்த்
வந்துட்டேண்ணா.
வாடா வாடா. ஏன்டா லேட்டு?
சாரிண்ணா வரேன்ட்டேன் வாங்க.
நேற்று ஏன்டா வரல?
ஹோம்ஒர்க்ண்ணா, அப்புறம் வீட்டில் இருந்துச்சு, இல்லாட்டி வந்திருப்பேன்.
கமான் கைஸ், கொஞ்சம் நேரம் லேட் ஆகும், நம்ம ப்ராக்டிஸ் ஸ்டார்ட் பண்ணலாம். கமான் நிஷாந்த், நீ ஸ்டார்ட் பண்ணுற. வா. ஏண்டா என்னாச்சு?
மூச்சு வந்துச்சு, நான் இன்னொருக்க கரெக்டாக பண்ணுறேன்.
சரி போ, பரவாயில்ல, நல்லா பண்ணு.
சார் ஏன் என்னால் முன்னாடி பண்ண முடியல? இந்த வாட்டி கரெக்டாக பண்ணும்.
டேய் என்னாச்சுடா?
அண்ணா
என்னாச்சு?
முடியலண்ணா, நான் மூச்சு விட முடியலண்ணா. அண்ணா 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 முடியல.
டேய் தூக்குங்கடா.
டேய் என்னடா ஆச்சு? எங்க இருக்காம?
உள்ள கூட்டிட்டு போனாங்க.
சார் நிஷாந்த்
டெஸ்ட்டுக்கு கொடுத்துருக்கோம். எக்ஸ்ரே சேஞ்சஸ் பார்க்கும்போது சிவப்படி மாதிரி தான் இருக்குது. மேபி ஸ்மோக்கிங்னால இருக்கலாம். எதனாலும் டெஸ்ட் ரிப்போர்ட் வந்ததும் சொல்கிறேன்.
சரி சார். அடுத்த மாதம் நேஷனலில் வச்சுக்கிட்டு இப்படி வந்து படுத்து கிடக்குறான் அவன். இவ்வளோ வருஷம் கஷ்டப்பட்டதெல்லாம் வீணாக போச்சு.
நிஷாந்த் எஞ்சி உட்காருங்க. இருமல் எவ்வளோ நாளாக இருக்குது?
3 மாதமாக இருக்குது சார்.
சளியோட வருதா சளி இல்லாமல் வருதா?
சளியோடு தான் சார் வருது.
சளி என்ன கலரில் வருது?
மஞ்சள் கலரில் வருது சார்.
என்ன பண்ணால் இருமல் அதிகமாகுது?
ரொம்ப நேரம் ஓடினா சார், அப்புறம் மூச்சோட கஷ்டமாக இருக்கும்.
மூச்சோட கஷ்டமாக இருக்கா?
ஆமாம் சார்.
ஓடும்போது மட்டும்தான் மூச்சோட கஷ்டமாக இருக்கா இல்லை நிற்கும் போதேவா?
நிற்கும் போது இல்லை சார், ஓடும்போது மட்டும்தான் சார்.
நெஞ்சு வலி எதுவும் இருக்கா?
அதெல்லாம் இல்லை சார்.
எத்தனை வருஷமாக ஸ்மோக் பண்ணுறீங்க?
3 வருஷமாக சார்.
ஒரு நாளைக்கு எத்தனை சிகரெட் அடிப்பீங்க?
ஒரு 3-4 அடிப்பேன் சார்.
காய்ச்சல் எதுவும் இருக்கா?
இல்லை சார்.
மூச்சை நல்லா இழுத்து விடுங்க. 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 ஸ்போர்ட்ஸ் மேனாக இருந்துட்டு சிகரெட்லாம் அடிக்கிறியாப்பா? இதோட நிப்பாட்டிக்கோ. சீம்ஸ் டு பி ஹைப்பர் இன்ஃப்ளேட்டட் லங்ஸ். சரியா பார்த்தா டெய்லி ஒரு 5-6 அடிப்பை போலையப்பா. சரி படுத்துக்கோங்க. ஆக்சிஜன் சப்போர்ட்டில் இருங்க. எதனா பிரச்சனை இருந்தால் உடனே கூப்பிடுங்க, சிஸ்டர் வந்து பார்ப்பாங்க.
என்னாச்சு சார்?
எல்லாம் தப்பான செயற்கையால் வந்தது சார். சிஓபடி மாதிரி இருக்குன்னு சொல்லியிருக்காங்க. ஸ்கூலுக்கு போகும்போது வரும்போது சிகரெட் அது இதுன்னு கண்ட பழக்கத்தை பழகிட்டு குட்டிச்சவராக போயிட்டான். 1 மாதத்தில் நேஷனலில் வச்சுக்கிட்டு என்ன பண்ண போகிறான்னு தெரியல.
எல்லாம் உங்களால தான்டா. உன்னை வந்து வச்சுக்கிறா. இன்னும் 3 வாரத்தில் நேஷ்னல்ஸ். இந்த நிலைமையில் எப்படி நீ பார்ட்டிசிபேட் பண்ண முடியும்? பார்ட்டிசிபேட் பண்ணியிருந்தால் கண்டிப்பாக மெடல் அடிச்சிருப்ப. இப்போ பாரு, உன் சிகரெட் பழக்கத்தினால உன் கனவாகவே முடிஞ்சிருச்சு.
நிஷாந்தோட அட்டெண்ட் உள்ள வாங்க.
சார் என்னாச்சு சார்?
நிஷாந்தோட அட்டெண்டரா?
ஆமாம் சார்.
ஸ்பைரோமெட்ரி டெஸ்ட் எடுத்து பார்த்தோம். ரிப்போர்ட் பார்க்கும்போது சிஓபிடி மாதிரி இருக்குது. அதாவது நுரையீரலில் ஒரு அடைப்பு மாதிரி. ஸோ அது இந்த வயசு பசங்களுக்கு எப்படி வரும்னா நிறைய ஸ்மோக் பண்ணும்போது வரும். ஸோ அவனால் இப்போது எந்த ஸ்ட்ரெஸ்ஸுமே பண்ண முடியாது. இப்போ கூட ஆக்சிஜன் சப்போர்ட்டில் தான் வச்சுருக்கோம். ஸோ இன்னும் ஒரு 6 மாதத்துக்கு எந்த ஒரு ஸ்ட்ரெஸ்ஸான ஒர்க்கும் பண்ணாமல் பார்த்துக்கோங்க.
சார் அவனுக்கு 3 வாரத்தில் என்ன நேஷ்னல் சார்?
இல்லை, அதுக்கெல்லாம் வாய்ப்பே இல்லை. போனால் இன்னும் அக்ரவேட் தான் ஆகும். அது அவன் உயிருக்கு கூட ஆபத்தாக முடியலாம். ஸோ இப்போ அவனை மேட்ச்சுக்கு எதுக்குமே கூப்பிட்டு போக முடியாது. அவனால் இப்போ ஓடவே முடியாது. இப்போ நடக்க சொன்னால் கூட ரொம்ப மூச்சு வாங்கும். ஸோ அந்த நிலைமையில பண்ண முடியாது. சரிங்களா? ஸோ மருந்தெல்லாம் எழுதி கொடுத்துருக்கேன். இன்னும் 2 நாள் டிஸ்சார்ஜ் ஆகிற மாதிரி இருக்கும். பார்த்துக்கோங்க. Okay, take
Smoking tobacco not only affects your life, it also affects your dream. Say no to tobacco.
I request the judges to give their opinion about the film.
Okay, the next movie is Dream Killer. This film talks about the one of the oldest and most important topic.
But still it is there. So it's really a dream killer. So the gymnastic and all he played on the beach, that was good. That was really we have used gymnastic play a person like sports person they have used. But little lag was there in the movie, little lengthier also. And certain scenes, unwanted scenes was there. Okay, a father comes and but it is related. But how effective it is adding value to the
made in another way to look even more effective.
Effective.
It would have made the duration somewhat smaller.
And it would be the length should have cut. And the I think the casting of this short film, so the trainer, he looks
so young and
he
doesn't look like a
master or a trainer kind of thing. That's casting they should have done little better. So that's
and
what.
Even cinematography have
little
it's like somewhat an old or an it was shot in a
the exposure was not that much bright. So little quality was less. But rest of the thing, but it is a hot topic. Still, it is there. It's really a dream killer.
Really, it has to be addressed. But
particularly for sports person and all, they have to avoid these kind of other smoking and other things. Nice. So good work. It's kind of a more of a PSA style.
Definitely yes, correct.
Yeah.
The next film is Utopian Dystopia by Uttar Pradesh University of Medical Sciences, Saifai Itawa.
It is the year 2022 and modern medicine has come a long way. But can we call a system of medicine truly modern when the poor can't avail those services? Let's find out. To figure this out, let's go to a village in North India, Ujjaini. It's adjacent to our medical university in Saifai. I needed to find someone who had a good idea about the diverse population that lives there. That is why I met the former head of the village, Uddham Singh. Let's see how aware are the people of this village about health related issues and hygiene.
बीमारियों को लेके आपको ज़्यादातर जो जानकारी प्राप्त होती है वो कहाँ से आप प्राप्त करते हैं? अखबारों से या फिर जो हम लोग गांव में आते हैं कैंपेन करते हैं, या फिर आप कहाँ से न्यूज़ से पता करते हैं? कहाँ से पता करते हैं बीमारियों के बारे में?
बीमारी जब है तो अपने आप अफसर जाइए, डॉक्टर बताइए जब बीमारी है तुम्हें, अब आप इलाज करें डॉक्टर। वैसे तो आदमी जो जाता है बीमार है तो इलाज करो। मैं तो अस्पताल जाए पता लगे बीमारी कौन सी तुम्हें है।
वैसे यहाँ मतलब अपने स्वास्थ्य को लेकर जागरूकता कैसी है इस गांव में?
कैंपू लगा रहा।
नहीं जैसे लोग यहाँ साफ पानी पीने के लिए, साफ सफाई रहने के लिए,
साफ पानी पीने के लिए आप तुम लोग लगाया था, सो सब बताते हैं। अच्छा, और पानी की सुविधा है? हम जैसे लोग इतने के घर फिल्टर तक लगा हुआ है। अब सब कितने लोगों के लगे गाँव तो हम तो घर घर हमारे घर लगा है। हमारे घर फिल्टर लगा है और 2 आदमी और 3 लेटरें बनी। हम केवल 2 लोग हैं, हमारी पत्नी, और लेटर 3 बनी, 2 इधर बनी और 1 ऊपर बनी।
It seems the residents of this village have a fair idea about the health services, given the fact that this village was adopted by our institute. But how many people can avail these health services? Is the system even equipped to handle the needs?
अच्छा, आपको क्या लगता है जैसे अस्पतालों में तब भी, हालांकि सरकारी अस्पताल में खर्च तो बहुत कम आता है, लेकिन इलाज और पढ़ाई बिल्कुल ही मुफ्त होनी चाहिए, क्योंकि इसकी वजह से जिनको सबसे ज़्यादा ज़रूरत है उन तक पहुंच नहीं पा रहा है। इलाज बिल्कुल ₹0 खर्च होना चाहिए।
अच्छी बात है, हम कोई बुरी बात नहीं, लेकिन बाबू शून्य करो तो इलाज हो तो कुछ लगता रहेगा। अब जैसे मान लो कुछ पैसे ही नहीं लग रहे तो जो जुकाम बहुत प्राथमिक स्वास्थ्य केंद्र नहीं जाएंगे, बड़े अस्पताल में पहुंच जाएंगे। जुकाम को नहीं पैसा लेके जहाँ में वो मरीज जाए बड़े अस्पताल में जो वास्तव में उसके पात्र है। अब लाइन जाई में लगाए बैठे बाम जाई नहीं,
तो जब अगर बड़े अस्पताल में शून्य किया जाएगा तो प्राथमिक स्वास्थ्य केंद्र में भी शून्य किया जाएगा। मतलब मेरा ये कहना है
जहाँ में पैसा लगाना चाहिए। हाँ, हमारी सोच में बड़े अस्पताल में कुछ पैसा लगाना चाहिए कि जिससे छोटा मोटा मामला है, जुकाम भाव है तो बा में कहा हो, जहाँ में वही लोग आए जो इसके काबिल है। हमारी सोच है, हम तो जरूर करें, सरकार करे सोच भाई।
Our primary care health centers need to be strengthened. A large number of patients with mild illnesses, they come to tertiary care centers when their illnesses can easily be treated at the primary centers. What this leads to is the patients with serious illnesses, they are unable to meet the doctors a lot of time due to the large line that exists in most of our government institutes.
बड़े अस्पताल में उसको 10 रुपये कम का पैसा लगना चाहिए, कम से कम। और हम तो कल 20-25 को क्यों? जो उसमें जब भीड़ कम होगी तो ढंग से देखेंगे। अब 3 से मरीज देखना डॉक्टरों, तो डॉक्टरों को हमारे लगा बच्चा तो डॉक्टर है। 300 मरीज एक आदमी कैसे देख लेगा? नहीं देख लेगा, भाभा ही काटेगा। मैंने कहा आएगा ही, लेकिन चलो जाओ अब उठेगा ही, मैंने अपने लगा तुम्हें बैठा दो, तुम 3-4 साल में पढ़ रहे तुम्हें तो आए हमारे लगा, हमारे अंदाज में रहा है। तुम डॉक्टर भी बनने की कोशिश में पढ़ो, पहली साल का लगा तो सीखता ही सकता है। तो अब तुम्हें आएगा, तुम्हें बैठा दो, करो बड़ा पर्चा, डॉक्टर चले कायदा जो है डॉक्टर जाना नहीं चाहिए, डॉक्टर बगल में बैठे, आप तुम्हें पर्चा भले बनाओ, अब चलेंगे पूरी छुट्टी करके कि हम घूमन जाए रहे और तुम बैठो। ये गलत बात है। आकर तुम 1 लाख रुपया तनख्वाह पाए रहे हो तो आदमी आस लगाए गया है, जाएगा ना गया कि भाई इतने बड़े जो MD डॉक्टर बैठे हैं या MS बैठे हैं जिनकी योग्यता हमें मिलेगी। अब यहाँ अस्पताल खोले बैठे, सब MBBS बैठे खोले, तो उनसे तो जो योग्य हैं जिनकी योग्यता हमें मिले। पैसा हम दे रहे तैयार हैं, लेकिन पैसा लेवाइयों को नहीं है। लेकिन आदमी सोचता है पैसा लगे तो लग जाए, तो हमारा सही लगेगा। फ्री वाले कुछ लोग मजबूरी है तो फ्री, लेकिन मजबूरी कर्ज काट लेगा आदमी। चाहता है कि हमारा घर का मरीज अच्छा फायदा हो जाए, भले पैसा लग जाए, जब सोच के हमारी समझ में ज़्यादा लोग। ठीक है।
He has highlighted one of the problems that exist in almost all government institutes, but nothing much is done about it. First is doctor to patient ratio, and second, it's the growing dependency on junior doctors. Do people trust them enough?
क्या ऐसा सही रहेगा जब मरीज जब दिखाने जाते हैं तो एक तो है कि आपने अच्छे से दिखाया, डॉक्टर ने अच्छे से देखा, इलाज लिख करके भेज दिया, क्या डॉक्टरों को उस बीमारी के बारे में मरीज को समझाना चाहिए कि ये क्यों होता है, कैसे हो रहा है?
अभी तक टाइम कहाँ है समझा सब। आप मान ली बात हमने आपकी, एक डॉक्टर 300 मरीज देखना पड़े, कैसे समझाएंगे?
हाँ, यही बात है
भाई। जैसे हमने जो बात पहले कही थी भाई, अब 20-25 रुपये लगे तो जो वास्तविक मरीज है बड़ा, जिसको बड़ी बीमारी है, वो वहाँ पहुँचेगा।
नहीं तो ये आप तो ये कहना चाह रहे हैं कि मैंने कितने लोगों को देखा है जिनके यहाँ से इटावा से सैफी आने के 20 रुपए लगते हैं, लेकिन उनके पास वो 20 रुपए देने के भी नहीं रहता है। लेकिन बड़ी बीमारी उनको भी कैंसर होता है।
हाँ,
उनको
तो अब इटावा से आए, सुनो अब तुम्हारी बात काट रहे, बेटावा से नहीं औरैया से आई, इटावा की बात छोड़ दे, 100 रुपए किराए में लग गए, बे यहाँ आए और लाइन लगी है, तो बिना को नंबर आए पाओ है बहुत देर में, और यहाँ जुकाम वाले लाइन पहने लगे, पहुँच गए 8 बजे, तो बे जुकाम टाइम काट रहे।
हाँ वही, वो तो ठीक है।
हमारा मतलब जो है कि बे जुकाम वाले पहुंचे प्राथमिक स्वास्थ्य केंद्र, और यहाँ भीड़ कम हो जाएगी तो डॉक्टर को टाइम मिल जाएगा। जब मेरी सोच है, अब हमारी सोच तो काम करेगी नहीं, काम तो राजन की मंत्री की सोच काम करे।
Patients travel to far away places just to get treated, and this is often a deterrent in their proper and timely treatment. This is a bigger problem for the poorer section of the society, for whom the travel expenses are way too much, and these are the people who cannot even afford to buy medicines, and a considerable amount is spent while traveling. A functional tertiary care hospital in each district seems to be a very good idea.
और अस्पताल में जैसे आपने व्यवहार कैसा देखा है लोगों का, डॉक्टरों का या नर्सेस का?
वो तो अच्छे भी हैं, और एक डॉक्टर ऐसे एक मिनट हमें बोल रहे एक डॉक्टर थे हमारे पास, अपनी खुद की बात है, जब कि हमारी तो कल हम पहुंचे अस्पताल में, तब भी बिन डॉक्टर ने हमने हमसे जब पूछी, और जो डॉक्टर हैं अब है मौका, वो उसने इतना घटिया डॉक्टर है कि हम उस दिन खुद को बैठते थे, और हमें बीमार बने रहे, मजबूरी बने भैया हम जाएंगे नहीं, तो उसने इतना गंदा बवाल किया मेरे साथ।
तो आपको ऐसा लगता है कि अगर व्यवहार
इतनी बदतमीजी भाषा मैंने प्रयोग की,
व्यवहार अगर सबका सही रहेगा तो गरीब लोगों का स्वास्थ्य अस्पतालों पे डॉक्टरों में भरोसा थोड़ा बढ़ेगा थोड़ा, और
अच्छा आप जाऊँ कहो सभी ऐसे दूसरे डॉक्टर भाई इतने अच्छे हैं, बहुत ही अच्छे, और हम कह रहे हैं जब ब्रादरी बात कह रहे हैं, हमारी ब्रादरी का ही है, मान लो वो नालायक है नंबर 1 का, और बेकार है, और इतना सुंदर को आ रहे हैं कहा कि हम कुछ कह नहीं सकते। जब बात आपने कह वो तो इंसानियत की बात अलग है, इंसान कौन कैसा है, डॉक्टर हो और चाहे आप लड़का पढ़ना आए, सबके सोच अलग है और सबके व्यवहार अलग है, अच्छे सब में हर जात में अच्छे। एक आदमी का होगा अहिरी जब खराब हो तो अहिर खराब नहीं, अहिरों में अच्छे आदमी का 100 आदमी है तो अच्छे भी है और खराब भी है, अच्छे बुरे सब में है। वो इंसान खुद ही खराब होता है, डॉक्टर बन जाओ चकंज बन जाओ खुशते ही होते बाजी, और बाजी सुंदर व्यवहार है, और वैसे कहा जाए डॉक्टर को तो सुंदर होना ही चाहिए। डॉक्टर वही सफल है जैसा का व्यवहार अच्छा है, क्यों मरीज जाता दुखी और डॉक्टर ने प्रेम से बोल दिया और मैंने समझाया सुन ली बाकी बात, और दादा मरीज तो सोच रहे इनने हमें जब वो दवा यूज कर जाएगी फायदा 90% फायदा ही करेगी, जो डॉक्टर ने प्रेम से बोल के ढंग से बात देख लिया। अच्छा जब हमारी सोच है, हम नहीं कह रहे।
Bad behavior in the healthcare setting can drive the people who are suffering the most away from healthcare. These people would not want to be humiliated and would keep on suffering, and the presentation of the disease will be further delayed if we do not solve this.
हम तो यार हर आदमी अच्छा, अब मौत तो जिंदगी तो सभी की जब आई है तो उसमें भाई डॉक्टर ही मर जा।
We are working day and night to improve the quality of healthcare, but only when we talk to the real stakeholders, the public, do we get to realize the gaps that are present in our existing healthcare. This conversation helped me realize that even with an underdeveloped infrastructure, there are ways through which we can deliver our health services better and more efficiently. Let's work towards that. Where there is a will, there is a way.
I request the judges to give their opinion about the film.
Okay, the next one is Utopian Dystopia. No, it's the video looks more like a TV show, no?
Yeah.
So produced by a news channel or something like that.
He directly speaks
to the camera, which is not like in a short film or a short movie.
Kind of thing. So he visits a village and the village head also. I think the understanding of the concept is little okay on the surface level. I understand,
yeah.
but instead of meeting a village head, you can go to a particular
some low level.
Okay, so normal common man from the village, okay, normal person, not as a head
more,
level. That will be more relevant. Okay, so that's what my view on this utopian thought.
No, even though if they have made it only a conversation, it will be a more good thing,
effective.
I think.
So in between he comes and okay,
he's coming and directly speaking to the camera.
Instead of talking like that, would have made a story
out of it. That would be nice.
Would be nice. Okay, so fine.
Oh, that's the thing. Even if a person comes there, talks directly to the camera, no, it doesn't make you can't connect anything to it.
Sometimes
that's like a compare speaking.
We can speak, but on certain topics. Okay, so. Okay, good.
Fine.
Next in line is Double-Edged Cure by Christian Medical College, Ludhiana. I request the judges to give their opinion about the film.
Okay, the next movie is Double-Edged Cure. It was really a nice concept which speaks about ethics.
Ethics and all. Okay, so they have given and led to us the viewers okay, whether it is good
or it's right or wrong.
It is wrong. Okay, so how to take it in some
to some extent it's good.
Good, yeah. So but the making way that is narrative and all, it is good. Okay, and I think she would have made a conclusion also. Okay, I think she would have decided at the end. She might have told that this is what happened.
Told her friend, this is what happening. You should take the medicine
like that.
Because she has changed somewhat, right?
Yeah, somehow. Now you can understand that you are able to you have hungry and you are able to eat something. So like this, the friend can persuade the particular other person. Okay, so it would have been better. Okay, if she had done that way. So
and technically they have made dialogues as captions, no?
Captions,
They are not talking.
That is also time. Okay. So they have to interact. Okay, so
the interaction makes more interesting.
Short film is an audio-visual medium. We have to use both. Okay, so it has to complement each other. Okay, so that's
basically the concept of movie is to know.
Okay, so visual as well as audio also should be.
That's what makes it a movie. Screenplay, not only the screenplay, the dialogues.
Yes.
Everything combines to. That's what the movie is.
Yes, sure.
But still, it's a good try.
Good try.
Up next is Eye Donation Awareness, a documentary by JIPMER Puducherry.
A lot of big celebrities are doing that, so it is getting encouragement nowadays. Like I should have. It's a good cause, right?
No. Eye donation is like what? It's after someone dies, if you like donate your eyes to someone who is blind or partially blind, then he or she will help promote it.
I don't know more about that.
Actually, people don't know about this. That's the main problem that I think.
எல்லாருக்கும் அதை பற்றி ஒரு ஜென்ரலாக யோசிக்கணும், பயம் எல்லாருக்கும். வெரி வெரி ரிஜிட்.
தெரியாத தன்மையினால தான். அதை நல்லா தெரிஞ்சு உணர்ந்தவங்களா இருந்தால் சரி, நம்ம ஒரு ஜானம் செத்த பிறகு என்ன பண்ண போகுது, மற்றபடி பூமியில் உயிராக இருக்கிறவங்க கொஞ்ச நாள் அதை கண்ணை வச்சாவது கொஞ்சம் படிச்சு போட்டோம்.
It might be a lack of awareness because otherwise people might be willing to do it.
சில பேர் வந்து இறந்துட்ட பிறகு அந்த கண்ணை எடுத்துட்ட பிறகு அது என்ன ஒரு ஃபேஸ் அழகில் மாதிரி உள்ள வாங்கின மாதிரி இருக்குல்ல, அதனால் சில பேர் அந்த மாதிரி கொடுக்க மாட்டேங்கிறாங்க.
They don't want to trouble like the dead body. They don't want to trouble the dead body like that. They are thinking.
People get aware, they show
அதாவது அவேர்னஸ் இருக்காதனால கொடுக்குறது இல்லை. அவேர்னஸ் இருந்துச்சுன்னா வந்து எழுதி கொடுத்தாச்சுனாக்கா அவங்க அந்த இது பண்ணி எடுத்துடுறாங்க.
Maybe like if someone wants some weaker eyes, like someone wants spectacles.
Like all those are myths, like if you donate your eyes next birth you'll be blind and stuff. All that is not true.
கட்டுறதுக்கப்புறம் அவங்க கண்ணெல்லாம் எரிச்சிடுறாங்க, ரெடி பதிச்சிடுறாங்க, அது மக்கி போகுது. ஆனால் அதை உயிரோட கொடுத்தா அது நிறைய யூஸாக இருக்கும். அது மட்டும் இல்லாமல் நிறைய பேர் பார்ப்பாங்க இந்த உலகத்தை.
they should educate them. Even though they are in a sad situation, if my parent died also, I may be very sad. Somebody should educate me. Why don't you do this and that?
கொடுக்கணுங்க நல்லது தான் வீணாத்தோன்னா போச்சு மண்ணில் வீணாக போகிற ஒரு பொருளை வந்து அதை ஏன் இன்னொருத்தங்க பயன்படுத்துமோ அது நமக்கு தான்
More effort is put into that, like some program is set up for particularly for this.
It doesn't hurt us after we die to donate an eye. So if one person can donate both of his eyes and two people will get vision.
सबको आई डोनेट करना चाहिए. Keep donating eyes. You want to donate our eye?
You told us the thing about it, so maybe it is in our head now. We'll do something which can help us in this cause.
Hey?
මොකක්ද?
හිනාවනේ.
මේ පොතේ තිබ්බ දෙයකට
මොකක්ද ඒ?
ඒ තමයි කොරග ගහ යන මිනිස්සෙක් දැකලා තව මිනිස්සෙක් අහනවා ඇයි ඔයා කොරග ගහන්නේ කියලා. එතකොට අර කොරග ගහ ගිය මිනිස්සයා කියනවා ඒ මගේ මේ දතේ අමාරුවකින්ද කියලා.
බලලා ඉවර වෙලා මටත් දෙනවද?
පොතද?
නෑ. S2.
To donate your eyes, you could call up JIPMER Eye Bank at 2275 Our team will reach immediately, as early as possible, to collect the eyes at your doorstep. Thank you.
I think I want to donate my eyes.
I am ready for right my eyes.
நான் கொடுக்கணும் தான் என்னோட ஆசையும் அது ஒரு எண்ணம் இருக்குது தான் எனக்கு கொடுக்கலாம் அவங்க
I request the judges to give their opinion about the film.
The next one is Eye Donation Awareness, a documentary. From the starting itself they have proclaimed it's a documentary.
Yeah,
but it's
fine.
a short film competition,
Okay,
but it's
fine.
fine.
So the thing is, they have got bites and all. Okay,
Yeah,
so
that was really
also
nice, nice work.
And the conclusion also, only 48,000 people have donated, so many people die. Still, the common public has not got that much. Okay, a lot of myths and taboos are there. Okay, so what will happen. Okay, so I think they should have made these things, okay, this will
more important in this topic.
Okay, what happens, okay, the interviews by the doctors and the other things
that
okay.
was good.
And one more thing I want to add is they have used other sources, okay, on a small short film kind
it's
of
from
thing.
Sri Lankan
courtesy, they have used courtesy, but it is better. You can create your own kind of concept.
They would have shot something like that, no? It will be more effective.
This is not needed at all also. You can remove. So even if you remove this movie also, it will reach its audience.
Because you have mentioned it was a documentary, no?
Okay, fine.
Even without that video, that looks like an effective documentary. But that video gives an emotional connect. But still, it's an video which is taken from
another source.
So that's not.
That's what.
That's not a great thing.
Okay.
Next in line is Thane, leased by JIPMER Puducherry.
வணக்கம் மக்கள், நீங்கள் கேட்டுட்டு இருக்கிறது 88.3 உங்கள் எஃப்எம். நம்ம இண்டிபெண்டன்ஸ் வாங்கி 75 வருஷம் ஆயிடுச்சு. அதனால் நம்ம சுதந்திரத்துக்கு காரணமாக இருந்த எல்லா தியாகிகளை பற்றி நம்ம பார்த்துட்டு வரோம். அந்த வரிசையில் இன்றைக்கி நம்ம பார்க்க போகிறது நம்ம எல்லாருக்குமே தெரிஞ்ச நேதாஜி சுபாஷ் சந்திர போஸ் அவர்களை பற்றி தான். அவர் உருவாக்கின ஆர்மி பிரிட்டிஷ் ஆர்மிக்கே ஒரு சிம்ம சொப்பனமாக இருந்ததுன்னா பார்த்துங்களேன். ஆனால் அப்பேற்பட்டவருடைய இறப்பில் இன்றைக்கி கூட நமக்கு ஒரு மர்மம் நீடிச்சுட்டே இருக்குது. ஆனால் சட்டத்துக்கு அவர் இறந்துட்டார். ஏன்னா இந்தியாவில் அரசியலமைப்பு சட்டத்தின்படி ஒரு மனுஷன் 7 வருஷமாக அவரோட குடும்பமோ ஃப்ரெண்ட்ஸோ தெரிஞ்சவங்களையோ பார்க்கலனாலோ இல்லை பேசலைனாலோ இல்லை அவரை பற்றி எந்த டீட்டெயில்ஸுமே தெரியலைனாலோ அவர் இறந்துட்டாருன்னு சொல்லுது. அதனால் சட்டத்துக்கு அவர் இறந்துட்டாருன்னு அர்த்தம். அதனால நான் சொல்ல வர்றது என்னன்னா மக்களே, 7 வருஷமாக நீங்கள் யார்கிட்டையும் பார்க்காமே பேசாமே இருக்காதீங்க. ஏன்னா அப்படி இருந்தீங்கன்னா அதே போய் வாட்ஸ்அப்பில் ஸ்டேட்டஸ் போட்டு போயிடுவாங்க. இப்போ உங்களுக்கு பேக் டு பேக் 2 சாங்ஸ் வந்து
7 வருஷம் யாரையாவது பார்க்கலன்னா இல்லை பேசலைன்னா அவங்க இறந்துட்டு தான் சொல்லுவாங்க. அது நம்மளை நாம் பார்க்கலனாலும் பொருந்தும்.
வந்துட்டேன். நீ இன்ஸ்டாகிராமில் நம்மளோட மேரேஜ் ஃபோட்டோஸ்லாம் போட்டிருந்தியா? ஸோ அதை பார்த்துட்டு நான் எப்படி ஆஃபீஸில் இருக்கிறது? ஸோ வந்துட்டேன் வீட்டுக்கு. ஹே, நீ உட்காந்துக்கிட்டு இருக்க. கம் ஆன் மாயா, லெட்ஸ் ஹேவ் அ டான்ஸ். வாழ வைக்கும் காதலுக்கு ஜெய்.
ஆமா, நம்ம வெட்டிங் போட்டோஸ்லாம் இப்பதான் வந்துச்சா இன்ஸ்டால போட்டு. நம்ம சொன்ன நிறைய பேருக்கு வெட்டிங்க்கு வரல இல்ல. they were all held up at work. அதான் போட்டேன்.
கண்டிப்பா மாயா.
கனவு மாதிரி இருக்குல வருண்.
கண்டிப்பா மாயா.
நம்ம நவ்ல இருந்து நம்ம கல்யாணம் இப்போ இந்த வாழ்க்கை அதே மாதிரி எனக்கு பிடிச்ச வேலையும் வந்துருச்சு.
வேலையா? எதுக்கு? இப்போ என்ன அதுக்கு நீட் இருக்கு? வேலைக்கு எதுக்கு போகணும் மாயா?
என்னது?
நான் தான் வேலைக்கு போறேன்னு மாயா. நான் சம்பாதிக்கிறேன், நான் உன்னை பார்த்துப்பேன் மாயா நல்லாவே. இப்போதானே நம்ம ரீசெண்டாக கல்யாணம் பண்ணியிருக்கோம். லெட்ஸ் பி டுகெதர், லெட்ஸ் ஸ்பெண்ட் சம் டைம் டுகெதர் மாயா. நம்ம ஒன்றா இருப்போம்.
இது தேவைக்குன்னு இல்லை வருண். இது எனக்கு பிடிச்ச வேலை, நான் ரொம்ப நாள் ஆசைப்பட்ட வேலை வரும். அதனால நான் கேட்குறேன், நான் போகணுமா வேணாமான்னு டிஸ்கஷனே தேவையில்லை வரும்.
கமான் 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 மாயா, மாயா ப்ளீஸ் ப்ளீஸ் ப்ளீஸ். நான் என்ன மூடில் வந்தேன் அதை நீ டோட்டலாக ஸ்பாயில் பண்ணிட்ட மாயா. அதுக்கு பேசாமல் நான் ஆஃபீஸ்லேயே இருந்துருக்கலாம்.
ஆறாத காயங்களை ஆற்றும் மாயங்களை அனுபவம் கொடுத்திருக்கிறேன். மழை காற்றோடு போகும் வரை போனால் என்ன, அது ஏதோ பூவின் துணையானால் என்ன, சுடரி சுடரி உடல்
உருகுதே என் ஆசை பெருகுதே, ஏதேதோ நினைவு தோணுதே, எங்கேயோ இதயம் போகுதே, பனிக்காற்றிலே பொன்மேனி உருகுதே என் ஆசை பெருகுதே, ஏதேதோ நினைவு தோணுதே, எங்கேயோ இதயம் போகுதே, பனிக்காற்றிலே.
மாயா மாயா தூங்க போகலாமா?
இல்லை வருண், எனக்கு தூக்கம் வரல, நீ வேணா போய் தூங்கு.
மாயா எவ்வளோ ஆசையாக கேட்குறேன், ஓவரா பிகு பண்ணுற மாயா. கல்யாணம் அப்புறம் வாட் ஹேப்பன்? ஏன்?
இல்லை வருண், எனக்கு மூடு இல்லை, ப்ளீஸ்
மாயா
விட்டுடு
மாயா
வருண்.
கம் ஆன். என்ன மாயா கல்யாணம் அப்புறம் மூடு இல்லை இருக்குன்னு பேசிகிட்டு இருக்க? இன்னைக்கு இல்லை நாளைக்கு இல்லை, வாட்ஸ் திஸ் மாயா? இதே டெய்லி, திஸ் இஸ் வாட் இஸ் ஹேப்பனிங் டெய்லி மாயா.
இல்லை வருண், வருண் கம்பல் பண்ணாத வருண், ப்ளீஸ், தலைவலிக்குது, எனக்கு மூடு இல்லைன்னு சொல்கிறேன்ல.
நான் போகிறேன், நீ வா.
வலிகள் மறைந்து போகாதே, சில நாள் வரைக்கும் அதை தீண்டாதே, அதுவாய் மறக்கும் பின் தோன்றாதே, இதுவும் கடந்து போகும், இதுவும் கடந்து போகும்.
ஹலோ வருண், இன்னைக்கு நைட் சீக்கிரமாக வந்துரு வீட்டுக்கு. இன்னைக்கு நான் டின்னர் ப்ரிப்பேர் பண்ணியிருக்கேன், நம்ம 2 பேரும் சாப்பிட்லாம்.
ஹாய் மாயா, ஹாப்பி anniversary to us.
தேங்க்யூ.
A small gift. என்ன ஏதோ எனக்கு டின்னர்னு சொன்ன ஆனிவர்சரி, நீங்கள் இன்னும் எதுவும் ரெடி ஆகலையா?
ரெடியாக இருக்கேனே, நல்லா இல்லையா?
இது ஒரு ட்ரெஸ்ஸா? இது என்ன ஹேர் ஸ்டைலு? பஃபூன் மாதிரி இருக்கு மேலே. உனக்கு தெரியாதா நீ ஃப்ரீ ஹேரில் எவ்வளோ அழகாக இருப்பேன்னு? தட்ஸ் வாட் ஐ லைக் பேசிக்கலி. ஹே இரு இரு இரு, அதானே காதில் இயரிங்ஸு. கோமாளி மாதிரி இருக்கு.
இந்த ட்ரெஸ்ஸுக்கு இது தானே வரும், நல்லா இருக்கு, நல்லா இருக்கு தானே?
அது நீ நினச்சிக்கிட்டு இருக்க. அண்ட் தேர் யூ கோ அகெயின். நீயே நினச்சிக்கோ அது இதுன்னு, ஆனால் எதுவுமே எனக்கு பிடிக்கல. நல்லா இல்லை மாயா, ஐ டோன்ட் லைக் இட். இரு இரு, எனக்கு எதா பார்சல் வந்ததா?
வாங்கி வச்சிட்டேனே.
அதையும் இப்படி தான் வாங்கினேன், இந்த காஸ்டியூமில். தலை எழுத்து.
வருண், அரேஞ்ச்மெண்ட்ஸ் ஃபுட்லாம் எப்படி இருக்குன்னு சொல்லவே இல்லை.
ஏற்கனவே மூடை ஸ்பாயில் பண்ணிட்டேன், இல்லை சாப்பாடு ஒரு கேடா?
இப்போ என்ன மூணு ஸ்பாயில் பண்ணிட்டேன்? இந்த 3 வருஷத்துக்கும் நம்ம கல்யாணத்துக்கு முன்னாடி இருந்த 3 வருஷத்துக்கும் எந்த வித்தியாசமும் தெரியலல்ல. நம்ம லவ் பண்ணுற காலத்தில் ஒவ்வொரு நாளும் என்னை புதுசாக ஃபீல் பண்ண கண்டுபிடிச்சேன். ஆனால் இப்போ இந்த 3 வருஷமா ஒவ்வொரு நாளும் நான் என்னையே தேடிட்டு இருக்கேன். ஆசைப்பட்ட ட்ரீம் பண்ண என் வேலையில் ஆரம்பிச்சு என் ட்ரெஸ்ல இருந்து இன்னைக்கு என் முடி வரைக்கும் வந்து நிற்கிது வருண். என் விருப்பத்தையும் நான் எப்படி இருக்கணும் நீ விரும்புறதையும் மேட்ச் பண்ணியே நான் என்னை தொலைச்சிட்டேன் வருண்.
அப்போ இந்த 3 வருஷம் நீ ஹாப்பியாகவே இல்லை, சந்தோஷமாகவே இல்லை. நம்ம ஒருத்தர் பிடிச்சானே கல்யாணம் பண்ணோம். என்னோட விருப்பத்தை நான் உங்ககிட்ட சொல்லி அதை நீ பண்றதுல உனக்கு என்ன பிரச்சனை இருக்கு? என்ன ப்ராப்ளம்? வாட்ஸ் யூ ப்ராப்ளம்?
இப்போ புரியுதா உன் பிரச்சனை என்னன்னு நீ ரியலைஸ் பண்ணல வருண். உன்னை பொறுத்த வரைக்கும் உன் மூட ஸ்பாயில் பண்ணாம நான் இருக்கணும். உன் விருப்பத்துக்கு ஏற்ற மாதிரி தான் நான் இருக்கணும்னா நான் இந்த வீட்டில் ஒரு பொணமா தான் இருக்கணும் வருண்.
என்ன சொன்ன? ஏன் உயிர் எடுத்துட்டு இவ பொணமாவே இருக்கலாமா?
ஹலோ வருண், ஃப்ரீயா? இன்னைக்கு நைட் சீக்கிரம் வந்துடு. இன்னைக்கு டின்னர் ஒன்றா சாப்பிடலாம் நம்ம. இன்னைக்கு ஆனிவர்சரி இல்லை. ஓகே பாய்.
I request the judges to give their opinion about the film.
Next is Tanai. So I think it is well professionally made. I think they have used drones and all, and a little bit professional actors also. Seems to be professional actors.
Even
the intercutting between the present and the past is also good.
That was not nice,
well made. But
there is no confusion in the time difference.
Okay, it is clearly it has been the storyline is the plot time and the story time has been clearly mentioned. The thing is, it doesn't have a conclusive now. Okay, she accepts whatever
happens to her. That's not a great thing. I think
she's not even fighting. She expresses, but she has to come out of that, or she has to fight that.
The thing is, if you are talking about an issue, you have to give an your solution from your side. This issue is not an
and it is abruptly stopping also. That's the only thing. There should be some conclusiveness.
Everyone knows,
but it is well made. Everything was there.
Technically it was a great
sound
movie.
It was very sound movie, but you should have concluded.
But conceptually, no. Everyone knows lots and lots of women are undergoing these kinds of problems.
Whether what kind of things, whether she wants to come out of that, or he wants to, fight with her, or make him understand that, so you have to give space for their own feelings and all, so this should be there. That is the only thing missing, I think.
This film shows like she have adapted to it. That's not a great thing.
She agrees whatever.
Agreeing what's happening to her domestic. She's agreeing the domestic violence happening to her. That's not a great thing, right? But
fine.
Still, it's fine. Okay.
Up next is Iduvam Kalandu Pogam by Sri Manakula Vinayagar Medical College and Hospital.
Yeah, this is the reaction for equilibrium constant. In this, A plus B will give C plus D. This is the reactant. This is the product. And equilibrium constant is equal to the reaction by product. What is, anyone guess, what is this C? Yeah, say.
Coefficient of reactant and product.
Yeah, perfect. Anyone know the application of this? ஏன் எப்பவுமே அவன் மட்டும் சொல்லிட்டு இருக்கான்? வேற யாராவது சொல்லுங்களேன். நான் இவ்வளவு நாள் நடத்தினதெல்லாம் வேஸ்டா?
ரொம்ப அறுக்குறாங்க கம்யூனிட்டி மெடிசன் என்னன்னே தெரியல.
எங்கடா போற? நான் போறேன், நீங்க
என்னடா பண்ணிருக்க?
படிச்சுட்டு இருக்கேன்டா.
ஏன் கிரவுண்டுக்கு வரல?
படிக்கணும் நிறைய இருக்குடா.
டெய்லி எல்லாரும் வராங்கடா. டெய்லி படிச்சுட்டு தாண்டா இருக்க. ஒரு நாள் வந்து என்னடா போகுது?
என்னடா, நான் ரிப்பீட்டரு, நீ ஃப்ரெஷரு. இந்த மாதிரியாவது நல்ல மார்க் எடுக்கணும்டா.
எல்லா வாட்டியும் ஒரே இதை சொல்றா. என்ன படிச்சுட்டு இருக்க?
இன்ஆர்கானிக் கெமிஸ்ட்ரி.
இன்ஆர்கானிக் கெமிஸ்ட்ரி என்ன படிக்கிற?
ஈக்குலிபிரியம் கான்ஸ்டன்ட்.
டேய், ஈக்குலிபிரியம் கான்ஸ்டன்ட் இது எப்படா சொல்லி கொடுத்தாங்க?
இன்னைக்கு தான்டா. கிளாஸில் கவனிக்காம என்ன பண்ணிட்டு இருக்கான் நீ?
டேய், அவன் சொல்லி கொடுத்த எனக்கு எதுவுமே புரியலடா. சரி, நீ இப்போ அதான் படிக்கிற, அப்படியே சொல்லி கொடுத்துரு.
சரி, இது வந்து ஒரு ரியாக்ஷன் வச்சுக்கோ. ஓகேவா? ஒரு ஐடியல் ரியாக்ஷன் வந்து A plus B gives C plus D. இந்த C plus D தான் ப்ராடக்ட்ஸ். A plus B வந்து ரியாக்டன்ஸ். ஈக்குலிபிரியம் கான்ஸ்டன்ட்னா எப்படின்னா கான்சன்ட்ரேஷன் ஆஃப் ப்ராடக்ட்ஸ் பை கான்சன்ட்ரேஷன் ஆஃப் ரியாக்டன்ஸ். இதுதான் ஈக்குலிபிரியம் கான்ஸ்டன்ட். இதை வச்சு நீ
என்னால் சத்தியமாக முடியாது. இப்போ தான் ஃபுட்பால் விளாண்டுனேன். நான் போய் படுக்கிறேன். நீ எனக்கு நாளைக்கு இல்லை அப்புறமா ஏதாவது சொல்லித்தான், சரியா? நீ படி. சரி, ஓகே. குட் நைட்.
Yeah, so very good afternoon to all of you. So today you are gonna appear for your NEET exams. Yeah, I hope all of you are prepared well. So exam is gonna start by 2 o'clock. So I'm gonna distribute the OMR sheet now. So you have 10 minutes. You have to fill the OMR. Once I give you the OMR sheet, you can start filling it. And also before that, I'll give you some instructions. You have to be very careful while filling the OMR sheets, because once if you do any mistake in the OMR sheet, it will not be replaced. Okay. And also the roll numbers, be very careful while filling the roll numbers, because if you go wrong there, your papers will not be evaluated. Okay. And also one main thing, don't try to do any of malpractices. Be on the safer side, because if they are caught red-handed, so you'll be debarred for next 3 years. So be careful for that. See to that. Okay. Yeah, you can start filling your OMR sheets.
இதெல்லாம் தேவைப்படாது. ஆனால் பரவாயில்ல, வச்சுக்கிறேன்.
அபி, ரூம்மேட் எங்கப்பா?
ஊருக்கு போயிட்டான் சார்.
சரிப்பா, நீட்டுக்கு ரிசல்ட்லாம் வெளில வந்துருச்சான். போய் என்னன்னு பாரு, நம்ம மற்ற பசங்களும் சொல்லிட்டு வரேன்.
சரி சரி.
பார்த்து பொறுமையா போ. உட்காருப்பா. தம்பி என்னப்பா ஏன்பா இவ்வளோ பெரிய முடிவு எடுத்த? இப்படின்னா ஆகிப்போச்சு.
சார் நான் 2 வருஷமாக இந்த எக்ஸாமுக்காக சார் படிச்சுட்டு இருக்கேன். இப்போ 0 வந்துச்சு சார். எப்படின்னு தெரியல சார். நான் அந்த அளவுக்கு நல்லா எழுதுறேன் சார். என்ன பண்ணுறதுன்னு தெரியல சார்.
நான் இதெல்லாம் ஒரு விஷயமாப்பா? இதுக்காக போய் இப்படியாப்பட்ட முடிவுலாம் எடுப்பியாப்பா? தம்பி எங்கள் அப்பா அம்மா நீ டாக்டர் ஆகணுங்கிறத விட நீ உயிரோட போகணும் தான்ப்பா ஆசைப்படுவாங்க. நீ என்னன்னா இப்படிலாம் பண்ணிருக்க? நீட்டுங்கிறது வெறும் ஒரு எக்ஸாம் தானேப்பா. அந்த எக்ஸாம்ல நீ உயிரியே விட போயிட்டியாப்பா. ஒரு எக்ஸாம் என்னப்பா பெரிய வித்தியாசத்தை கொண்டு போயிருக்கிறது உன் வாழ்க்கையில்? உனக்கு எத்தனை வயசு ஆகுதுன்னு சொல்லு.
சார் நான் இப்போ 19 வயசு ஆக போகிறேன் சார். என் கூட இருந்த நான் இப்போ செகண்ட் இயர் இருப்பேன் சார். நான் காலேஜே சேரல சார். என்ன பண்ணுறேன்னா
சார் தம்பி அவன் செகண்ட் இயர் பண்ணால் அவன் வாழ்க்கைப்பா. நீ உன் வாழ்க்கையை பாரு. நீ உன் வாழ்க்கையை எப்படி பண்ணிடலான்னு பாரு. உனக்கு வெறும் இப்போ 20 வயசு தானே ஆகுது. 19 வயசு தான் ஆகுது. 19 வயசுல நீ இன்னும் எவ்வளவோ சாதிக்கலாமே. 19 வயசுக்கு மேலே தான்ப்பா வாழ்க்கையை ஆரம்பிக்கும். இதுக்கு இப்போ நீ இந்த மாதிரி முடிவுலாம் எடுத்துட்டா உங்கள் அப்பா அம்மா நடத்தி போகிற ஒரு செகண்டு எவ்வளோ கஷ்டப்படுவாங்க. நீ இறந்துட்டீங்கன்னா அவங்க எவ்வளோ கஷ்டப்பட்டு உன்னை ஃபீஸ் கட்டி படிக்க வைக்கிறாங்க. நீ இப்போ டக்குன்னு இறந்துட்டா அவங்களுக்கு யார் ஆறுதல் சொல்ல யார் பார்ப்பா? இப்படிதான்ப்பா என் பையனும் இந்த மாதிரி தான் நீட்டுன்னு ரொம்ப அழுதுகிட்டு இருந்தான். தோத்துட்டான். இப்போ அவன் இப்போ அதே மாதிரி தான் ஒன்று மாதிரி முடிவெடுத்து இப்போ அவன் எங்கள் கூட இல்லாமல் போயிட்டான். இப்போ நான் உனக்கு வந்து பேச்சு கொடுக்குற மாதிரி அட்வைஸ் பண்ணுற மாதிரி அவனுக்கு யாராவது கொடுத்துருந்தாங்கன்னா அப்போ அவன் எங்களோட இருந்திருப்பான். அவன் எல்லாமே போயிருப்பான்ப்பா. இந்த மாதிரிலாம் அவன் முடிவெடுக்க கண்டிப்பா. யாருப்பா? அம்மாவா? பேசு. உங்கள்கிட்ட எல்லாத்தையும் கொட்டி தீர்த்துரு. உன் மனசில் இருக்கிறது எல்லாத்தையும் வெளில சொல்லு. அவங்கள தவிர பார்த்த யாருமே உனக்கு நல்ல வழி காட்ட முடியாது. பார்த்து
ஹலோ அம்மா.
ஓப்பா போயிட்டு தைரியமா போப்பா. நீ வாழ்க்கையில் இன்னும் நீ பார்க்க வேண்டியது நிறையா இருக்குது. தைரியமா போயிட்டோம். சரி சார்.
Everybody knows that the dice are loaded. Everybody rolls with their fingers crossed. Everybody knows the war is over. Everybody knows the good guys lost. Everybody knows the fight was fixed. The poor stay poor, the rich get rich. That's how it goes. Everybody knows. Everybody knows that the boat is leaking. Everybody knows that the captain lied. Everybody got this broken feeling, like their father or their dog just died. Everybody talking to their pockets. Everybody wants a box of chocolates and a long stem rose. Everybody knows. Everybody knows that you love me, baby. Everybody knows that you really do. Everybody knows that you...
I request the judges to give their opinion about the film.
So next is இதுவும் கடந்து போகும் short film.
That was really nice work. Execution was really good.
Yeah.
But certain things were not up to the mark.
Yeah. For me, I think the location is not properly established. What kind of location
where it happens.
Already it seems to be a college, but he is preparing for the NEET. Whether it is
that
a
looks
kind
like
of
in college.
College, yeah. Already they are in a room, kind of. It might be they should have established it's a
something
kind of a coaching center.
Is it a coaching center or something like that?
And the casting also was.
That's what I'm about to say.
Yeah.
The character, that warden character, he looks young and he says he had an son and he's dead.
Yeah.
That's not really,
Yeah. Fine, but the performance of the main
lead role was
good.
Other than that,
otherwise So these kind of thoughts will come for students.
Definitely,
who,
that's really need to be
failing
addressed.
exams. Yeah, it has to be addressed, but it would have been little
More
better,
convincing.
convincing. They should have told the
Yeah.
story, I think. Yeah.
But the emotion was good.
Yeah.
Yeah, let's see.
Okay.
The next film is Bins by Government Vellore Medical College and Hospital.
Get your filthy hands off me. How dare you? Do you even know who I am? How dare you just bring me in like that? Hey, human! Take me back to my store, man. They can't hear you, kid. I know, old man, I know. By the way, where am I? In hell. What did you just say?
Yes, more horrific than hell.
Kids, don't scare him. You are in a hospital where you will get food for doing nothing. Food? Are you serious? Food is myth, right? I never had it back in the store. No, we eat food. We divide all the biomedical wastes given amongst us based on the chart present above you.
I eat general waste. I prefer IV tubes, gloves, goggles. But I love catheters.
Glass. Broken and contaminated glass. That's my food. Why is Mr. Whiteo over there playing mute?
He's very dangerous. He eats all the needles, scalpel, and the blades.
Ooh, I'm scared.
Food alert!
Please be catheter. I'm really hungry.
No, it's a vial. Yellow, be ready.
No!
What? Yes, you eat vials, lungs, pancreas, and many more anatomical wastes. Tantalizing stuff.
That's what previous yellow bin said.
Are you kidding me? Was there really another yellow bin before me?
Yeah, and he was more interesting than you.
You are the 27th yellow bin I am talking to. Huh?
Just look over there.
Is he dead?
Yes, more likely poisoned.
Poisoned?
Precisely.
Okay guys, sorry for being the party pooper, but I'm leaving.
Hey, here comes the killer.
Killer?
Yeah, he's the one who poisoned the previous bin.
Excuse me, sir. The lab reports.
This is the time to report. When are you gonna learn punctuality? Get out of here.
Don't worry, kids. Everything will be fine.
Please put in red, please put in red.
Holy bin! He's dead. He's dead. He's dead. Am I gonna be dead? I don't wanna die. I don't wanna die. Please.
Oh my god, I think he's gonna kill us soon.
Aussie, put them in front. Okay, sir.
Hey, what's taking you so long?
Sorry, sir. I don't have proper practice putting Venflon.
Even after 5 years, you don't know how to put a simple Venflon? First, dispose that. Incoming!
Look at this buffoon. He's playing Inky Pinky Pocky with my life. Dude, it's red and white. Red for apples, red for cherry. Dude, why are you looking at me? I am yellow. Please don't bring it closer. No, yellow is different from red. Don't stop. Please stop.
Is someone speaking to me?
Can you hear me now? Here, buddy. Hey, this side. No, not that side. This side. Here, down. Here.
A bin is talking to me?
Yeah. Bring your ear closer. You, Jack the Ripper, have killed 26 of my predecessors, and because of what? Because you, buffoon, couldn't properly dispose the waste in the correct bins. All you had had to do was look 15 inches above me, and there's a chart hanging instructing you exactly how to dispose the waste. Goodbye.
Yummy! But it's not a catheter.
I request the judges to give their opinion about the film.
Okay. The next one is Bins. That was really creative, no?
Very creative. Okay.
That was really nice. The concept was really nice. Even though we think it's a small thing, no? Differentiating the bins and using it properly.
Yeah.
In every household, we can
segregating
use it.
of this kind of so
but we are not taking it as a serious issue.
And the thing is, the way they used to narrate the thing.
That was really awesome.
It is a video kind of posterizing the images,
somewhat like an animated,
adding kind of a lot of colors in it, and
that was really nice.
Creating the characters as the bins talking. Okay, so am I hungry, yummy? These kind of things, it adds value to this.
The main thing is if you put wrong things into it, it will
21 yellow boxes already died. These kind of things was very
which makes us guilty.
Value,
it makes us guilty. Which not using it properly.
Okay.
That was really great idea. Really nice.
And I like the way that narrative.
That was really
nice.
Simple and
very clear also. Okay. And very creative. Good work. Okay. Good work. So nice. And one more thing in the bin. Okay. So. They said that it has been everything is written on the little
the top
of the wall or something 2 or 3 inches. I think that should have been made little printed one or something. It is like
more
a handwritten kind drawing kind of a thing. Normally hospitals will not have this kind of thing.
So printed format.
In a printed format should have been. So if it is there, it will be more appealing also. But still, it makes sense. Okay, so it was very well made and executed.
Their idea is to make it like an animated films. Also, they are made like that.
Maybe they might have thought like that. Okay, it's good.
But still, it's a good work.
Up next is Alag by Government Thoothukudi Medical College and Hospital.
Sorry. Hey Dia, what a surprise.
Hi Madhu, எப்படி இருக்க?
என்ன ரொம்ப குண்டாயிட்ட? ஆமா, எத்தனை குழந்தைங்க?
Everything is normal. You can go home tomorrow.
Okay, doctor.
என்னம்மா பண்றீங்க?
பிறந்த குழந்தைக்கு சர்க்கரை தண்ணி தாரேன்.
முதல் 6 மாசத்துக்கு பாப்பாக்கு தாய்ப்பால் மட்டும்தான் கொடுக்கணும், நோய் எதிர்ப்பு சக்தி அதிகரிக்கிறதுக்கு. சொன்னதெல்லாம் புரிஞ்சுல?
புரிஞ்சு டாக்டர்.
என்னடி சொல்லும், பசிக்குதா தியா?
அச்சச்சோ பட்டுமா, என்னடா தங்கம் பசிச்சிருச்சா உனக்கு? சரி ஒன்றும் இல்லை சரி வா போலாம்.
தாய்ப்பால் குடுமா.
பட்டுக்குட்டி. குட் பாய்ல அப்படிதான் சமத்தா தூங்கணும், சரியா? பட்டுக்குட்டி. ஏண்டி கிரேட்டு?
என்னடி பண்ணுறது, தாய்ப்பால் கொடுக்கறதுக்கே பாதி நேரம் போயிடுது. ஏண்டி லூஸு, தாய்ப்பால் கொடுத்தா அழகு போயிடும். நீ அழகாக இருந்தால் மட்டும்தான் ரிசப்ஷனிஸ்ட்.
அதான் பால் பாக்கெட் பால் பவுடர்லாம் இருக்குல்ல, தாய்ப்பால்லாம் வேணாம்.
குழந்தை வர அழுது.
தியா கொஞ்சம் தண்ணி எடுத்துட்டு வா. புச்சகுட்டி, என்னது இது? தியா, உனக்கு என்ன பைத்தியமா பிடிச்சிருக்கு?
I can do this. ஏன் அழகு போயிடும், எனக்கு என் வேலை தான் முக்கியம்.
குழந்தைய விட உனக்கு அழகு தான் முக்கியமா போச்சா?
பொம்பளைங்களுக்கு குழந்தை கடவுள் கொடுத்த பரிசு. சுற்றி பாதுகாக்கணும், தொலைச்சிட்டா கிடைக்காதுமா. அந்த காலத்தில் 3 குழந்தைக்கு தாய்ப்பால் தாம்மா கொடுத்தோம்.
பட்டுக்குட்டி, ராஜாத்தி, பட்டுமா, எழுந்துருமா.
ஹலோ.
தாய்ப்பால் கொடுக்காதனால நோய் எதிர்ப்பு சக்தி குறைஞ்சு தொற்று நோய் மூளையை பாதிச்சிருச்சு. சாரி, குழந்தைய காப்பாற்ற முடியல.
என்னாச்சு?
என்ன மன்னிச்சிருங்க, என்ன மன்னிச்சிருங்க.
ஆமா, என்ன 2வது குழந்தையா இது? So cute.
ஆன்ட்டி சாக்லேட்.
என்ன விசேஷம்?
ஆன்ட்டி எனக்கு பர்த்டே.
Many more happiness of the day. என்கிட்ட குட் நியூஸ்
சொல்றி.
நான் கன்சீவா இருக்கேன்டி.
சூப்பர் ரீ.
நான் மட்டும் நான் பார்க்காம இருந்தா நீ பண்ண அதே தப்ப நானும் பண்ணியிருந்திருப்பேன்டி.
மது, தாய்ப்பால் கொடுக்க வேண்டியது அவமானம் இல்லை மது, அவசியம் மது.
I request the judges to give their opinion about the film.
So the next movie is Alagu.
Yeah.
The movie speaks about motherhood, how important is breastfeeding.
Yeah. Breastfeeding is.
That's really a good topic to be spoken.
But the casting, no, so there were all kids. Okay, the casting was not proper. Okay,
yeah,
so
yeah.
there you should use proper characters. Okay,
The scene
that
where the
maturity should be seen in the characters. That is the only flaw, I think. But little like melodramatic was stretchy.
Yeah, the performance was somewhat
okay,
more
so
dramatic.
little gripping they should have made. Okay, so little kind of a serial feeling it gives. But okay, the performance of the lead also was good. But the treatment should have been
technically the scene
that
where
the concept is good, but the way they told us, okay,
that
they
was
should have used some other way.
It have been much more better.
Yeah.
The scene where the main lead girl speaks with the friends, no?
Friends or even
they are like
the
small girls.
Yeah.
Even the dialogues won't sync, no?
Yeah. And the husband characters are not also that attached. We cannot see that attachment and it is very little plastic artificial in the nature. So, but it's a good.
Overall, it's a good film. Yeah.
Fine.
We now move on to the super short film category. First up is Radiation Role Assess by Maulana Azad Medical College.
Marie Skłodowska paid for it with her life. Rosalind Franklin got ripped off of a Swedish prize. Somewhere between a hand picture and fantastical fiction, radio energy travels back and forth between friend and foe. An inseparable part of medicine, radioactivity is everywhere, be it at the start of a menacing event or in the diagnostics or treatment. That's familiar. But what's quirky than new in this field? Here's the concept of radiation hormesis, a myth or a must-solve mystery. It basically says that low levels of ionizing radiation, near to but slightly above background, protect against diseases possibly by activating repair mechanisms. Where did that come from? So first up is the oldest known concept, radon therapy. Radon is a radioactive noble gas formed during the decay chains of thorium, uranium and radium. High doses is a known cause of lung cancer and an indoor hazard when it accumulates inside homes, but low-dose inhalation and water baths are offered as options for chronic pain and some unbelievable claims for diabetes, cancer and arthritis. Hallo, ich bin hypothetisch Ersten aus Deutschland. Jedoch Radon-Therapie ist nicht meine erste Wahl, aber sie ist eine Wahl für Leute mit chronischen Schmerzen. There are radon tunnels in Germany that let patients breathe in regulated doses of radon strictly with a prescription. It's offered by many of my colleagues in other countries like Czech Republic, Japan, Austria, Poland and USA. Zooming out of Earth, another field full of low-dose radiation is space. Astronauts are exposed to much higher background radiation than those at Earth due to the loss of protective atmospheric values, but still not high enough thanks to Earth's magnetic field. It averages to about 150 millisievert per year aboard the International Space Station, and while on Earth it is about 3 to 5 millisievert per year. But frequent post changes, short space travels and stay, the less number of cosmonauts that exist could confound studies. But one done in 400 US and Russian astronauts showed no increase in the cancer incidence than the rest of the population. In fact, another major confounder could be the possible effect of microgravity on DNA healing. But it has its kinks. There's a proven effect of accelerating cataract called radiation cataract and the possible effect on central nervous system that could cause Alzheimer's at an earlier age. That still stands to be proven. Another intriguing story comes from right our home, India. India has huge thorium reserves, especially in the monazite sand of the coast of Kerala, and one such place, the Karunagapalli coastal belt, is the standpoint for the cohort study given its high background radiation, almost 80 times that in London. But even after a decade-long study, they did not show any excess cancer risk from gamma radiation, except maybe a few cases of leukemia, but that also statistically insignificant. So, could low-dose ionizing radiation work like immunization with weaker microbial strains? While it is proven that high doses are fatal, making even interplanetary human missions a futuristic dream, so debunking overly ambitious sci-fi concepts. But can radiation itself hold the key to defeating it? Could the transition from Kardashev scale 1 to 2 lie in digging deeper into radioactivity, medicine, and both together? It seems ethically unresponsible to subject humans to radiation for mere hypotheses more likely to be null than true. But a rather smart bypass has already been taken by growing cell cultures and lab animals and almost no radiation labs. Cutting off radiation could tell if low dose actually increases our defenses or not. Even if this doesn't become our ticket to intergalactic dominance, maybe deeper studies into this could help novel and existing therapies become an adjunct for chronic pain, something 1 in 5 people suffer from. And maybe, if we go further, even the claims that now seem wild turn out to be more tamed. Till then, steer clear. Wear the lead aprons, minimize exposure for patients and healthcare alike. Dab that sunscreen and don't fall for radon novelties just yet. Time and science will tell. Or maybe they won't. Or maybe we'll end up somewhere we didn't expect with questions we never could have imagined. Till then, keep roving, radiation rolesses.
I request the judges to give their opinion about the film.
Okay, the next movie is Radiation Rolesses. Nice work, good effort. It was really informative, it speaks about more radiation, what radiations can do.
Okay, they talk about radon therapy.
And they have more, I think they have put more effort in it, making its own, making their own animation.
A lot of infographics are there. I think it is too much of information is there, bombardment of information. So you
it would have been much slower, no?
Slower, okay.
It will be more
these things should
understandable.
And as an audience, you have to see that and you have to digest that. It has to reach you. It goes very fast. Okay. So these are all very technical things. It should be little slower. Okay. The narration also little faster, but according to that infographics, whatever you are using, but it is very informative and new kind of a thing. It would have been little stretched detailly, and a certain infographics it is not, because you are talking about too much of technical things, it has to be very seriously told. And these kind of drawings, if it is very proper, it will
the looks of it is like a comical video.
Yeah.
But the thought,
that information is very
serious thing.
So you have to balance that. Okay. So if it is really made with proper graphics instead of doing this kind of hand drawn kind of a thing, so would have been better. But too much of information is there, and which is very important also. Okay.
So it was like a presentation.
It's good, thing, but it has to reach to people. Okay, so it has to be little slower.
Even if it talks about one or two things, it has to affect us.
Yeah, too much of information is coming.
We can't figure it out which one to take, which one to leave.
Yeah, that's the thing.
It's somewhat like that. But good effort. They have made an over.
Okay,
it's
so
like
very
a handmade video or something like
also
that.
Lot of effort they have put, but little you have to. Okay, so it has to reach.
They have made for around 4 minutes. They have much shortened the information and
and
use the duration for an
duration also. Fine,
but still it's a good work.
Good work.
The next film is ORS and Diarrhea by Maulana Azad Medical College.
घर पर ORS बनाने के लिए सबसे पहले 1 लीटर यानी ऐसे लगभग 3.5 ग्लास पानी को उबाल लें। पानी को ढककर ठंडा होने दें। फिर इसमें 6 चम्मच यानी 1 मुट्ठी चीनी और आधी चम्मच यानी 1 चुटकी नमक डाल दें। अच्छे से मिला देने के बाद हर आधा से 1 घंटा पर थोड़ा थोड़ा पीते रहें। अगले दिन तक ना रखें, पूरा उसी दिन खत्म करें और अगले दिन नया बनाएं। ORS का सबसे ज़रूरी इस्तेमाल है दस्त लगने पर अगर तेज़ बुखार हो, बेहोशी लगे या लैट्रिन में खून आए तो तुरंत डॉक्टर के पास जाएं। घर पर ठीक होने का इंतज़ार ना करें। ORS और भी जगह इस्तेमाल कर सकते हैं, जैसे लू लगने पर, जिनकी हाल ही में सर्जरी हुई हो, बर्न्स का इलाज चल रहा हो, डिहाइड्रेशन हो, जैसे ज़्यादा कसरत करने के बाद। ORS की जगह वह उसके साथ दस्त में कई और चीज़ों का इस्तेमाल करा जा सकता है। पकी हुई पतली खिचड़ी, हरे नारियल का पानी, नींबू पानी, हल्की चाय यानी 1 कप गर्म पानी में बस आधी चम्मच चाय पत्ती और चावल का पानी। चावल का पानी मतलब चावल को ज्यादा पानी में पकाकर वो पानी लेना, या चावल को तब तक उबालना जब तक वो पानी में ना घुल जाए। दस्त से बचा जा सकता है। खाने से पहले अच्छे से हाथ धोएं। गंदे खाने से बचें, जैसे नाली के पास खड़ा ठेला या जहां मक्खी पनप रहे हों, जिस खाने पर गंदगी, मक्खी वगैरह दिख रही हो। खाने के बर्तन अच्छे से धो के रखें और बंद अलमारी या ठीक से ढक कर रखें ताकि कॉकरोच आदि उन पे ना आए। साफ जगह जैसे नल, ट्यूबवेल, फिल्टर से ही पानी पिएं और अगर साफ ना हो तो पानी को उबाल कर ही पिएं। घर में व घर के आसपास कूड़ा ना जमा होने दें, क्योंकि उसमें पनप रही मक्खियां बीमारियां फैलाती हैं। अगर कूड़ा हो तो म्युनिसिपल कॉरपोरेशन को उससे संपर्क करें या सभी आसपास रहने वाले लोग मिलकर यहाँ अपने डस्टबिन आदि लगवाएं। एक बार की सावधानी आगे कई जिंदगियां बचा सकती है। खुले में शौच ना करें। लू से बचने के लिए गर्मियों में हर थोड़ी देर पर पानी पिएं, विशेषकर अगर आप धूप में ज्यादा समय बिताते हैं। दस्त से बचाव और इलाज दोनों आसान है, पर हमें सतर्क रहना होगा। आसपास सफाई रखें, साफ हाथों से साफ खाना और पानी पिएं, खुले में शौच ना करें और अगर तबीयत खराब हो तो तुरंत डॉक्टर के पास जाएं। जानकार भारतीय, होशियार भारतीय, सुरक्षित भारतीय।
I request the judges to give their opinion about the film.
Okay, the next movie is ORS and diarrhea. There are lots and lots of information. But
Yeah.
Really needed, much needed information.
Much needed, and which is very home remedy also.
Yeah, that's
you
the
can
thing.
prepare in home.
Home itself.
So that is the intention of the filmmakers.
Even if you are in a,
they have achieved that. Okay, so you can make ORS in your home. Okay, so it is possible, but certain things was not connected. Okay, editing of this certain things, you know, the fade in, dissolve, and all very. Little quick. Okay, so that should have been little slower. So that is my
the
view.
shots they have made with different children's and
Kids
all.
are there,
Kids
yeah.
are but if they have made it like a story, like
better.
a conversation between a mom and a children,
yeah,
which
or
makes
father
it more
understands who plays and comes, okay, like that. Okay,
it will connect more, right?
Connect more, yeah.
Just
add
like
little
that,
bit of fiction, too much of fiction. Okay, so it is like fragmented here and there. Things
that's
are
the
there.
thing, yeah.
So if you have a kind of a flow, it would be better, I think.
Up next is Locked in Times, Having Many Angles by Dr. Chandramama Dayananda Sagar Institute of Medical Sciences. I request the judges to give their opinion about the film.
Okay, the next movie is Locked in Times, having many angles.
Yeah.
This movie speaks about most important topic of recent times.
Yes.
That
This
COVID
kind of
situation and all,
stress,
lockdown, how stressed out we are.
And lot of talked about lot of people lost their job.
Yeah,
okay,
that's
so
really
lot of stress
bad.
will be there. Okay, so they'll be little down also. And the main thing is it would have been better visualized.
The making would have been much better.
Too much of text was there. Okay, so it was going.
If it was made like a conversation, the original
and
dialogues and all, it would be a good.
They should have some drama. At the beginning, there was a drama. Okay, the kid were writing the poem, and the sister comes and checks it. Okay, so that should have you should have shown that really what happens. Okay, and how they get affected, and the text you should avoid. Okay, particularly in a visual medium, you should avoid this kind of text. So speak through your visuals and audio. That would be better. Okay,
because
then only we can hold the audience like that.
More than words, visuals can grip the video more.
Yeah.
So if they have made it somewhat like that, no, it will be more effective.
Good. Yeah.
But still, it's a very good topic, no? Which the pressure we undergo during the lockdowns, lots and lots of people. Not only the main essence of this movie is we know about the people who lost their jobs on COVID. That and all we know, but how the children get affected to it. How wives get affected to it. That's an important thing, no, right?
It's a bigger issue. Okay, so you have to see.
We think we have pressure, but what our pressure is affecting
kids.
Kids is it's a really important thing to
address.
Yeah. Good.
The next film is Trapped, Medical Mafia by VMKV Medical College and Hospitals, Salem.
Hello sir, good afternoon sir. Sir, I came to know about your college through social media sir. Actually sir, I am a NEET PG qualified aspirant sir. This year only sir. Sir, I want seat in MS Ortho sir, MCI recognized seat sir. Is it available in your college sir?
Yes dear, only one seat is available for MS Ortho in my college, and many candidates are waiting for it. So, but you have to deposit 1 lakh immediately to fix the seat.
Bro, I heard your conversation. I think it's not a good thing because I think it's a medical mafia. You should not go for it. My advice from my side is don't go for it. Stop there. But bro, I need MS Ortho. My parents also wanted me to take MS Ortho seat. And I wanted to take this seat anyhow because this is the last round of counseling. I have no other option. I don't want to waste more years in PG today.
Yes dear, I received your fees of 1 lakh. But to confirm the seat, you have to pay all the fees because many candidates are waiting for confirming the seat. So kindly pay all the fees as soon as possible.
Sir, please try to understand, sir.
No, I cannot consider it here. You have to pay complete fees to confirm.
Sir, please kindly return my 1 lakh, sir.
Okay, then I will return you your money after.
I request the judges to give their opinion about the film.
The next one is Trapped. It's really a much smaller video.
So it talks about medical mafia.
Mafia behind the medical
people
seats.
have been cheated. Okay.
That's really a good topic, but it would have
little longer also. So you have to. The acting also seems to be little artificial.
Yeah.
Okay. So would have been better, and
the making should be more effective,
appealing,
no?
effective also. So
the visuals and audio quality was also much.
I think whether they used.
There were some dialogues.
No, the dialogues was there.
More
story kind of they should have stretched. What happens? Okay, what kind of background he's from? Okay, like this
everything
kind of backdrop it is there now. Then we can have a lot of impact.
He cries when he lost his.
He cries, but the backdrop also.
How to say that the parents.
Yeah, they should have.
Who put their effect earning that
those
1
things
lakh
should
is.
be there. Yeah.
No, that's not a simple idea, right?
Yeah. Fine. Good.
Up next, we have different methods of teaching students' perspective by Ames Diogar.
Good morning. So today's topic is pulmonary vascular disease. I will start from pathophysiology. Since you guys are from AIMS, so you are supposed to know the basic thing. Supposed to know physiology. अगर नहीं आती है तो फर्स्ट ईयर में दोबारा जाइए पढ़िएगा. ठीक है? So pathophysiological response and the clinical significance depends on the extent of pulmonary artery blood flow, which is obstructed. Number 2, the size of occluded vessel. Number 3, the number of embolus. Number 4, the cardiovascular health of the patient. Now the consequences of this disease. There are 2 consequences. First one, this topic is over from my side. You guys go back home and read it.
बस पीपीटी रीड करके चले गए.
क्या ठीक है यार, खाली कागज तो छाप के आए थे. जैसा भी है ठीक ही है यार.
गुड मॉर्निंग स्टूडेंट्स.
गुड मॉर्निंग.
आज आप लोगों की ऑप्टा की पहली क्लास है और आज हम लोग आई बॉल के बारे में कुछ पढ़ेंगे. ठीक है बेटा, आप खड़े हो.
यस मैम.
आप बताओ आई बॉल की शेप क्या होती है?
मैम गोल होती है आई.
बेटा आई ए स्फेरिकल होती है. बैठ जाओ. कुछ नहीं पढ़ के आए दिखते हो तुम लोग. आई बॉल की शेप होती है ए स्फेरिकल. इट इज मेड अप ऑफ 3 layers. Outer, middle and inner. Outer layer of eye, it is made up of cornea, sclera, limbus. तुम खड़े हो. मिडिल लेयर के बारे में कुछ बताओ.
मैंने पढ़ा था पर अभी याद नहीं आ रहा है.
बैठ जाओ. क्या करोगे? पढ़ाई लिखाई शुरू करो अब. इट इज ऑल्सो कॉल्ड यूविया. और इनर लेयर रेटिना होती है. ये देखो ऐसे ये एक लेयर हो गई, ये दूसरी लेयर हो गई, ये एक और तीसरी लेयर हो गई. मेरे डायग्राम्स बहुत पुअर है, तुम बुक में से जाके इसे सही करना. ठीक है, आज के लिए बहुत है, बाकी हम कल पढ़ेंगे.
गंदा पढ़ाती है, कुछ समझ नहीं आता. ना इसकी राइटिंग समझ आती है, ना इसके डायग्राम समझ आते हैं.
ठीक है ना, नोट्स तो मिल गया, बस एग्जाम में जाके छापना ही तो रहेगा.
अरे इतना भी तो नहीं पढ़ाया कि छाप ले पूरा. लो आंसर उसमें भी बहुत शॉर्ट लिख पाएंगे. क्या कुछ नहीं पढ़ाया, फेल ही हो जाएंगे यार ऐसे.
हाँ यार.
Students, till now we have discussed all the boundaries and goals of middle year with the example of this room. तो चलो अब एक बहुत ही इंटरेस्टिंग कॉन्सेप्ट हम सीखेंगे ईयर ओसिकल्स का, जो आप बहुत पहले से पढ़ रहे हैं, पर आज हम एक बहुत इंटरेस्टिंग तरीके से उसको समझेंगे. तो 3 स्टूडेंट्स आगे आ जाओ. तो देखो हमारी 3 ओसिकल्स हमारे सामने रेंज है. मैलियस, इनकस और स्टेपिस. इतना हम कल देख चुके हैं. ये लेटरल वॉल है, टिम्पैनिक मेम्ब्रेन यहाँ पे अटैच होगी, और ये हमारी मैलियस जिसका हेड एपिटिम्पैनम में अटैच है और जो अटैच है इनकस के हेड से. तो जब साउंड वेव टिम्पैनिक मेम्ब्रेन को स्ट्राइक करेगी तो सबसे पहला इंपैक्ट किस पे पड़ेगा? मैलियस पे. और मैलियस वाइब्रेट होना शुरू होगी. मैलियस का हेड इनकस के हेड से स्ट्राइक कर रहा है, जो डायरेक्टली किसको स्टिमुलेट कर रहा है? स्टेपीज को. और ये स्टेपीज की फुट प्लेट किस पे जाके स्ट्राइक करेगी? ओवल विंडो ऑफ इनर ईयर पे. तो अब आप देख पा रहे हैं वाइब्रेशन को, कैसे यहां से आने वाली साउंड वेव इनर ईयर तक पहुंच पा रही है. मूवमेंट ऑफ हमारे ईयर ओसिकल्स हम इससे बहुत आसानी से समझ सकते हैं. तो यही बहुत इंपॉर्टेंट कॉन्सेप्ट है. यहाँ पे मैलियस और इनकस के बीच में एक साइनोवियल जॉइंट और स्टेपिस और इनकस के बीच में दूसरा साइनोवियल जॉइंट. और तीसरा हम इस डायग्राम में बड़े आसानी से सेम चीज देख सकते हैं. साउंड वेव यहाँ आया, मैलियस सबसे पहले स्ट्राइक किया मैलियस को, मैलियस का हेड इनकस के हेड को स्टिमुलेट किया, वहां से स्टेपिस और फाइनली साउंड हमारा इनर ईयर तक पहुंच गया है। तो चलो आज के लिए इतना काफी है, बाकी हम कल डिस्कस करेंगे। थैंक यू।
पढ़ाया ना यार, आज मजा आया यार, सही बोल रहा है।
कितना अच्छा पढ़ाया है, ऐसे ही सब टीचर पढ़ाए तो कितना अच्छा होगा।
अगर ऐसे ही पढ़ाया होता तो मैं भी पास हो जाती, मैं भी टॉप कर जाती।
सही बात है यार, मजा आया। हम भी टॉप कर जाते,
हम भी टॉप कर जाते यार।
ऐसे
Now, I request judges to share their valuable opinions.
The next one is
different method of teaching. So,
no, the differentiating the teaching aspects is really nice,
right.
but
so which will be effective? Okay, so they have
first
used
thing they are using PowerPoint.
With the PowerPoint. Second
next,
is chalk and whiteboard. And
then
third
next is on practical. Using the students itself as an model and
models and all.
That was nice.
But the thing is, they should have used same topic in these three scenarios.
Yeah, first they were talking about heart,
with the same eye and ear, but you should have taken ear for all
the things.
Okay, so that would be, we can feel the difference. So how, which is effective, which is not effective, what kind of mode you have to go. So that would be,
that will be
okay, they should have chosen only one
single concept,
and they should have tried with
differentiated with
different modes of teaching. Okay, so but it is very in need. Okay, students, which kind of teaching method is good for students, where they can understand or clearly get the insights of or the nuances of a certain topics. So that is very needed one. But if you have done with the same thing, it will be good.
Nice,
good thought. Okay, well made also, but the idea is good.
Yeah, technically it was well made.
Yeah,
that's really appreciable. But small things like that, no?
Yeah, this is the flaw. Okay, flaw.
Next, we have glaucoma awareness, again by Ames Diogar.
ग्लोकोमा को आम बोलचाल की भाषा में काच बिंदु, काला मोतिया बिंदु, काला पानी और सामाल बाई भी बोलते हैं।
काला मोतिया बीमारी च ਅੱਖਾਂ ਦੇ ਵਿੱਚ ਦਾ ਦਬਾਅ ਵੱਧ ਜਾਂਦਾ ਹੈ, ਤਾਂ ਕਰਕੇ ਅੱਖਾਂ ਦੇ ਪਿਛਲੇ ਹਿੱਸੇ 'ਚ ਮੌਜੂਦ ਨਾੜ, ਜਿਹਨੂੰ ਕਹਿੰਦੇ ਨੇ ਆਪਟਿਕ ਨਰਵ, ਉਹਨੂੰ ਸੁਖਾ ਦਿੰਦਾ ਹੈ, ਤਾਂ ਅੱਖਾਂ ਦੀ ਨਿਗਾਹ ਹੌਲੀ-ਹੌਲੀ ਕਰਕੇ ਕਮ ਹੁੰਦੀ ਰਹਿੰਦੀ ਹੈ ਤੇ ਉਹ ਨਿਗਾਹ पूरी तरीके नाल जा भी सकती है।
देखियो, काला मोतियाबिंद के एहन कोनो खास लक्षण नहीं होइ छै, लेकिन तहियो जे एकर सबसे पहिलुक लक्षण अछि ओ ई है कि धीरे धीरे एमे आँखक रोशनी कम होय लागे छै, आ जे एकर सबसे पहिलुक संकेत अछि ओ ई है कि परिधीय दृष्टि में हानि आवे लागे छै।
ग्लुकोमा संक्रांत झुंकिर कारण 35 থেকে 40 বছর বয়সী ব্যক্তিদের যাদের গ্লুকোমার পারিবারিক ইতিহাস রয়েছে বা যাদের ডায়াবেটিস, উচ্চ রক্তচাপ, ইন্ট্রাঅকুলার প্রেসার বেড়েছে, তাদের নিয়মিত চোখের পরীক্ষা করানো উচিত, কারণ দীর্ঘস্থায়ী গ্লুকোমা কোনো উপসর্গ দৃশ্যমান হওয়ার আগে দৃষ্টিশক্তি নষ্ট করতে পারে।
கண்ணெடுத்த பரிசோதனை டோனோமெட்ரி என்று அழைக்கப்படுகிறது. இதில் ஒரு சிறிய கருவி கண் துள்ளியால் உணர்ச்சியற்ற பிறகு கண்ணின் மேற்பரப்பை தொடர்பு கொள்கிறது. இது வழியாற்றுவது மற்றும் விரைவானது, ஆனால் உங்கள் ஒத்துழைப்பு தேவைப்படுகிறது.
କଳାମତିଆ ଯୋଗୁଁ ଯେମିତି ଅତିରିକ୍ତ କ୍ଷତି ନ ହେଉ ତାର ନିବାରଣ ନିମନ୍ତେ ନିଜ ଡକ୍ଟର ସହିତ ପରାମର୍ଶ କରି ନିୟମିତ ଉଚିତ ବ୍ୟାୟାମ କରିବା ସହିତ ନିର୍ଦ୍ଧାରିତ ଆଇ ଡ୍ରପ୍କୁ ବ୍ୟବହାର କରିବା ଦରକାର, ଯାହାଦ୍ୱାରା ଆଖି ଡୋଳା ଭିତରେ ଚାପ ବୃଦ୍ଧିକୁ କମ୍ କରି अग्रगति काला मोतियार प्रतिरोध करिपरिबा।
तौर पर काला मोतिया का इलाज दस्तयाब नहीं है, लेकिन इसे आँखों के कतरों के इस्तेमाल और सर्जरी के जरिए से रोका जा सकता है और बेशक एहतियात इलाज से बेहतर है।
ಸಾಮಾನ್ಯ ದೃಷ್ಟಿಯಿಂದ ಸಂಪೂರ್ಣ ಕುರುಡುತನಕ್ಕೆ ವಿಶಿಷ್ಟವಾದ ಪ್ರಗತಿಯು ಚಿಕಿತ್ಸೆ ಇಲ್ಲದೆ ಸುಮಾರು 25 ವರ್ಷಗಳಂದೇ 70 ವರ್ಷಗಳದೇ ತೆಗೆದುಕೊಳ್ಳುತ್ತದೆ. ಇದು ಬಳಸಿದ ಅಂದಾಜು ವಿಧಾನವನ್ನು ಅವಲಂಬಿಸಿರುತ್ತದೆ.
काला मोतिया बिंद्र बीमारी से जुड़िया कुछ मिथक। पहलो, जहाँ लोगों ने भी सही दिखे हैं वहाँ लोगों ने यह बीमारी कौन हो सके है, पर यह बिल्कुल गलत है। जहाँ लोगों ने सही दिखे है वहाँ लोगों ने भी यह बीमारी हो सके है। दूसरो, जारे परिवार में काला मोतिया बिंद्र बीमारी कोनी वहाँ लोगों ने यह बीमारी कौन हो सके है, पर यह भी गलत है। जारे परिवार में काला मोतिया बिंद्र बीमारी कोनी वहाँ लोगों ने भी यह बीमारी हो सके है। तीसरो, काला मूत्रबिंद बीमारी रो इलाज संभव कोनी, पर या भी बिल्कुल गलत है। अगर समय रहते जांच हो जावे तो इलाज भी संभव है।
ગ્લોકોમા અંધત્વનું બીજું મુખ્ય કારણ છે તેની અવગણના એ સારો વિકલ્પ નથી. પ્રારંભિક નિદાન અને સારવાર જટિલતાઓને અટકાવી શકે છે. આપણે હોસ્પિટલ અને સમુદાય સ્તરે જાગૃતિ ફેલાવવી જોઈએ અને દંતકથાઓને સ્પષ્ટ કરવી જોઈએ.
COVID-19 മുൻഗണനകൾ മാറ്റാൻ കാരണമായേക്കാം. എന്നാൽ നിങ്ങളുടെ കാഴ്ചശക്തിയും വളരെ പ്രധാനമാണ്. COVID-19 ഗ്ലോക്കോമ എന്നിവയിൽ നിന്നുള്ള സംരക്ഷണവും അത്യാവശ്യമാണ്. അതുകൊണ്ട് തന്നെ നിങ്ങൾ നിങ്ങളുടെ കൺതുള്ളികൾ മറക്കാതെ ഉപയോഗിക്കുക. గ్లోకోమా రోగిகளுக்கு COVID-19 వ్యాక్సిన్ എടുക്കുന്നത് సురక్షితമാണ്.
నీటి కాసుల వ్యాధిని నిర్లక్ష్యం చేయటం ఒక పెద్ద పొరపాటు. ఇది మీ చూపుని తెలియకుండా దొంగిలించే ఒక దీర్ఘకాల వ్యాధి. ఎటువంటి లక్షణాలు లేకుండానే 90% చూపుని కోల్పోయే అవకాశాలు ఉంటాయి.
क्या आपको या आपके परिवार के किसी सदस्य को काला मोतियाबिंद के कुछ लक्षण हैं? यदि हाँ, तो घबराइए नहीं, आज ही काला मोतियाबिंद की जांच करवाइए.
The World Glaucoma Week is a global initiative of World Glaucoma Association in order to increase awareness on glaucoma. That's why we made this video to help the cause, representing different part of the India that we could. Thank you.
The world is bright, save your sight.
Now, I request judges to share their valuable opinions.
Okay, the next one is glaucoma awareness. It was well made documentary kind of thing.
Documentary kind of thing. So
I
think,
but the message was very clear and loud. Lots of information.
Lot of information was there. Okay, so each one speaks a different
languages.
Okay, so and it was little faster also for me.
Yeah.
So the text also huge, subtitles were there. Okay, with lot of lines, 3-4 lines were there. So sometimes because you have to give enough time for the viewers to what they are saying. Okay, so
they have
goes faster.
there should be certain time to grasp the things we have.
Inputs, yeah.
You are going showing
that. It is kind of what each individual speaks about glaucoma. Okay, various kind of things.
It was like more like an awareness video.
Awareness video, but if you have a story or you should have made some kind of connect, because whenever different shots changes, different character speaks, you are not to able to.
It's a jump, no? From one.
There is a jump. Okay, there is a disconnect when new characters come. Okay, so we will not able to get the total idea of what they are coming to say. So because randomly it's fast changing, that the idea of using different language is good.
That was really good.
When you narrate or give an information, particularly in medical kind of a thing, so how far it reaches the audience. So that's what a little lacking. I think it's my view.
That's a very good point to make. But even though
but the information whatever phone, I think.
Yeah, it was shot in phone, but different kinds of phones. They are speaking in their own phones.
Yeah.
Even if their idea was to make it like this, if they have shot it in their own camera, not how to say, shot everyone in the same camera like that, no?
Yeah.
It will be much better.
Much better also. Okay, so well made. The intention is good, but whether it served the purpose, that's what my doubt.
Information was
good.
Yeah.
Next, we have The Prick, presented by MEDICINA Medical College and Hospital.
अरे चिन्मय जाओ चिन्मय
क्या हुआ उसको?
पता नहीं चिन्मय పేషెంట్ శాంపుల్ తీసుకుంటుంటే నీళ్ళు ట్రిప్ అయింది పేషెంట్ హెచ్ఐవి పాజిటివ్ నాకు ఏం కావాలో అర్థం కావట్లేదు
Don't worry, okay? I will call sir. क्या हुआ?
నెగటివ్ ఇంజరీ సార్
Is patient HIV positive?
yes sir
Okay, don't worry. Did you wash your hands? Okay, immediately send your and patient blood sample for that. There is a Venna ART counseling center in your college. You can approach them. I will inform them. Okay?
excuse me sir
Yes.
good afternoon sir
Please have a seat.
thank you sir
You must be Chinmay, Dr. Jagdishan Prabhu.
yes sir
What happened?
I was collecting patient's blood sample and accidentally I got to a needle prick injury. The patient is HIV positive.
Why you didn't be wearing gloves at the time? Wearing gloves is the foremost part of our job and it decreases the risk by a huge margin. Did you wash your hands with soap?
Yes.
Good. Show me the side of effect. Don't worry, it's just a superficial injury. Just follow what I say. You told me you wash your hands with soap, right?
Yes.
I hope you didn't use any antiseptic.
No sir.
When did it happen?
An hour ago sir.
Good thing you came early because the post-exposure prophylaxis has to be started in 72 hours. Now I'm going to prescribe you some drugs. Take these 2 medicines right now. Then from tomorrow onwards, use it once daily for the next 28 days.
Okay sir.
Inform this to your parents or guardians. Explain them all this. Don't worry, everything's going to be alright. If you have any queries, contact me. For additional help, reach out to your friends and families. Just don't be alone.
Now, I request judges to share their valuable opinions.
Okay, the next one is the prick. The concept was well established, short and sweet.
Superb.
No
The
audio
scenario
quality.
they have created for that. Okay, she goes and meet a patient. Okay, who has an HIV, and she said,
Pricks her,
okay, accidentally pricks
pricks
her
her finger.
fingers. The narration was okay. So they are taking the story.
It has a nice flow to it.
Okay,
Yeah.
so the story is easily moving to the next level. Okay, so the drama was good, and it is also well made, which is very very important. Okay, a lot of common people doesn't know this one. Okay, so even for the students the fresh graduate students who coming to the medical education, it is also awareness for them. So within 72 hours they have
That's
to watch
really
it.
a good point, no?
These kind of
Everyone
things
thinks
we'll also okay.
if he got a prick, no?
Yeah.
Then that's it.
Yeah, a lot of people, when elders are there at their home, even normal people used to give insulin for their parents,
grandparents or someone.
grandparents.
Yeah.
So these kind of things will be okay.
That's more
giving
informative,
information
no?
for the normal common
Within
public
72 hours, if you get proper
you
medication,
need not to worry about those thing kind of thing. Okay?
That's really
so very well
good point
made. Okay, good point. And the way they executed the drama was
really nice,
effective. Okay, so it reaches the audience. So as soon as
it connects well.
As soon as she got the break, the way
she reacts,
she
that
got
was really
tense
nice.
by seeing the report. And the friends immediately so these things, the drama was very good, very
nice.
engaging also. Okay, well made.
Coming to the technical aspects, the sound quality of the video was somewhat low and
high. Okay, so
the
between
first
the
few minutes
friends
were
and all, so there it was little lacking. So if they concentrate
towards the end, it was nice.
Nice,
towards the end, the audios were very clear, dialogues were very clear.
Good.
But at starting a few minutes was
little
very low, and we can't hear what they are saying, what they are speaking. But other than that, it's nice work.
Nice work.
Really nice work.
Up next is surgical approach of cicatricial atropion and lit sequelae SGS presented by PJ Chandigarh.
Clinical photograph of 35-year-old male present to us with severe cicatricial entropion, lead margin keratinization, and lag ophthalmos. Hence, approach is patient tailored to address all the lead problems with one surgery. A short video of the same patient. Traction sutures were passed to avoid the lead margin. Incision was made at the gray line to separate the anterior lamella and posterior lamella. Kinking tarsus was observed. Dissection was carried out. Plane of dissection was then continued up the tarsal plate till anterior insertion of alveus aponeurosis were separated. Keratinized lead margin was excised. Graft is desirable. MMG was placed at the lid with mucous membrane facing towards the cornea. Superior edge of the graft was secured by passing continuous interlocking sutures. Inferior edge was secured by passing double arm suture through the tarsus, graft, and brought out at this increased level. Similarly, medial and the lateral sutures were passed. Final knots were tied. Graft was posed to the tarsus by passing interrupted sutures. Graft was pressed against the bed. This is a post-operative photograph of the same patient with no leg ophthalmos and posterior lead margin was well opposed to the globe. Thank you for your patient listening.
Now, I request judges to share their valuable opinions.
Okay, the next one is surgical approach of cicatricial entropion. And that was really well shot, I think.
Well shot,
no?
okay, because
it's really
it's an
crucial.
eye, so they have had a big close-up for that eye, and we are able to see what's happening.
That's really new for us.
And the thing is, the audio quality, there was a narration behind
it's in the background, but we can't hear it properly.
But we can't hear it, so it was well shot. But it is only the surgical approach, what is being
it's
done.
like it's mostly like in documentation of the procedure.
Okay.
That's what we get from that. No, we can't hear something. Music. The music is somewhat higher than
the voiceover.
So, but still, it's a good work. Good
well
effort
shot.
to be
well shot.
shot.
Next, we have AIDS, Break the Stigma by MEDICINA Medical College and Hospital.
మాది ఎంఎన్ఆర్ మెడికల్ కాలేజ్. దేని గురించి రాని? ఇది ఎయిడ్స్ అవేర్నెస్ గురించి రాని చేస్తున్నాం. ఇట్లా మా కాలేజీలో కూడా చేస్తారా? ఒకసారి మా ప్రిన్సిపల్ సార్తో మాట్లాడాలి, సార్ ఒప్పుకుంటే చేస్తాం. ఓకే, ఎయిడ్స్ డే రోజు చేపిద్దాం అనుకుంటున్నాం. ఒకసారి మీరు మా ప్రిన్సిపల్ సార్తో మాట్లాడాలి. ఓకే బ్రో. ఓకే, థ్యాంక్ యూ.
Dr. Saumiki and వీళ్ళందరూ మా టీమ్ ఫ్రమ్ MEDICINA మెడికల్ కాలేజ్ అండ్ హాస్పిటల్. ఇవాళ మేము మీకు HIV ఇంకా ఎయిడ్స్ అవేర్నెస్ గురించి చాలా క్లుప్తంగా తెలుపుతామని వచ్చాము.
Now, I request judges to share their valuable opinions.
So, next movie is AIDS Break the Stigma. So,
it was convincing. It was made live.
Yeah.
That was really nice. No, the
Making
performance was
good.
also good.
Good. And I think the dialogues is very minimalistically they have used.
The main thing is some scenes have dialogue, some things
Some
don't have
doesn't have,
dialogue.
yeah, that's the thing.
movie. The sounds.
Little aesthetics should have been added, but the flow is okay. So
yeah, the flow is good.
The girl faces the trauma. A lot of people doesn't engage her. So so whenever she comes, people
has and connect
to it, and little it is not gripping after that. So when they meet, and the other medical team comes and they give the awareness. That should be
that's
little
not so convincing.
So there should be some kind of
if they have thought of doing it in a dialogue way screenplay way, you should have done it in the same way. If you have thought not to do it in a dialogue way, then we should have dropped all the dialogues.
But mixing it is not
mixing it is not a good option, I think. But other than that, it's really nice. Really nice.
Up next, we have Pulse Polio Immunization by AIMS Patna.
और कम्युनिटी मेडिसिन के अंतर्गत यहाँ पे प्राइमरी स्कूल में आई हूँ अभी। पोलियो पिलाने के लिए बच्चों को। तो मैं यहाँ पे पोलियो पिला रही हूँ। हम यहाँ पे 4 वैक्सीनेटर्स हैं। ये सुमन जी जो ANM हैं और ये मीना जी हैं जो हमारी आशा फैसिलिटेटर हैं। तो सुमन जी सबको पोलियो पिला रही हैं। मीना जो हमारी आशा फैसिलिटेटर हैं वो सबको बुला के ला रही हैं। अभी हमारे 60 बच्चे हो गए हैं जिनको बुला के लाए हैं। और जो दूसरी हमारी इंटर्न है वो टैली शीट में निशान लगा रही है। और हमने 60 बच्चों को पोलियो कवर कर दिया है। और ये मुझे बहुत अच्छा एक इनिशिएटिव लगा गवर्नमेंट का कि सारे बच्चे इसके अंदर कवर हो रहे हैं। और आई एम प्राउड टू बी अ पार्ट ऑफ इट।
हम हैं टीम झांसी से और हम कहना चाहते हैं कि 2 बूंद हर बार पोलियो पर जीत रहे बरकरार।
किसी पर उपस्थित है 5 साल तक के बच्चों को पोलियो बूंद पिलाने के लिए। ये हमारी आशा वर्कर उषा जी और रेखा जी है। अब तक हम यहाँ पर 138 बच्चों को पोलियो बूंद पिला चुके हैं, जैसे कि आप देख सकते हैं स्टैली शीट में। यहाँ पर 138 बच्चों को हम पोलियो बूंद पिला चुके हैं। हम सब उपस्थित यहाँ लोगों का एक ही लक्ष्य है, 2 बूंद हर बार पोलियो पर जीत रहे बरकरार।
भारत में पोलियो का आखिरी केस 13 जनवरी 2011 को पश्चिम बंगाल में सामने आया था। उसके बाद आज तक कोई भी केस देखने को नहीं मिला है। तो WHO ने भारत को 27 मार्च 2014 को पोलियो फ्री घोषित कर दिया था। उसी चीज़ को हम आगे बरकरार रखें कि भारत पोलियो फ्री रहे। तो इसमें पोलियो की दवाई 0 से 5 साल तक के बच्चों को हमें पिलानी चाहिए। जितने भी हमारे पोलियो बूथ हैं वहाँ पे बच्चों को लेके आएँ, उन्हें पोलियो की दवाई पिलाएं। 2 बूंद हर बार पोलियो से जीत रहे बरकरार।
हमें अपने देश को पोलियो फ्री रखना होगा, क्योंकि पोलियो फ्री भारत ही अच्छे से चलेगा, दौड़ेगा और खेलेगा, और तभी तो बढ़ेगा इंडिया।
Now, I request judges to share their valuable opinions.
Okay, the next one is pulse polio immunization. It was informative.
Informative.
But it has lots and lots of pictures more than videos.
Videos and different aspect ratio it was shot.
That's not a good thing in a short film.
Either you want to shoot in vertical mode, you can continue in the vertical mode. Sometimes it goes to the 4:16:9 ratio.
Yeah.
So mixing of these two kinds of aspect ratio.
That's not, if you are gonna shoot it in an horizontal mode,
you can
should
do
be
it,
continuing
or
doing
just,
that.
straight away you can go for the vertical mode. But another thing is the sound quality is little low. You have to increase the sound quality. A little poor.
So instead of pictures, they would have more made it like a story
or something. There
like
are people, they are interact, they are showing that and all. So it is just they have documented.
It's more like a documentary or
kind of a thing. Yeah. So
it's more like a presentation or a documentary mixed kind of thing.
Kind of thing. Okay.
But it's informative. But
informative.
It talks more about how important is polio
immunization and all. Okay, so
good.
Next, we have A Cup for a Change, presented by Mahatma Gandhi Medical College and Research Institute.
I'm good. Come in. Coffee? Yeah, cool. I need extra restroom. I'm on my periods. It's been a 6 hours travel.
என்னையாச்சு நாக்கன் எங்க டிஸ்போஸ் பண்றது? நாப்கின் கீழே பின் இருக்கு, அங்க போட்டுறேன். தனியா ஒன்றும் இல்லையா இங்க? இல்லை, நான் பேட் யூஸ் பண்ண மாட்டேன். அப்போ என்ன யூஸ் பண்ணுவா? மென்ஸ்ட்ரல் கப். மென்ஸ்ட்ரல் கப்? ஆமாம். லைக் how do you even use it? சரி போட்டு வா, நான் சொல்கிறேன். ஓகே.
Bro, do you know anything about a menstrual cup?
I have heard about it, but I have never used one.
Chalo, I'll tell you. See, it's pretty simple. It's just a medically approved silicone cup, a better alternative for pads and tampons. It has a stem and a cup. It is inserted during menstruation into your vagina.
Wait, did you just say you insert it in?
Yes.
Won't that be painful?
No, not at all. That's such a myth. Once you know how to use it, trust me, it's the best thing that has ever happened to you.
Wow. Can you show me one and tell me how
Yeah,
it is?
sure. Let me show you one.
This cup comes in small, medium and large sizes and in different shapes as well. It is flexible, affordable and is reusable for 10 years. Just needs to be boiled before and after use of every cycle.
What made you choose menstrual cups over pads?
Okay. First of all, doing physical activities is so much easier. You know how much I love to swim. And there's no odor, no fear of rashes or infection. Conditions like toxic shock syndrome or cancer, like that we see in tampon, there's no fear of it.
Let me show you the different kinds of folds. This is C fold. That's punch down fold. That's a 7 fold. And that's a triangle fold. That's an S fold.
I prefer the punch down one. It's pretty simple.
Like, how do you insert it inside?
See, you can squat or you can lift your leg into a higher place. That gives you easier access, obviously. And then just use the fold you find convenient and insert it inside slowly.
Won't that break my hymen?
No, not at all. You don't have to worry about that. Dude, I totally recommend this for you. I know how much of a travel freak you are, and this is gonna be totally life-changing for you.
I'll just straight up go and try this right away.
You tried it? Bro, this is super comfortable. I told you.
Now, I request judges to share their valuable opinions.
Okay, the next one is a cup for a change. It's very, it's really important topic to be addressed.
Yeah.
And it's a bold attempt, I think.
Really?
Really,
no. I think this should have been, the information was there, so they show how, and they connect the cup for a change and they start with having a cup of a coffee and slowly into moving to this kind of analogy, I like that.
That was nice. The whole making process was nice.
Was good. And how to use it, so that was missing here. Okay, they say that we can use it. So graphically you could have, so how, because a lot of women will not be knowing, not aware of
lots
this.
Of women don't have awareness of this.
This one. So graphically,
but still they have managed to talk about the folds of it.
Folds and
that is really nice.
And circle.
Yeah, that's really nice.
And it is new. Okay, a lot of people will get
really
aware about this one. Okay, and they talk about it as stainless and you can do all sorts of
how to use
work.
it.
Okay, so
washable and lots of information.
Useful kind of thing.
Technically, it has no. Say the same orientation issues.
Issues.
Some shots are shot in a vertical manner.
Vertical
some shots are shot in a horizontal manner. If you are going to shot in a vertical manner, the whole film should be shot in a vertical manner. But same goes with the horizontal.
Good concept, which is very needed.
Important. No?
Important.
Yeah, it's really nice. Nice work.
Nice.
Up next, we have isolation presented by JIPMER.
Isolation. I shut the door in an attempt to isolate myself from the people and their perceptions of me. I sleep on my bed. I stare at the ceiling, still as blank as it was yesterday. I clear my frames of all the photographs, if only it was as easy to clear memories from my head. I stare at the lizard that's fixated on a moth on my wall. Does the moth know that the end is near? I stare outside my window, a balcony with water stains on its walls. It almost pains my heart to watch it layer after layer of cement to keep the wall intact. But water always finds the little crevices to seep in from. Nothing is intact forever. I giggle at my own thoughts. But then I snap out of that, for in this isolation too, I still worry about what people say to a person who giggles just by himself. These curtains, we bought them together, she and I. Who knew then that one day she'll draw the curtains on our love and all the little things that we shared? She left, the curtain stayed. She was right. Why carry the baggage of all these memories like a ghost on one's shoulders? But I couldn't be that practical. For it was me who asked to keep those curtains here. It'll be a memory, I said. Maybe I should watch some television. It's same here too. Just that here you might guess before they are about to fool you. Maybe I should call an old friend. But again I can hear the conversations rolling even before it happens. Hey, how's life? All good. Yeah, all good. At the end it all comes down to me. My breath. Closed my eyes. Breathe in, breathe out. Breath has its own rhythm. The mind settled. My lips curl into a smile. That moment I felt truly isolated. Isolated from the world. Isolation.
Now, I request judges to share their valuable opinions.
The next one is isolation. The dialogues were deep, no? Touching, deep, but
yeah.
still
but it is not gripping, okay, so it is not relating to the people, okay, so
the idea of the maker does not that's not exhibited properly, I think.
Yeah. Visually it should have been
Yeah.
made better, okay,
Yeah.
so the shots and all, okay, so but it is not, something is lacking, it is not gripping.
No, we can't get the message, no, what he is conveying.
Immediately he breathes in and
Yeah,
breathes out, doing yoga or something, he smiles, but it is okay, but it has to be stretched, okay, so then, okay, the effect,
the solution,
you should have give some time for that happening.
Yeah.
Immediately you will not get that, so on the due course only you will feel that one, Okay, so that should
in the course of time, the time taken for the solution is much smaller.
Smaller, immediately gets the remedy kind of a thing.
But he has established the characters,
everything in a lengthy way.
But the solution is short in a small. That's not convincing. No.
Yeah. So, okay, fine.
Next, we have CU Appa, presented by Dr. Chandramma Dayananda Sagar Institute of Medical Education and Research.
ಹೇಳಿ ವಿನಯ್, ಹೇಗಿದ್ದೀರಾ ಈಗ? ಸರ್ ಆರಾಮಾಗಿದ್ದೀನಿ, ಬಟ್ ಕೆಂಪು ಕಮ್ಮಿ ಆಗಿಲ್ಲ ಸರ್, ಹಾಗೆ ಇದೆ. ಓಕೆ ಓಕೆ ಓಕೆ. ವಿನಯ್, ನೀವು ಒಂದು ಕೆಲಸ ಮಾಡಿ, ಇದೇ ಡ್ರಾಪ್ಸ್ನ ಇನ್ನೊಂದು ವಾರ ಕಂಟಿನ್ಯೂ ಮಾಡಿ. ಓಕೆ ಸರ್. ದಿನಕ್ಕೆ 2 ಸಲ ಹಾಕಿ ಕಮ್ಮಿ ಆಗುತ್ತೆ. ಓಕೆ. ನೆಕ್ಸ್ಟ್ ಯಾವಾಗ ಬರ್ಬೇಕು ಸರ್? ಇನ್ನೊಂದು ವಾರ ಬಿಟ್ಟು ಬರ್ತೀರಾ? ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸರ್. ಸಿಸ್ಟರ್, ಒಪಿಡಿ ಕ್ಲೋಸ್ ಮಾಡಿಬಿಡಿ, ಟೈಮ್ ಆಯಿತು.
ಇಲ್ಲ ಸರ್, ಇನ್ನು 3 ಜನ ವೇಟ್ ಮಾಡ್ತಿದ್ದಾರೆ ಸರ್.
ಇನ್ನು 3 ಜನನಾ? ಮಗನ್ ಬರ್ಡೇ ಇದೆ ಸಿಸ್ಟರ್, ಐ ಡೋಂಟ್ ವಾಂಟ್ ಟು ರೂಯಿನ್ ಹಿಸ್ ಡೇ. ಆಯ್ತು, ಕಳಿಸಿ. ಹಲೋ ಬುಡ. ಬುಡ, ಪೇಷಂಟ್ಸ್ ಜಾಸ್ತಿ ಇದ್ರು, ಡೋಂಟ್ ವರಿ, ಓಕೆ, ಐ ವಿಲ್ ಕಮ್ ಫಾಸ್ಟ್.
Hello?
Hello, Pa.
Hi, Shaurya. I'll come quickly, okay?
Appa, don't drive so fast. Drive slow. I will wait, Appa. I will wait, Appa.
Oh, Shaurya, I love you.
I love you, Appa.
See you soon, Kanda.
See you, Appa.
Now, I request judges to share their valuable opinions.
So, next is CU Appa.
CU Appa.
So, again, it is a kind of a PSA kind of a style they have followed. So, and here also the aspect ratio changes. Okay,
no,
so in the hospital, in the last when he reaches home,
the girl runs towards his father.
Okay, so that aspect ratio, I think it is shot in mobile, but the first shot and all, okay, the beginning they have shot with the proper camera the aspect ratio is followed, but still no.
The idea of it was to it's like
drive slow,
okay. Speed kills, something like that,
kind of thing. But still, why these thing the hospital scene is necessary or not?
Yeah.
Okay, so like this.
If you have connected somewhat with that thing to this one, that will be more better.
That would be better.
Yeah, but still, in a minute he had shown.
Within a minute, it's conveying something is very tough, but they have tried it. Okay, fine, good.
Up next, we have Sitting is the New Smoking, presented by Yong Lu Lin School of Medicine, NUS, Singapore. Now, I request judges to share their valuable opinions.
The next one is sitting is the new smoking.
Yeah.
You know,
Title
no,
is very different. The
Creative
concept
too.
is okay. Okay.
But it's more like an ad film, I think. No, it's not like a
but
movie.
PSA kind of a thing is
Okay.
okay. But the thing is how scientific it is proven that how it reduces.
We all know, no.
We all
If you stand for a long time, we can. It affects our
varicoses and all
Yeah, that's
they
it.
used to say. But something is missing in this film. Okay, and the BGM they have used. Okay, so different BGMs are coming here and there,
which is not synced with the
the visuals.
It does not match the color of the tone of the movie.
Yeah,
no?
it's like what do you say? Something is missing. Okay.
But still, making a film in a minute is not an
easy task.
But
within a minute, they
if
will
you are
be able
creative
to
enough,
convey
you can
that.
do it, no?
So we can get rid of this kind of neck pain or sitting for a longer time.
Small
So
story, no, that would be much better.
Much
It's
better.
like just like in PSA.
PSA kind of thing.
If it
Shot
has
with
a
lot
small
of people.
story in it, no small essence of drama in it, no, it will be more, nice.
Effective. Yeah.
But still, it's good.
Okay, good.
And now we move on to micro-short movies. First, we have COVID prevention song by AIMS New Delhi.
कोरोना से तू लड़ जाएगा, मास्क पहनेगा बच जाएगा, सैनिटाइजर रखना छोटे वरना साबुन चल जाएगा, हैंडशेक न कर, हग भी न कर, दूर से हेलो हाय करने का, अरे टेंशन काय को लेने का, घर पे ही तू रहने का.
Now, I request judges to share their valuable opinions.
Next one is COVID prevention song. No? The song was nice.
Nice, yeah, very peppy.
But it should have been made in more technically. It is not strong. I
Strong,
think.
yeah. Chroma key was little okay, so it is not
that much of.
But they have tried it. Good, good work, good attempt. And the song, okay, so the rhythm, I like the beats
that was
rhythm,
peppy
that
and it was catchy. I
catchy
think, no?
also. Okay, so within a minute. Okay,
yeah,
it's
that's really good.
Good.
Even the technical thing, no, I think they have used green mat.
Green mat and all they have done.
That was they have put more effort to it, but
yeah, but good. The prevention song is good. Okay, little peppy, so it is able to hold you also. Okay,
yeah.
so
if it was made somewhat with good
visuals, okay, instead of shooting in a studio, you should have gone
outdoor
outdoors,
or something like that. Now
this some kind of drama could have been made better. Okay,
even more like 5 to 10 members dancing to it or something.
Okay, that
will be much comical and it will be nice.
Nice one. Okay, good.
But it's still good. Yeah.
Next, we have Hair Fall to Hair Full, presented by Trichy SRM Medical College. Now, I request judges to share their valuable opinions.
Okay, the next one is hair fall to hairful.
Yeah.
Hairful.
Hairful.
It's a dream to lots of youngsters today,
Yes,
no?
sure.
It's a very big problem for youngsters of this age.
Really.
Lots of hair falls. Now they
And
have made lots of artificial ways to prevent,
Prevent, yeah.
hair plantations and much
The
more
thing
like
is,
that.
I like the way that story. Okay, they're using two.
So they're suggesting a natural way of
doing it. One girl having with short hair and the other girl, okay, she was amused. Oh, how she got. So that kind of drama was very good.
Nice.
And the second part, no, so in between they have the title. I don't know. It is a disturbing thing.
Yeah.
Okay, so either you use the title at the beginning or at the
end.
In between, okay, on characters you have introduced, and again you are showing the title hair fall.
That won't be a good idea.
It is breaking the story.
Yeah, that's not a good idea for an 1 minute video.
1 minute video, because you have only 60 seconds. You can tell a lot of other stuffs, and later they use the slide and the acupuncture points and all.
That's really informative, no?
Informative.
Talking about but it should be shown in a visual medium.
And they should have, even they can use the slide, but audio, with support of audio there,
that would be nice.
so that it can reach even illiterate. If you show to the illiterate people also through the audios, okay, you can get the information. Okay, so that is what.
No,
but
it speaks about a very important thing.
Things.
Going to unnatural ways of
simple
hair growth.
enough.
Simple acupuncture points. There are acupuncture points in our head. Oiling durations. That's a really nice thing to speak.
Nice concept, well made. Okay?
But it should be shown
short
in
and sweet. Okay, so it's good.
It's really
small flaws are there, but it's good.
The other thing is, these kinds of habits should be brought up from the small age.
Yeah.
When a 5 or 6 year child watching this video, she can't understand, no?
Okay.
If you are putting in a slide,
yes.
If it
they
was
can
conveyed
use
in
audio, so that you can you can achieve what you intended.
If it was made like the other girl talking to the other girl about this,
they should have
advising
they
something
thought,
like
I think they might have thought that if they had an interaction with these two, it might sound like advertisement.
That will be, but
that's why they might have avoided that.
If you're gonna make it an informative video, this thing is really has to be reached from the small age.
Yeah.
And that's what I thought,
Good one.
Yeah.
Up next, we have Drug Autobiographies in Pharmacology, presented by Ames Mangalagiri. Now, I request judges to share their valuable opinions.
Okay, the next one is drug autobiographies, no?
Yeah.
It was
very creatively.
Yeah, very nice concept, no? Making the drugs as heroes gods,
and
freedom fighters.
The way the cartoons they have used, naming the parts and other things.
That's really creative one.
They
put a lot of work to it, no? That's really nice.
Within a minute, she was able to give that autobiographies of these drugs. In the
lots and lots of information.
Lots of information is there.
But still, it's somewhat more. More phased, no?
Yeah.
So fast.
It
was
fast.
Made into a 2 or 3 minute video, no? It will be more
informative.
You can understand easily.
Lot of information is there, but how effective it is going to reach the audience.
The slides are moving so fast.
Also. In certain areas it is slow, going very slow, but
towards the climax, no?
It is going up and down.
Retaining
what kind of drugs is there mentioned here and there. So that is little lacking. But the idea of making this drugs with this
that's really cool, no? That's really
good.
Nice way of making the drugs as heroes, police officers,
peacemakers.
gods, peacemakers. That's really nice one.
Yeah. Good.
Up next, we have Black or White, the board is always right, presented by Ames Diogad.
Good morning to all. The board remains a quintessential part of medical education, be it the pandemic era or the non-pandemic era. Now, how we utilize the board is of prime importance to make out the best of it. Usually what the teachers do is use the narrative form where they just keep on writing like the causes, differential diagnosis and treatment, and that goes on. What I am emphasizing today is a nuclear form of using the board in which we start with a central topic, we just highlight the topic in the center and then interact with the pupil and they ask them regarding what they think of the causes could be and relate it with their prior knowledge of first year and the second year or the relevant professional years. Just for example, red eye, if I just query them, they will be answering something like conjunctiva, cornea, iris, anterior chamber and so on. And from there we can just discuss and ask about the differential diagnosis, and that will be a very interactive session. Thank you.
Now, I request judges to share their valuable opinions.
Okay, the next one is the black or white. The board is always
right. Yeah, a lot of people, still teachers prefer the chalk and talk method instead of going ICT or PPT or any kind of technology enabled learning. So in this he uses a way of using nucleus and
effective way of using
the board. Okay, so it's a good kind of approach in this digital era. So he's
even still we are moved to next level of
but still this kind of old conventional methods.
That's really effective, no? Other than PPT and all, it's more effective.
This is also like this, the nucleus diagram and where you find these things. Okay, so you can go on explaining things. If it is this is this and this will be the cause, like this he has explained. But good. Within a minute he has
done something good.
Done good. Okay, good.
Let's see. Good.
Lastly, we have BP Kailena Next Enu, presented by Dr. Chandramma Dayananda Sagar Institute of Medical Sciences and Research.
ಏನೋ ನೀನಿಲ್ಲಿ
ಡಾಕ್ಟರ್ ಮೀಟ್ ಮಾಡೋಣ ಅಂತ ಬಂದಿದ್ದೆ ಕಣ. BP ಕಾಯಿಲೆ ಐತೆ. ನಮ್ಮ ಡಾಕ್ಟರ್ ನೋಡಿದ್ರೆ ದಿನಕ್ಕೆ 2 ಮಾತ್ರೆ ತಗೋ ಸಾಕು ಅಂತ ಇದ್ದಾರೆ. BP ಕಾಯಿಲೆ ಭಯ ಆಗ್ತಿದೆ ಕಣೋ ಅಂತ.
ಓ, ನಂಗೂ BP ಇದೆ ಅಂತ ಬಂದಿತ್ತು. ನಮ್ಮ ಡಾಕ್ಟರ್ ಏನು ಹೇಳಿದ್ರು ಗೊತ್ತಾ?
ನೋಡಿ ಸೊಂಟೆ, ನಿಮಗೆ ಇದರಲ್ಲಿ BP ಇದೆ ಅಂತ ಬಂದಿದೆ. ಹೆದರ್ಕೊಳ್ಳೋ ಅವಶ್ಯಕತೆ ಏನಿಲ್ಲ. ನಾನು ಟ್ಯಾಬ್ಲೆಟ್ ಬರ್ತೀನಿ, ದಿನ ಬೆಳಗ್ಗೆ ಒಂದು ರಾತ್ರಿ ಒಂದು ಊಟ ಆದ್ಮೇಲೆ ತಗೊಳ್ಳಿ. ಸ್ವಲ್ಪ ಊಟದಲ್ಲಿ ಪಥ್ಯ ಮಾಡಬೇಕಾಗುತ್ತೆ. ಊಟದಲ್ಲಿ ಉಪ್ಪು ಕಡಿಮೆ ಮಾಡಿಕೊಂಡು ಸೊಪ್ಪು, ತರಕಾರಿ, ಹಣ್ಣು ಇಂಥವನ್ನ ಆ್ಯಡ್ ಮಾಡ್ಕೊಳ್ಳಿ. ಆಮೇಲೆ ನಾನ್ ವೆಜ್ ತಿಂತೀರಾ?
ಹ್ಞೂ ಸರ್, ತಿಂತೀನಿ.
ವಾರಕ್ಕೆ ಒಂದ್ಸಲ ಫಿಶ್ ತೊಗೊಬೋದು. ಆಮೇಲೆ ದಿನ ಬೆಳಗ್ಗೆ ವಾಕಿಂಗ್ ಮತ್ತು ಎಕ್ಸಸೈಸ್ಗಳನ್ನ ಮಾಡಿ. BP ಕಂಟ್ರೋಲ್ ಇಲ್ಲ ಅಂದರೆ ಕಣ್ಣು, ಕಿಡ್ನಿ ಮತ್ತು ಹಾರ್ಟಿಗೆ ಡ್ಯಾಮೇಜ್ ಆಗುತ್ತೆ, ಸ್ಟ್ರೋಕ್ ಆಗೋ ಚಾನ್ಸ್ ಇರುತ್ತೆ. ಬಟ್ ನಾನು ಹೇಳಿದ್ಮೇಲೆ ನೀವು ಫಾಲೋ ಮಾಡಿದ್ರೆ ಖಂಡಿತವೆಲ್ಲ ತಡೆಗಟ್ಟಬಹುದು. 1 ಮಂತ್ ಆದ್ಮೇಲೆ ಬನ್ನಿ, ಮತ್ತೆ ನೋಡೋಣ.
ಓಕೆ, ಆಯಿತು ಸರ್.
Now, I request judges to share their valuable opinions.
Okay, the next one is BP Kailena Next Enu.
Next Enu, yeah. Kannada.
It's Kannada word.
Yeah.
I don't know I'm pronouncing it right, but still.
Yeah. So very short, within a minute, they are able to convey what is how you have to to avoid hypertension. Taking reducing salt and all, but
sound quality is much
little low. The patient's voice is not clearly
even the starting part of the video is much
less. So we are not able to what the character is saying. So that is the flaw. But the doctor says, so within a minute you want to
have conveyed an important message. That's good.
Yeah,
that's
good.
really good. Yeah.
Fine.
Good. Okay. MEDICOFF 2022.
Yeah.
We have reached the final stages of it.
Yes.
So it was a great experience, right?
Yeah, to see all the medical films. And the great thing about this virtual film festival is they are not from this filmmaking background, so they are all doctors and medical students. They have shown so much of interest in making these medical related short films, and they have a lot of response was there.
Yeah, they have put a lot of effort to it. No, it's not an easy task of making a video, right? It's not easy to make a film. No, even though in the same field, as a director or a filmmaker, I know how hard it is to make a script, how hard it is to make people act.
Yeah.
But they have done it, and they have done a great job in doing that. That's really nice. They have pulled
Okay,
it off
so-
in a great manner.
And we congratulate all the participants who have
Yeah.
sent their entries, and you have shown a lot of interest in creating these short films. Congratulations for all the people who participate in this film festival.
Great work, great work. Okay.
And we'll
apart
move on
from
to the final stage.
final
We are going
stage.
to announce the winners. We'll start with the special mention jury, then we'll come to the other
we
categories.
have an separate category called special jury, which is not mentioned before. But seeing a lot of good works, we definitely wanted to appreciate the work of certain films. So we'll start with that, and then we will go to the different categories of films: long, super short, and micro short films. Okay, the special jury mention awards. The first award is Patient Empathy, Dr. Banu Prakash HM, Assistant Professor, Siddhaganga Medical College and Research Institute, Tumkuru.
The second special mention, Small Things Matter, Dr. Reena George, Professor, Christian Medical College, Vellore.
Third one, Auras and Diarrhea, Asta Jori, final year MBBS student, Maulana Azad Medical College.
The fourth winner, AIDS Break the Stigma, directed by Chandrasekhar Reddy Chinta, third year MBBS, MNR Medical College and Hospital.
So we will move on to the next category, micro short films.
The second prize goes to COVID Prevention Song, directed by Ankit Chandra, Senior Resident, AIMS, New Delhi.
The first place goes to Hairfall to Hairful, directed by Dr. Prabhakar, Associate Professor, Trichy SRM Medical College. Moving on to the next category, super short films.
The second prize goes to Cup for Change, Ms. Varsha Arnachalam, MBBS student, Mahatma Gandhi Medical College and Research Institute, Pondicherry.
The first place goes to The Prick, directed by Mr. Chandrahas Siripurapu, third year MBBS student, MNR Medical College.
So we'll move on to the next category, long short film. So the third prize goes to Medication Error, directed by Dr. Harish Naik, Assistant Professor, Karwar Institute of Medical Science, Karwar.
The second place goes to Right Feet, Right Deed, directed by Dr. Hamsavina, Professor, Siddhaganga Medical College and Research Institute, Tumukuru.
The first prize goes to Bins, directed by SVC Dinesh and Ahmad Wasir, second year MBBS student, Government Vellore Medical College, Vellore. So congratulations for the winners.
Congratulations everyone.
Thank you.
Thank you.
I now request the organizing secretary of MEDICOFF, Dr. Rohit, to deliver the vote of thanks.
Hi everyone. Here we are at the final stage of MEDICOFF 2022. First of all, I would like to thank our respected director Dr. Rakesh Agarwal and respected Dean Academic Dr. Pankaj Kundra for allowing us to conduct this event in this grand manner. Next, I would like to thank our respected Head of Department of Medical Education Dr. Jayaprakash Rajan, who helped me in each aspect of organizing this MEDICOFF 2022. Next, I would like to thank our respected NTTC Alumni Association Head Dr. Kadambari for supporting in conducting this MEDICOFF 2022 and other members of NTTC for giving their valuable opinion during the organizing the MEDICOFF 2022. Next, I would like to thank the external juries Mr. Nagavarman and Mr. Muttamil, who in spite of their busy schedule has agreed to come here and after seeing each movies individually with their patients gave their valuable comments, which is not only useful for the participants but also useful for the organizing committee also. Next, I would like to thank the members of organizing committee starting from third year MBBS students Jaydeep as well as Joseph, who prepared and gave us such a beautiful brochure in such a quick time. Next, I would like to thank the JRDA President Dr. Kalyana Prabhakaran and Vice Presidents Dr. Konuri Bhargavam and Dr. Hasta, and also the Recreational Secretary Dr. Nitish Praveen, who helped us in lot in circulating this brochure to various colleges across India as well as to the overseas also, and as a result we received 2 overseas entries, one from Malaysia and one from Singapore too, which made us very happy. Next, I would like to thank the other members of the committee, my co-PGs Dr. F.B. Mohammed and Dr. Deva and our SR Dr. Priyadarshini, who helped me in even the small doubts I had in conducting this MEDICOFF 2022. Next, I would like to thank the anchors Zahid, Ufia and JV Singh in anchoring such a beautiful manner. Next, I would like to thank the other staffs of NTTC as well as the office in charge and other staffs of the studio for helping us lot in conducting this MEDICOFF 2022. And next, I would like to thank our Department of Biochemistry for giving me a chance to conduct this event in this grand manner. Next, finally, I would like to thank the participants. Without you, this event is not possible. In spite of your busy schedule, you have given such a beautiful films that made us took a lot of time in choosing the best from the best of the films you have given. And finally, I would like to congrats all the prize winners of the MEDICOFF 2022 and I wish you best of luck to other participants for winning in future MEDICOFFs. And finally, I thank you all for this wonderful participation and it is a finally I am saying thank you all for this beautiful event and thank you.
Thank you all for your active participation in MEDICOFF 2022. We expect more participation in the upcoming MEDICOFF. See you all in MEDICOFF 2023.